I feel like I've outpaced him intellectually. Wait, how do you restart your iPhone? Is there like a hotkey to do this or what? I can just hold down the power button? Hold every button? Volume and power button. Hold power and upper volume. Oh. Okay. What happened to the Tree of Logic convo? I was playing Age of Empires 4 and she got banned from Twitch because in my chat she said whip them into shape or something. Unironically, she got banned from Twitch for that. So we're waiting to see when she gets unbanned. Yeah, I don't know. It's really stupid. She got banned while she was in my chat when it happened. Woman detected, opinion rejected. Jesus. Stupid as fuck. Okay.
Hey, how's it going?
Hey, hello, hello.
Hi, how are you?
I'm doing okay. Like 5 hours late for this, but I'm here.
It's okay. I was getting worried that you weren't going to respond eventually, but that's okay.
Wait, hello?
Oh, hi. Sorry about that.
Hello?
Hello? Uh-oh.
Hello? Can you hear me?
Oh, I can hear you now.
Okay, sorry.
That's okay.
I needed to make a physical adjustment. Okay. All right. Well, hey, do you want to introduce yourself so people know who you are and everything?
Yeah,
as
sure.
much as you're comfortable, also, yeah.
Yeah, I'll try not to dox myself too hard. So my professional background, hi, you can call me Joe. I'm a professional nurse by training. I've been a behavioral support officer. I've been a recreational therapist, and I've studied under the Canadian healthcare system. So that's my basic understanding of how the healthcare system works.
Okay.
Now, I also work very carefully in research as well, specifically nursing research.
Okay.
Especially on technological improvements. I've worked in the emergency rooms, I've worked in medicine, and I've worked in mental health crisis situations.
Gotcha.
I've worked in mental health intake, and I've worked in mental health, like inpatient medicine as well, for longer stay patients.
Okay.
So I wanted to go on and kind of try to dispel a little bit of the information regarding like why we send mental health workers and why we send police workers into these situations and why we perform the way we do as a structural kind of example.
Okay.
Because I think there's a lot of like different things that people think cops do and think nurses do and think physicians do. And understanding how it all fits together is really hard sometimes, especially for people who don't really have a lot of exposure to the system, especially young people, who I know your audience is a lot younger. And their exposure to the medical system might have been very cursory, or it may have been only as just one or two people kind of with small interactions.
Sure.
All right. So if you have any questions throughout this conversation, I'd love for you to ask them. I'd love to try to dispel any of the myths that may exist as to why we do it in Canada specifically. I'll try to do my best for the States. Your laws are actually very similar to ours in a lot of the different respects we have. The one caveat is that the cost is different for the end consumer. The end consumer will pay a higher premium for their health emergencies and health crises than we will in Canada. Usually it's free. But I believe that both of these structures function almost identically with how we treat medical conditions and how we would treat inpatient conditions.
Gotcha. Okay. That was going to be the first big question is how similar do you think this is between the US and Canada? Yeah? My understanding is... go ahead.
Our privacy laws are very, very similar. PHIPAA and HIPAA are the laws that are different. So we go under PHIPAA, you guys go under HIPAA.
Okay.
From a hospital structure perspective, the code systems are the same. Most medical inpatients are the same. And even my licensure is almost identical, with the caveat that some of the units they use are different. So, for example, like blood glucose is slightly different in Canada versus the US. You guys use, I think, grams per deciliter. I think we use millimoles per liter, which is slightly different. So reference ranges are slightly off. So if you say like 13 might mean different thing to me than it means to you.
Gotcha. Okay.
But other than that, there's not too much of a difference, especially with emergency departments. The one problem and caveat that I would say with that is the hesitancy that a patient would have to undergo mental health treatment, especially at cost. Yeah.
Okay, gotcha. Do you mind me asking, what is your current profession? Where do you work right now? Not where do you work, but like what field or what do you do right now?
Sure. Right now I do inpatient medicine. I do inpatient mental health as well. I'm actually a resource nurse at the hospital that I work at. I work at a tertiary hospital. It's a community hospital. It's not a teaching hospital. So we don't do a lot of experimentation. We do based on what other people experiment on. And then we try to adopt the best practices that we've developed in mostly the Toronto area, because the hospital system in Toronto is the one that most of us base of our systems on in Canada.
Gotcha.
Because there's like 6 or 7 hospitals right there. They all kind of work together. They develop research. We try to utilize it in our communities, tailor it to our communities because we have slightly different populations and intakes and things like that. And we try to develop it and improve on that.
Okay.
All right. So mental health and why do we respond in the way that we do? I know that this was kind of a hot button issue, and a lot of people want to see more of social work kind of involved within the healthcare system and involved in first response. And I think that I'm mostly in the agreement of your side of it, where police are the best responders for the first response. And that's specifically because of how we integrate our coding system into it, how much risk there is to practitioners, and a whole bunch of other stuff. And we can go through the list and go through a whole bunch of different stuff on them if you like. And I'd love for you to ask questions as we go.
Sure. I'll probably, I guess since if we're mostly in agreement, I'll play devil's advocate and try to respond to the other side.
I would love to. I've been fighting your chat for about 3 hours, so I'm already kind of
Oh, Jesus. Going. Okay.
Yeah. No, I was just bored and having fun.
What, like today you were, or like on the day?
Yeah, today. I was just waiting around for you. I wasn't sure if you were going to be indisposed or not.
Gotcha. Okay. Well, I guess, so I guess the general argument is that dealing with somebody that is having a mental health crisis, like the appropriate protocol for what's the best way to subdue them in a way that reduces the amount of harm both to them and to other people, seems to be a relatively unique thing compared to dealing with somebody that we might say is either having a drug crisis or is otherwise sane but still aggressive. So I think the call is that a social worker would be more equipped to deal with people having a mental health crisis than a police officer who's just looking to fight crackheads or, subdue somebody.
So, if I may, drug crises are mental health crises. I would argue that these are one and the same, and that mental health is addictions are part of mental health, just as mental health is part of addictions. So both of those are important caveats. Now, what exactly is the difference between these two circumstances? A mental health crisis where a person is deemed violent and a person who is deemed violent who is deemed mentally fully capacitated. My question back to you for a person who asked this question, because I know you're playing devil's advocate regarding this, is what is the difference? What is the discernible difference there?
So I think I can't do it anymore. Fuck. So the discernible difference. So here. Okay, I'm curious to hear your take on this. Okay, because I only have so much life experience. Okay, so the discernible difference seems to be that this is from my point of view. I just want your feedback and input on this. Okay, because I'm curious. Because I might be totally warped. Okay, the impression that I get is that mentally ill people that have severe, like, I don't know if I'd say like a psychotic break or somebody that's being like acting out in a violent manner. I think that these people tend to be isolated to either certain classes or in like the upper middle class, they're isolated to certain institutions. So I think a lot of people don't know what it's like to have an experience of like an adult or like an older child, especially older male children, having a full-blown mental crisis. So I think the impression is when you hear mental health crisis, you think somebody's in bed, they're very sad, they might want to kill themselves, or somebody's just like very upset and they're like shouting in the living room. So like if we just had a social worker to talk them down, like they could do that really well, whereas a police is just going to come, busting heads. And my impression is that if you had a little bit more experience, and I am empathetic towards people that have these problems, right? Obviously it sucks. Everything about this sucks.
Absolutely.
Yeah. But if you've had experience firsthand with like low functioning autistic people, especially men, especially older children that are male, or if you've had experience somebody having a mental health break, sometimes like it comes down to like you have to have a big guy there to physically restrain them or drug them or multiple people to do it. And I don't know if there's a shortcut around that. I don't know if any amount of talking down, like if it was a mental health crisis, you could just be talked down from. Mom and dad could do it. You would need to call somebody, That's
and believe it or not, this is exactly the kind of conversations that I often have with my patients. And this is often the conversation that I will have with patients' families. My specific frame of reference especially is arguably even harder because I mostly deal with patients in dementia, which is even more difficult. Which is even more difficult because they have already been diagnosed with a mental health condition, and then dementia compounds the issue. Yeah. Because it is like, is it the mental health issue? Is it dementia? Is it symptoms of both? Is it one? Is it the other? How do we treat them different? Right?
And oftentimes, if you can correct me wrong, but I believe that things like dementia or things like Alzheimer's disease, especially, these will run in tandem with other things as well, or can cause other things. So somebody that has Alzheimer's disease.
There's like 6 or 7 kinds of Alzheimer's disease, and each one performs slightly differently as well. Like Pick's disease is a certain specific kind of Alzheimer's disease that affects emotional functioning first. And it's actually very difficult to detect because most people just think they're effing crazy. Yeah. And that they're just having like emotional issues. And often Pick's disease shows very, very early, like we're talking like mid 40s, 50s. And you'll see that somebody is just violent or aggressive or potentially just like angry towards other people. And you won't be able to determine that it's actually dementia unless you would do like a proper MRI of their brain. That's just not standard practice because it's very expensive to do MRIs. So all of that compounds into these issues where mental health isn't really taken that seriously. But it's not just that, it's that we don't understand how to respond to mental health and why we respond to mental health in the way that we do. I'm curious, are you streaming this right now, or are we just
I'm sorry. Yeah, I'm sorry. Holy fuck, I should have said that. Sorry, I turned my stream and everything. Yeah, we're streaming.
Gotcha. Yeah, okay, cool. I was just curious on that. My apologies. All right, so let's continue on this line. So with responding to the physical acuity, you're exactly right in this, and this is why I was having these conversations with some of your chatters and groups on Discord. We respond with police because whether or not we like it or not, let's say we get a call and it's bizarre behavior, right? The person is acting bizarrely. This is a triage diagnosis that we can render at the hospital, but it is not an official medical diagnosis because bizarre behavior doesn't really tell you anything. It just says what they're in for, right? Bizarre behavior can then be determined by the best person to determine that is a psychiatrist. So the way you guys work and the way we work too is that physicians can do everything a nurse can with two caveats. The caveats are the renderance of a diagnosis and the fulfilling of a prescription.
Wait, hold
And
on.
both
Let
of these-
me back that up. I think, did
Sure,
you mean
go
to
ahead.
say nurses can do everything physicians can except for those two things? Or did you mean to
Except
say?
for those two things,
Yeah,
yes,
okay,
my
gotcha.
apologies.
No, that's
yeah.
okay. Just making sure it was
So,
okay.
yeah, so like a doctor can deliver an IM injection, they can do all this kind of stuff, but nurses can do all of this stuff as well, with the exceptions of a nurse cannot tell you a diagnosis. So let's say a nurse gets an image back that says, like, this dude has cancer or whatever, right? Even if I know a patient has cancer, I cannot tell the patient that they have cancer. That's the role of the physician, and it's a legal liability to me if I was to tell a patient that they had cancer, even if I am well aware that there's a big tumor on the x-ray, we're 99% sure it's cancer, the histology came back positive, all that stuff is all coalesced in like a diagnosis of cancer. And I know for a fact that the doctor's coming over at 3 p.m. to say they have cancer, and they're like, hey, did you get my test results? And I'm like, sorry, you just have to go over with the doctor.
Yeah,
Can't say anything.
something real quick that I want to add to that.
Go for it.
I've seen some people in the I'm always so scared to bring up the coronavirus because I don't know if you're going to say some crazy shit. I don't think
I've
you would.
worked on the COVID ward, so
Okay, yeah. So
Yeah.
there were sometimes conspiracies go around where I hear people will say things like, oh yeah, like I saw my MRI, like they hung it up or whatever. They hung up the X-ray next to me. I could see it and they wouldn't even tell me because they were trying to hide what was going on. They didn't want me to know or whatever. I've heard
Look,
people
if you can
use
read
that
an
language
MRI
before. Yeah.
If you can read an MRI, cool. But like honestly, they're freaking hard to read. I
Sure.
don't know if you can really realistically fully discern things from looking at an MRI without a trained eye. Even most physicians, even in their own specialty, often consult radiology specifically because it is so hard to determine specifically certain things or certain conditions.
Yeah.
Some things like a pulmonary embolism, for example, on a chest X-ray will show up, but it's hard to see unless you really have a trained eye for it.
Borrowing
and then
from a little bit of real life and a little bit of the show House. I think I've heard it
Alright.
said often that like doctors don't like to test for things unless there's some symptom, because if you just start doing a bunch of scans, it's easy to like read tea leaves and either see something that doesn't exist or like invent stuff, because it's just not like a technology where like, oh, that's absolutely what a pulmonary embolism is. We see it. It looks like the textbook. Exactly. There's a lot of like fuzzy shit you don't know all the time or whatever.
There is a lot of fuzzy shit. So even within that discernment, I wanted to say a little bit about that. I have 2 degrees in health studies. One is in kinesiology, the other is in nursing. In my first degree, we went over a lot about anatomical features and structures of normal human beings. And only 30% of human beings actually show normal anatomical presentation.
Yeah.
Many people will have very weird malformations that you would not normally see on specific things. For example, on one of the cadavers that I worked on a long time ago, I believe they had a vessel that did not show up on any normal like anatomical structures. I think their radius like pierced a specific part of their musculature. And it was super, super rare to have something like that happen, but that patient had it. And a lot of people have like, there's mirror imaging anatomical differences. There's so much that goes into a medical image regarding that, but that's kind of neither here nor there.
But good to know, I think, is good, because a lot of people, I was reading about this in relation to blood work, because some of the reference ranges for some of our stats are so
They're very wide.
Yeah,
Yes,
they're
absolutely.
huge. I'm like, what?
They're very, very wide.
And
so
then I've heard that it's like,
oh,
go ahead.
Go ahead, sorry.
Well, I was going to say on that point, like I've heard that like it's really bad as a layman to just get blood work done and then to try to read your results and be like, oh my God, like even though this is in reference range, like this is kind of low or this is kind of bad. It's like, if you're not symptomatic of anything, you probably shouldn't be worried about it, unless you've got like some hidden condition. Like, but in general, it's not good to just try to read something, see it on the lower end of the reference range, and be like, oh, this is unhealthy. I know like a lot of guys are doing this now with like low testosterone. They're like, what? It's only 300, 400? Like, oh my God, I need TRT immediately. I'm super low T, even though they're completely asymptomatic of being low T. Yeah.
Yeah, so all of this kind of paints a picture of what we're seeing inside your body. To a certain degree, we can determine things, but even different things that we do when collecting your blood sample, for example, will have different effects on how your blood ranges are affected. So let's say we look at lactate, for example. Lactate's one of the metabolic byproducts of sugar being anaerobically deoxygenated, I forget the exact term, I apologize on that. But lactate builds up in your blood when there's like lack of blood flow to something. And your lactate kind of gets rinsed out so like if you tourniquet a patient, their veins kind of bulge up because their veins are like restricted on their blood flow. But then if you take a lactate after like 5 minutes of a tourniquet being on them, it's going to be through the roof because you have all this lactate that's building up in their veins trying to get out.
Sure.
And you're going to have a false positive because you had the tourniquet on too long. But if that's the only snapshot of blood that you get, you might think, oh shit, this guy's a metabolic disease. What am I doing here? And you may actually treat something that's not there. So you can have false positive, false negative, and all that's based on the imaging that you would actually get from the patient. And part of working in emergency departments is figuring out the bad stuff that it can be and trying to prove that it isn't those things so that you can send them up to a medicine floor if they're really sick or send them home if they're not. To determine exactly what the course of treatment is for that patient. So let's say a patient comes in and they are in like crazy abdominal pain. You don't actually know what the hell's wrong with them. Not even close, right? It could be appendicitis, it could be pancreatitis, it could be hepatic obstruction. You take extra stuff to actually learn what it is, right? And taking all that information, you can say like, man, this guy's pancreatic enzymes are through the roof. We need to admit this patient. Or everything's coming back clean. It's not pancreatitis. Love it. Great stuff. So we have these tests to kind of determine the really big bad stuff, but it could be that the pancreatic enzymes are elevated because of a gallbladder issue, and that is blocking the common bile duct because the pancreas and the bile duct and a whole bunch of different stuff empty out together. And if the gallstones are in the wrong spot, we won't know that until we do like a proper X-ray of the abdomen, or sorry, probably a CT of the abdomen to actually see something like that.
One thing that I, not to shut on your profession or anything, but when I get into arguments with people about,
it's more fun.
No, yeah, we get into arguments a lot related to things like psychology is like kind of be a hot topic sometimes. And something that I notice, or I feel personally, like it's a big misconception is people will look at stuff like psychology and they'll be like, oh, these are social sciences. These are soft sciences. You know, this isn't like medicine or, you know, like what physicians do. This is way more rock science. Like there's a lot of human input in a lot of different stages of like the medicine process. And I think people aren't aware of that all the time. So like on kind of what you're talking about here in terms of forming a diagnosis, like I'm gonna guess here, but I'm pretty sure that when you're trying to figure out what's wrong with a patient, like sometimes some of the most important part of that diagnostic process is just asking a patient if like their condition has changed at all over the past like couple weeks. Like, have you always had this pain, or is this something new, or did you do something that like sometimes these questions are more important than like any number of diagnostic tests you can run just because you don't know all the time.
As unfortunate as it is, you are correct. It sucks because you want to have this objective lens by which you can view every patient, but unfortunately the subjectivity of each person's diagnosis can be very different.
Yeah.
Like for example, let's say somebody comes in with chest pain. I've had patients come in with 10 out of 10 chest pain and 1 out of 10 chest pain, and they had the exact same heart attack. The exact same. Like the same area, the same blockage, everything to a T. So patient's subjective presentation of I am in chest pain doesn't really tell you the full story there. It's exactly the same presentation, and each person's going to feel it a little bit differently. I've had patients calmly tell me they're in no pain whatsoever and they have a pulmonary embolism. And then I've had patients who couldn't breathe with the same thing. And each of these gradations, it's not to say that these are necessarily in the different locations. They may be. But it's more about how the patient subjectively feels and what the patient needs in that situation. We don't treat a patient with pain medications if they're not in pain, or at least we try to avoid it if we can. We can assume that certain people are going to be in pain, let's say after appendicitis. They're going to be in a little bit of pain after surgery. We're probably going to give them something to make sure that they're not actively in pain so they don't yell at us like, why the hell did you give me pain medications? Because we can narrowly, or at least somewhat, describe somebody's conditions if we know their trajectory, right? Like if we take your appendix out, we know you're probably going to be in pain. We know you're probably going to need something a little stronger than Tylenol. So we're going to start you off with that. And if you're in 0 out of 10 pain, we might take that off and switch to Tylenol. Then we might go to nothing. And it's all based on how much pain they're actually presenting with. The healing itself is different again, right? It could be that those surgical sutures are really good. They're not so good. They're infected. They're not. They have a fever. They don't. All that stuff goes into the whole picture of what do we do to treat this patient? A lot of medicines, unfortunately, don't treat diseases. They treat symptoms. But that's not always the case depending on the medication.
Sure.
Yeah. So back to the discussion at hand, I guess, which is why do we respond with police to a mental health crisis? And why the hell don't people... I don't know. I think we're very much in agreement on it, but it's because of the safety thing. It is the fact that we don't know if somebody has command, auditory, tactile hallucinations that may cause them to be homicidal, suicidal, anything like that. But what we want to quash and squish down as quickly as possible is the risk to themselves and others.
Sure.
That's really the punchline, is safety first. And if that means restraining somebody physically, absolutely. But nurses and social workers aren't trained to do so. And if they were given the liability to do so, we're kind of building cops by another name.
That was kind of my feeling, is that like, you ever see the movie Armageddon? Is that...
I have, yes. Why did we build astronauts? Why didn't we train astronauts to use mining equipment as opposed to miners to use the astronauts?
Yeah,
and
exactly.
The director said, "Fuck you." Yeah.
Yeah, it's like the same question.
Yeah, exactly.
Yeah, like we can let's take social workers and let's give them all the proper training to do restraints on how to subdue somebody, on how to utilize non-lethal weapons. It's like, okay, well, there's two parts of that that's funny. One is kind of on the surface funny, but the other is a little bit funnier on a deeper level. The first part is that like you're building a cop, essentially, again, right? Is kind of what you're doing.
Yes.
But the second more deeper thing is that like, were social workers to have all of this training, would they not build up the same stigma of cops over time then? Would that not just be a thing that would happen?
That would also be the risk, but it's also, let's say we don't properly tool them. It's also about the tools we send into the situation. Do we send somebody as a group of two, like cops do? They perform in groups of two and are able to squash situations very quickly, and there's two armed persons responding to a situation. Do we send one cop who is armed and a crisis worker who is not, which we are trialing in Canada, by the way? We'll get back to you on whether that's effective or not. We've also tried to train cops to be crisis workers, which we actually did trial in Canada for a couple of years, but it was deemed pretty ineffective because most of the time the responses were identical in the way that cops were able to respond to the things. Now, that's not to say that they wouldn't be able to necessarily be a little bit kinder, a little bit less aggressive, and that's nice, but it's not really effective, if that makes any sense.
Sure.
It's still begging the question of, well, whether we get the person there like nicely or not, we still give them the same diagnosis, we still give them the same treatment, and we basically just spent a lot of money and resources on things that we kind of didn't need to.
I wish that there was like, I wish there was more video footage in terms of like police interactions with people, because I can.
You don't see the good ones. You don't see the good ones. That's the punchline.
Because I was gonna say, like, based on like when you see like certain videos, I am incredibly sympathetic towards people that are like, because like there are horrible videos where cops are out to a scene. I want to say they shot and killed this guy. It was a homeless guy outside. I think they shot him with beanbags first, and then eventually shoot and kill him. And I think the guy was like standing outside in his underwear, and you could tell looking at the guy, like he's not armed, and there's some kind of mental issue going on here. Like this is not like a burglar or an arsonist or something.
Sure.
Like, this is
absolutely.
And it's like, fuck, like you see like cops like shoot and kill a person like that, and it's like, really? Is that, you know? So I can sympathize in cases there, but there are a lot of videos that nobody watches or nobody sees or whatever, where cops do show up and they actually handle like the de-escalation part, the responsible engagement of force, or like the use of force continuum. Like they handle it really well. But I understand why, you know, in a nation of 330 million plus however many are up in Canada, it's very easy that, you know, you could get one video a day of a bad interaction, and statistically it's still not a bad thing, but it's enough to cause a huge scare, right? You're like, oh my God, like cops are showing up and just busting head. That was actually, oh my God, that was somebody, I think Vosh said it on that panel a few days ago that really got me triggered. I think that's why I went on, is because like a wellness check is when a cop shows up and just busts your door down and screams, "This is the police." And it's like, fuck, like that's not what a wellness check is. Like that's not what the average wellness check looks like. Yeah.
Even people in your chat were having difficulty with this discernment. Wellness check versus needing to bust down the door for whatever reason. A wellness check just means that somebody is saying like, hey, I want you to just check in on somebody. I might be gone for a week and I haven't heard my grandma responding to their calls. It's been like 2 days. Now, the question then becomes, who do you want at the door and what do you want their capacity to be? Do you want them to be able to break down the door? Do you want them to not be able to break down the door? Do you want them to be able to come in anyway if somebody says to fuck off? Because realistically, a person at the door can always say like, look, I'm busy, or, you know, I'm in the shower, or go away, I don't care for it. And realistically, if you're doing a wellness check, or if there's a funky smell even, you want to have somebody be able to bust down the door and be able to like deal with the body in that situation.
Or even sometimes if there's not, you know, like if you're doing a wellness check on somebody that you haven't heard from in 2 days, if it's like grandma or grandpa, you know, it might be the case, and it's unfathomable to us, well, I don't know how old you are, but you don't sound like you're in your 60s or 70s, right? That somebody could
No.
legitimately fall and not be able to, they don't have the musculature anymore.
I've had cases like this where people have been on the floor for 4+ days.
Yes, and nobody even thinks it's a possibility. Yeah, and you want somebody to show up and like it. Yeah, I feel like people don't understand sometimes when you call for a wellness check. You know, it's like you're not calling because you're just kind of concerned for somebody. Like a wellness check is like a call of last resort. Like you don't have anybody that can get to somebody. Somebody might be dead or dying. You want somebody to show up that can bust down a door if they need to make sure that, you know, grandma's not dying on the floor or that somebody hasn't hurt themselves or somebody else.
Or it could even be that there is a crime that has taken place and there's a person chained up in the basement. That's not unheard of. These things have happened before many times. And as terrible as it is to respond with such an enormous amount of force that the police are available to render to a person, they very infrequently do so. The goal of it is for safety, that a person is able to respond in kind with a large amount of force in situations where a crisis worker would be unable or incapacitated by the person they're responding to. And I think that that's a risk that we always run when we're responding to house calls like this.
Yeah. Oh, oh, fuck. I might end up saying things that you've emailed me. I don't remember what exactly you told me anymore, because I had a few
No, that's okay. Don't worry about it.
Somebody emailed me with a lot of information relating to these things as well. And something I didn't even think of is this. I don't remember what this guy said he worked at, but he said that don't ever let anybody tell you that when you do not call the police. Nobody calls the police unless you're actually dialing the police department. When you dial 911, you are contacting a dispatcher, and they are making the call on whether or not police services are appropriate or somebody else.
That is correct. So they're determining if you want to use the police department, if you want to use emergency department, if you want to use cops, if you want to use crisis workers. But these kind of crisis workers generally don't function out of large metropolitan areas as frequently. It's far more efficient to bring a cop into a centralized bureaucracy like a hospital, where we can control things like the environment and be able to render mental health services for these people.
Yeah.
It also speaks to the centralization of the ability of us to respond to calls as well. It's inefficient to send a large amount of trained professionals to things that they don't need to be sent to. For example, like let's say we're sending cops out to mental health checks, and like 40% of the time we need to bring them in for whatever reason. It's inefficient to then send a crisis worker with them to do like a 35-minute sit down, have them drive to, have them drive from, when they could see 12 or 13 patients all brought into them by the police, and them doing the heavy work and the lifting of bringing them into a centralized bureaucracy where we can control the environment, we can get them medications and emergencies, we can prevent them from causing harm to themselves or others. All these things are really important safety checks, and especially as a medical practitioner, we need to be responsible stewards of our patients at all times. It is our responsibility to take care of patients. It's on us if patients commit suicide in our care, and we need to be careful about those things. And it's on us if somebody harms themselves or others in our care, and we need to be aware of these considerations for mental health workers, and to understand that these are important caveats that we always need to keep in mind when responding to mental health crises. Now, when we speak to specifically crises, right, what is a crisis is also really difficult for people to pin down, I think. From your understanding, and I'm not meaning to call you out on this or anything, but what is a crisis? What would be deemed a crisis? And I think this is an important thing to talk about.
Yeah, so my understanding is that like a crisis is where you have a situation where somebody is either an imminent threat to themselves or somebody else, and the people in that vicinity aren't able to get that situation under control. I'd consider that a crisis.
Right, I would consider the same. Now, the question becomes in the more gray areas. What is bizarre behavior, so to speak, right? Is a person like depressed, for example, or just not eating? Are they not responding to verbal stimuli? Are they not responding to auditory stimuli? Are they responding strangely to certain things? And one of the most important things that I think people don't realize specifically about mental health crises is that these could have medical backings that you don't know until you get them to a hospital. Like, for example, the presentation of confusion. Let's say a person presents as confused. They may not be responding properly. They may not be verbalizing properly. They may not be able to interact with the world around them in an effective way. What do we then say about that patient? Are they sick from something? Are they having a kidney issue? They could be having a urinary tract infection that causes delirium. They could be showing early signs of dementia. They could be showing a psychotic break. But either way, in all of these cases, we need to do further testing to determine that. You or I don't know that until we've actually, run the gambit of the tests. We've drawn some blood, we've done some exams, we've done some tests, and then we're able to actually make a better determination. Is it in their head? Is it not? Are all our labs correct? Have we corrected for everything that it isn't, or determined what it is? And that's what I do in emergency medicine a lot, is determining what things aren't, not necessarily what things are. That's the role of the physician. But we have to prove things that it isn't first, right? And until we do that, we don't really know if they're at a risk themselves or others until we've gotten them processed within the hospital.
Sure.
Yeah.
Well, do you hear, I guess if you, is there anything else you heard that sticks out to you on the panel, or do you think I have a misunderstanding of anything related to this, or anything
I think
else?
that a lot of people within, I think that my biggest gripe with this entire thing is that people don't really understand why we respond to mental health in the way we do.
What do you mean by that? Expand on that.
Yeah. It's for safety. All things at all times are safety. Whether we like it or not, we want to try to prevent people from committing suicide, causing harm to themselves or others. Now, that usually means that we have to be a little bit heavy-handed, especially when it comes to what we allow for people to be able to do in mental health settings, what we allow for people to, how we respond to mental health crises, all these different things. And when we coalesce all that together, we can sometimes appear very callous towards a mental health condition. That a person may be in a kind of crisis situation, and they may say, like, look, I just need some kind of miracle with regards to this, that, or the other. There isn't necessarily a miracle cure, but we can work really hard on keeping you safe, keeping you out of harm's way, and keeping you healthy. But the harder parts are like family dynamics, things like that. You may be in a crisis from a family dynamic. That's not the role of medicine. Unfortunately, that's going to be more the role of social work. But even the determination of your need for social work is going to come at the behest of a medical practitioner. And that emergency medicine and medicine in general is going to be your best bet for those things.
Sure. One thing, you said you were a resource officer, so I imagine, did this involve some level of like physically restraining people, or?
So I'm a resource nurse. So what that means is I go everywhere in the hospital, from mental health to inpatient medicine to surgery, everything. I do almost everything at the hospital, even including emergency medicine. The one thing I don't do is ICU and babies, like infant and maternal care.
Gotcha. Okay.
So all of those things, at all times, you have to be aware of every patient's safety and mental health condition, right? At any point, a person could just be not eating as a result of like cyclothymia or like depressive disorder. And you have to treat that, right? You get people antidepressants, you get people treatment, you get people counseling, you get people education, you get people everything that they need to succeed and thrive, right? And all those things can be from a mental health condition. It can be from a medical condition. That's why you treat everything. That's why you screen for everything. But when it comes right down to it, the reason why I think we need to send cops to these situations, at least in the preliminary issue, why we respond to mental health crises or mental health requests or mental health, whatever we want to call it. The reason why we send cops is safety, because we don't know, we can't control the environment at a person's house. We can't control it in the hospital.
This is almost every social worker that's emailed me with firsthand experience has always said that if you are a social worker, like, you're not being called to the nice white picket fence gated communities. Some of the neighborhoods you're called to are very scary. And to show up in this area, you have no idea what the scene is going to be. And having a police officer there to just like secure an area or a pair to say like, hey, it's safe, do your thing. That a lot of social workers, people that have emailed said they would never go to a place if they didn't have police officers there with them.
Absolutely, and they're not trained for it. Because social workers generally are there to connect you to services that you don't really know exist and to support families with like calls and other support programs that they may need. So a social worker doesn't necessarily like intervene in a crisis, but they will be able to provide you with things like, let's say you're just food insecure. You're unable to provide for your children and it's very distressing for you, and you're just at your wit's end and you're starting to throw pots and pans around the house, and that's your psychotic break that you have. The social worker would be able to say like, okay, that's not the appropriate response, and we can maybe get you medications that help you prevent that. But really what you need is access to food programs in your state or your area or wherever you happen to be. And they would be able to connect you to those food resources, be able to check up on you, they'd be able to work your case, be able to make sure that those resources were effective and helpful in working towards, the improvement of health. Because that's all that health is. Health is the capacity to enact our lives in the way that we wish to do so. That's the goal of healthcare, and it should be the goal of healthcare at all times.
Yeah. Something.
However,
Oh, go ahead.
oh, go ahead. No, go ahead. Sorry.
I was going to say something else along those lines. This is more of a general complaint about people's perception of medicine. I heard a really good post on a doctor complaining about this. Is people have a fundamental misunderstanding sometimes of medicine, and that when you go to a hospital or when you do anything involving medicine, all medicine does is it makes it so you're not dying anymore, but it can't actually make you healthy. It's like the goal of like any treating a disease is to either get rid of a disease or to restore like maybe an organ of functionality or whatever, but it's not going to like improve like the health of a person in ways that lifestyle changes or other things can. And I've seen complaints before where people will say things like, oh, all doctors want to do is give you drugs and blah, 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 blah. And it's like, okay, yeah, but when somebody comes into your office and they're massively overweight, they don't exercise, they smoke, they do all these things, there's nothing you can really do for that person. There is no medication to improve somebody's lifestyle. All you can do is treat an underlying condition or symptom, and that's really all that can happen at the hospital. There's not really room for anything more, say for like physical therapy or something kind of like unique like that. Yeah,
I agree, but as strange as it is, the hospital in its structure actually do these things. You just don't realize it because it's all the stuff that you don't really take into account as the medicine. They give you 3 square meals a day, for example. You eating 3 square meals a day is a really important part to enact health outcomes. Getting the right amount of protein. All your meals are provided by a dietitian. Everyone hates hospital food, but it's actually very nutritious when it comes right down to it.
Oh, sure. While you're there, yeah.
Yeah, exactly. While you're there, they'll be able to feed you 3 square meals a day of nutritious stuff. And that might actually be the biggest problem that you're having, is that you're just not getting the right amount of vitamins when it comes right down to it. That could be at least a part of it. It could be that you're not getting enough physical therapy, and the physiotherapist will see you every day and get you up and walking and moving around and stretching and doing all these things that you need to be able to do to enact your what we call activities of daily living. Being able to cook and clean and go to the grocery store for yourself, kind of thing. And the whole goal of the hospital is to control the environment in such a way that realistically, if you're doing the things as we do them in the hospital, giving the medications on time, giving them at the right times, in the right amounts, with the right amount of food, and the right amount of social supports and things there, you're supposed to take that with you as the goal and say like, wow, I got better on this. I should keep it going at least a little bit.
Sure. Yeah. All right. Well, anything else?
That was probably a quicker conversation than I was expecting, but it was been fun, honestly.
Okay, cool. Well, hey, if anything ever comes up and you think either I'm super wrong or somebody says something dumb, or you can provide input, feel free to always shoot me.
I would love to shoot you an invite over some more input, especially on healthcare stuff. That's my specialty. I'm not going to weigh in on shit like the legal stuff or anything, because it's not really my area of expertise. No, that's all everyone's talking about right now with the Rittenhouse case, but I think it's pretty cut and dry.
Wait, what stuff?
Oh, like the Rittenhouse thing is all anyone's talking about in politics in the last week. I don't really like to weigh in on stuff like that. I usually just like to let things run their course, because realistically, I'm not an expert in that stuff.
Oh, sure. Okay. I didn't know if that tied into something medical. I'm sorry. I got confused.
Oh, no, it doesn't. Sorry.
Gotcha,
my apologies. My area of expertise is really only medical. So
Okay.
as unfortunate as it is, I could talk about it, but realistically, I'm not an expert on it.
Sure. Gotcha. Okay.
Yeah.
All right. Well, hey, thanks a lot. I appreciate it. And let me know if anything else ever comes up. Yeah.
Absolutely. I'll be around.
All right. Have fun. I'll see you later.
Thanks. Bye-bye.
Imagine being a male nurse, guys. Fucking got him. Okay, sorry. So after... why do I say sorry? I'm not apologizing, you fucking losers. After I did my one panel thing, sometimes I get people that email me, like social workers and stuff. So yeah, I said if anyone want to come on and chat, they can come on and chat. So there were 2 people that came on to chat. Yeah. Oh no, Your Movie Sucks did a Dune review. Did he say it was a 10 out of 10? An amazing movie? Are we burning the bridge? How do I say his rate? Oh, he gave it a... Oh, he gave it a 6 out of 10. Oh, vindication. Oh no, chat is losing it. Oh no. Oh no! What did you give it? I don't know, like a 5 or 6. It wasn't a bad movie. It was just kind of boring and nothing happened. It's really long. That's all I would say. You said it was awful? Did I ever say it was awful? Okay, if I said it was awful, I was wrong. That's not the impression I'm gonna give. I feel like I said multiple times. It's not that it was like horrible. It was just kind of boring and like nothing really happens. I like the music a lot, and I guess like the action was okay, but it was boring and really long. Okay. Okay. Social worker number 2, inbound, and then after that we might talk to one more if she's still awake.
Hey there.
Hello.
Hi. My name's Ben. We were talking on the old on the email, and I appreciate you responding. Your email etiquette is great.
Uh-oh.
And yeah, just talking about crisis work stuff and potentially other things if you wanted to. But yeah, I don't know where the best spot to jump in would be.
Well, why did you email me in the first place?
I emailed you because I was listening to the conversation, and I hate to say I'm a fan of yours.
Okay.
It was a little hard to listen to, though, because it sounded like a bunch of folks who were doing their best guessing, and everybody was guessing really good. But ultimately, it was kind of like missing the point. It's like, that's just not really what it looks like. And he had some strong points, but, just kind of quick background. I've worked in mental health for about 12 years.
Okay.
Been doing drug and alcohol counseling the past 5. Went to grad school, and somewhere in that chunk of time of the past 12 years, I've done crisis responding work for about 3 years. And that has typically been with folks 17 and under, though I work alongside a team, totally different organizations, but there's another team that does 18 and up.
Jeez. Okay, wait. So let me understand. You do drug and alcohol counseling for 17 and under?
Oh, sorry. Well, yeah. So drug and alcohol, 17 and under, but therapy services for adults. So I'm something called dual diagnosis.
Okay.
And I suppose I'll do therapy with kids if they come my way. I kind of prefer 14 and up for myself. And yeah, but the crisis response that I do specifically is for 17 and under. And that's like on top of the other duties. That's like a separate thing that you can do if you want to.
Gotcha. Okay.
Yeah.
Well, where do you want to start as the expert?
Sure. So the part that got me was nobody mentioned anything about non-emergency police.
Okay.
And maybe that was intentional, and I tried to sort of listen back to it, but there wasn't a whole lot about like non-emergency police.
Nope, I don't believe anybody brought any of that up.
Yeah, so a lot of folks call for non-emergency police, for non-emergency things. And I tried to get some good data on this, and I just couldn't. The best I could sort of find, like, nationally was sort of this idea that, like, about 30 or 40% of calls that come in through 911 are non-emergency. And like you just mentioned in the last thing, the dispatcher will sort of, do that.
Were you the one that told me that?
I don't think I was. I didn't actually give you much info.
Oh, okay, gotcha.
Like,
there are so many. Every time I have these conversations, like so many experts like will email me in their field to give me like their feedback. That's why my like position changes over time on things. So I get people like you will email me, and yeah, somebody emailed me, and that was their line at the end. They were like, "Hey, when you call 911, don't ever let anybody say that you're calling the police. When you call 911, what you're actually getting is a dispatcher."
Yeah, which was perfect, which was so helpful to hear. I was like, hell yeah.
Yeah, and I didn't even think of that at the time. I was so dumb. The email was, also, he said the only phone number available is the cops, which is dumb because 911 doesn't call a cop. It calls an emergency dispatcher who is then qualified to dispatch the correct emergency or non-emergency services. So what you're talking about, the non-emergency thing, yeah?
Right, exactly that. So, and just kind of explaining a little bit what a crisis call is this going to be like too rough to hear it from the kid's perspective? Is that kind of too far off your point? I have a sense of what adult calls look like as well.
No, you can, whatever we're here.
Yeah, I just wanted to run that down real quick.
Go for it.
So for the most part, crisis calls are usually pretty boring. Like it will be something like you get a call and it'll be like, hey, my son or daughter, they're beating the crap out of the house. They're kicking the crap out of their siblings. We have a rough time. And here's where your strong point came in. That was awesome. We say, okay, well, are they physically violent? Are they armed? Anything like that? Because if so, please hang up and call the cops. And then when they say like, no, they don't have a weapon or anything, they're just really escalated, or they were escalated early, but they're starting to calm down, and we're kind of worried about what's going to happen. That's when we kind of jump in and we say like, okay, we'll try to talk to them or whatever. They might refuse over the phone, or things are too hot. So then we'll show up in person and kind of try to talk them down a little bit.
Okay.
Yeah.
Okay.
And I guess would it be helpful to kind of like identify like what an intervention for that might be?
Yeah, go for it.
Yeah, so intervention might just be like, what do we need to get through the night? It's very short-sighted. It's not like services.
Or actually, wait, let me back up.
Yeah.
I'm sorry, this is a good question. So in a situation where, let's say you hypothetically get a call, and it is just like, we have like an older child who's having problems. Say it's only a mother in the household, so they don't know if they can get, if you were to show up, but the child doesn't have any weapons. They're not like ultra physically destructive, just like something more than rambunctious, but not like lethal. Okay, something in between that.
Yeah.
Right? Would you bring normally like a police officer to those situations, or would you just show up as one social worker? Yeah.
We would show up and we would call the police if we needed to, if it sort of escalated from there.
Gotcha. Okay.
And the big point is like, and I have been trained in doing restraints. It is not a part of this job. I don't like it. It's a bit superfluous, and fortunately, I haven't really had to use restraints. But there, in systems of care, there's something called like a subacute facility, which is what you might think of as like I don't know, like your typical movie mental health hospital where the orderlies are jumping on folks and all that.
Sure.
Obviously, they don't do that. They use, approved holds, and I've been trained on those. And honestly, I've only ever been a part of one hold, because that program was like next to ours. But we don't do holds. We don't do any of that stuff. The big training is just about like getting out of there. Like, how can you put a door between you and the person who's sort of like threatening, and then calling the police pretty quickly, letting them know that you're a crisis responder. And I think that that's sort of a piece that was maybe missed because nobody knew about it, that like we talk to each other like agencies. Like police are going to respond more quickly to a crisis worker than they might with somebody else.
Sure.
Because, we're kind of doing the same thing. And for what it's worth, hate to be a shitter here. I mean, I really like the police in our town. They've been pretty nice and professional and do a great job. But I live in a very white place, and that can also be why crisis services can be as successful as they are. Just to name that out loud, I guess. Yeah. So I think the other thing that was sort of missed, which much about like budgeting, like the idea of like the biggest mistake that people make in budgeting is they don't ever anticipate making more money. Like they just like, oh, I'm going to make $15 an hour forever.
Are you talking about like for individuals?
Yeah, for individuals. Like when an individual makes a budget, there's sort of a sense of like a mistake people can make is they don't plan on like, well, 4 or 5 years from now, you're going to be making quite a bit more money than you're making now.
That's interesting. I'm sure there are ways where that pops up. But I feel like the bigger problem, maybe this is just from what I've seen, is people are really bad about planning on making future money. And that they'll assume that they'll have more than they'll have. Or if they get a raise, they're very, very, very quick to up their bills, their monthly bills, onto whatever new financial raise they got, or even if the money is a temporary thing. So I've seen, and this is the worst thing about like working in these areas, because even if I was like working poor, I always had like a good education, right? The worst time for poor people is fucking April when that tax return money comes in. Yeah, motherfuckers, they won't even take $3,000 and go buy a TV. They'll take $3,000 and buy a new living room set and a TV that they have to make future payments on with money they don't have. I feel like people have a lot of problem with stuff like that. Ugh. But yeah, sorry, go ahead.
God damn, that's a good point. Well, shit. Well, where I was going to go with that is the idea that when we have these crisis services in place, there is a word of mouth factor. And so there is sort of like a calibration period where it's sort of like, well, who do I call? Like, how do I know if this rises to the level of 911 versus crisis worker versus just non-emergency police? And I sent you something in the Discord just now. This is the program that's sort of like, the darling of crisis workers. It's called Cahoots, based out of Eugene, Oregon. And you can kind of see like their utilization rates over time. where like I don't know, I guess it's on page 3. It sort of starts out as in 2014 they're getting just under 10,000 calls a year.
Oh, I'm seeing it. Yeah.
Right, by 2019, they're getting almost 25,000 calls.
Mm-hmm.
And they respond to about 20% of the police calls, well, so 17%. And on their data points, they also highlight that of those 24,000 calls, about 250 of them escalated to the police being involved.
Gotcha.
So as these services kind of get off the ground and people know that they exist, they tend to try to use them, which is another important thing. But just to bring it home, like that liability piece is everything. And there are things where if I had to be liable for them or my team had to be liable for them, like absolutely would not do it. Like it was way too much risky business.
Yeah.
Because especially with mental health, like that's your licensure on the line.
Sure.
That's not just getting in trouble. That's like, do you ever get to do this job again if you mess it up? Which, no thanks. That's kind of a bit too spicy.
Yeah. Yeah, and it's not losing your job sucks kind of, but it's not even the job loss that's the worst part. It's the fact that you've invested years in your life training for it that are now essentially completely worthless.
Right.
Yeah.
Exactly. I mean, geez Louise, I got a BA in psychology, and then I didn't get my master's degree for like 8 or 10 years later, something like that. And it's a pretty useless degree. Like for those who want to do it, go for it. Like if you want to pursue mental health, it's a degree in a related field. But as far as like job prospects, you can't do a whole lot with it.
Yeah.
Other than get a master's degree later, maybe you want to teach, maybe you want to do research, in which case you're fine. But a lot of folks who do that want to do counseling, and that's why they pursue that degree.
Sure.
So anyway, there's a piece of that one. And yeah, I'm trying to think if I forgot anything about that. Any other kind of questions about that stuff?
Not that I can think of, no.
Yeah. I think the other thing that I just wanted to bring up as well as I took some notes a little bit is I do not want to get into the Rittenhouse stuff. I'm kind of treating this as like folks can maybe recognize my voice, and so I don't want to say anything that I wouldn't be comfortable with everybody who knows me knowing. But you've kind of spoken to this idea with some of the Rittenhouse stuff coming out, and there's probably a better name for it, but I could sort of call it the sociopath trap, where we just sort of automatically assume that everybody is a sociopath.
Oh, yeah, sure.
Like, what are you going to do when you show up and you encounter the sociopath who's, like, ready to murder you?
Which is so annoying because the entire fucking body of psychology, I am not aware of any fucking large or small psych experiment or study that has ever been done that's like, we did this study and we found out at the end, wow, none of our subjects were influenced by this. Wow, all of our subjects were free-thinking, divinely inspired people, and we weren't able to influence them with these slightest social factors at all, right? Like, it's always completely the opposite. But anytime something happens, this person is like a divine, like 100% in control of their destiny, completely free will, the most evil, horrible person ever. It's very, very, very frustrating. Yeah.
And it may be the case that indeed somebody is like a sociopath, been diagnosed with antisocial personality disorder, doing very bad things. But it's sort of like, if that's the case, you got the math problem correct, but you used the wrong formula.
Sure.
Like, realistically, probably a lot more things are true. And I don't necessarily think it sort of behooves us as a society or individuals to just automatically assume that, like, nope, this person loves hurting people. And I want to be very clear, like, I'm not trying to defend Kyle Rittenhouse here. I'm not engaging in those subreddits. It's just, it's popped up.
And my guess would be, I don't even have the numbers in front of me, but my guess would be that it's probably still like a single-digit percentage of ASPD people that actually act out like in outwardly violent ways that are like committing crimes and stuff. I doubt it's like 80% of people with ASPD are out there like murdering people, because we'd see these numbers.
Because if you do that, you're in prison.
Yeah.
Like, it sort of works itself out. And, I've had the opportunity to work with folks in prison and all that stuff. This is totally anecdotal. I worked in residential treatment for a long time, so kind of a big revolving door. And then I've worked with a lot of folks in the community. So I've probably worked with a few thousand people at this point, in some capacity or another. And I've met maybe 3 that it's like, okay, yeah, they might be there. Like, they like to hurt animals. They get off on, pain, that kind of stuff. But it's just incredibly rare. Usually it's just a tremendous amount of trauma. and trauma makes people do really funky stuff. That's not usually the best.
I say this through when I talk about. I guess I'm curious what your feedback or your thought is on this. A lot of the times we talk about, especially on this stream, emotionally manipulative people sometimes, or people that can be abusers. And I try to be really careful when I talk about this, or I try to be really precise. I'm actually completely anecdotal here and just my lived experience. So maybe the research doesn't agree with me, but when people act in ways that are emotionally manipulative or emotionally abusive, I don't believe a lot of people think that these people spend a great deal of time kind of like plotting out their evils.
Right.
When in reality, I think it's more like, let's say you have a person who knows that if they cry, they'll get what they want. It's not like they're thinking like, okay, after he does this, I'm going to start crying and I'm going to get what I want. It's more just like you have a set of learned behaviors that provoke certain responses and you just kind of like default to them. But it's not this highly manipulative, sociopathic, like I'm planning all this stuff. It's just people, especially like some abusive people, just kind of like fall into a pattern of behaviors that like manipulate people around them. It's not like the most cognition. It's not like this ultra cognitive process where you're super thinking about every time you're doing it or whatever, I guess.
Exactly. Like there's sort of like a conditioned response to it. Like, you know, I don't know what's what, but I notice that when I do these things, I get these results. And man, I what I will tell folks in session sometime is like, you know, let's bring back the dick. Like bring back the jerk. Like this person is mean. This person's a real jerk.
Oh yeah. Because like
person's not nice.
When we talk on, especially on Twitter, even more, or maybe a little bit more specifically, something that I get so frustrated by is there are no more dicks or assholes. There are no more mean people. There are only abusers, right? Like all of the language becomes so much more tuned up. And it's like, was that person mean to you? No, that person was abusive. And it's like, well, damn, like, were they really abusive? Like, well, what do you mean by that, right? That person ignored you. That's not ghosting. That's abuse. It's like, well, hold on. Is that really abuse? Like, yeah, people are very quick they've co-opted like all of the, I don't know if you call it the therapist vernacular or like all the domestic victim vernacular. And now it applies to every single social situation you're in. It's like, geez.
Well, and I took some notes, and you know, this is kind of going through things. Like we don't have to go through any of these topics. If you got to you kick me out whenever you want,
whatever you want.
But it's kind of going through some of these things about like and I think when folks are kind of maybe new to psychology, like newer students, that kind of stuff, it can be really exciting to learn a term that maybe explains something you've been thinking or feeling your whole life. And so it's just very like freeing to be able to say like, yes, this thing that really bothered me when I was a kid, that actually has a name, and that name is like emotional abuse or stonewalling or some such other thing.
Sure.
Or this person's a narcissist. When in what they're going off is like, well, what does that mean? It's like, well, they don't like it when people are critical of them.
Yeah.
And it's like, well, you know who doesn't accept feedback? Somebody who doesn't like you.
Yeah.
Like that's a person who might not accept your feedback.
And I don't know.
Nothing to do with narcissism. I
don't know if I would blame society at large or if I would blame psychology for this, but I really want, this is actually a huge criticism that I have of psychology. I wish they would have invented or created a whole new set of language or a whole new set of words or adjectives rather than either, I don't know if psychology borrowed from common vernacular first or if common vernacular borrowed from psychology, because I think it is actually so incredibly damaging. I hate the fact that like major depressive disorder, it has depression, that people call it depression, because it's not at all. It's totally not even related. It's a totally different thing than feeling depressed. And like, it would be like calling like one thing like a chair and another thing like the color blue. Like they're so different. And it frustrates me so much that like NPD, narcissistic personality disorder, right? It doesn't really have much to do with just being narcissistic or having a big ego, right? Like there's the diagnostic criteria is more specific than that. There's plenty of people that are there are plenty of people that are narcissistic that aren't NPD. They don't have that.
Right.
Yeah.
So it's the idea of like traits versus diagnosis. Like all of us might have a personality disorder trait.
Sure.
If we are angry enough.
For sure.
Or amped up enough, or if life has sort of taken a dump on us enough. The piece with MPD that really cracks me up is there's a huge component to that of grandiosity.
Sure.
You feel like, you know, you deserve to be with the upper crust of society. Good things ought to come with you. Like, I know it's going to happen. And that's often just missed for like this person won't accept my feedback or my criticism. Heretofore, they're a narcissist.
Yeah.
And it's really problematic. And what you're talking about with the language piece, so like tons of therapeutic models. Every therapist has their favorite, whether you know it or not. Um, I encourage folks to ask them, like, what kind of therapist are you? What kind of work do you do? My big four, like, I'm a big narrative therapies person. I also do DBT and a little bit of internal family systems. So I'll kind of swing in there.
Okay.
And the narrative therapy piece is sort of like, what is the story you tell of your situation? And how do you relate to that story? So, like, something really bad happens to me, and is the story like I'm damaged goods, or is the story like I'm a walking miracle? And so, when we have really intense charged language, that very much colors the narrative. That very much colors the story in a way that could be helpful for some, but could also be really unhelpful for other people.
Sure.
And I think you bring that example up a lot of times, like for somebody who's like truly experiencing pretty heavily. I don't know. It's like the meme with the guy from what is it, Breaking Bad? Like, we are not the same.
Yeah.
Like
Gus Springer, yeah.
Yeah. Like I use this term because I was essentially mentally tortured for years. You use this term because you're sad.
Yeah.
And I'm not trying to take a dump on anybody's mental health here. It's just these are things that can be kind of unhelpful sometimes. And I mean, some of these terms, man, they sound cool. Like, they sound badass to say out loud. So,
and I think sometimes it feels a little like, this is super armchair psychology, right? But like, you get this, yeah, ironically enough, you get kind of like, it feels validating to say that like an experience that you had was bad if you can give it like a really big label that brings with it a bunch more like serious kind of things, like, oh, like,
yeah,
I didn't just have shitty parents, like my parents were a combination of narcissistic personality disorder and all these other cluster B personality disorders, and they engaged in so much different abuse and traumatized, and I have triggers and PTSD, and it's like, damn, like, really, like, yeah, it gets a little frustrating sometimes when it seems like every single person on, and I'm kidding, online now, but like when every single person on Twitter has like 6 different disorders, and all of these, of course, are undiagnosed, and they're not seeking treatments for anything, and it's like, Jesus Christ, like, but then they'll be on the flip side out there talking about all these diseases and conditions and stuff, and just saying stuff that's totally off the wall, like not true, and it's all very, 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 very frustrating.
Yeah.
Not to get political, and I don't want to draw you in that direction, but like, without saying whether or not Kyle Rittenhouse was right or wrong or anything, but I was very frustrated because everybody on Twitter, 80% of the people on Twitter are like, oh, I've got triggers and I've got trauma and PTSD and blah, 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 blah. Yet everybody on Twitter was so quick to look at, I don't know if you saw Kyle Rittenhouse have what looked to me kind of like a panic attack in court. And everybody's like, oh my God, it's fake. I can tell 100% it's fake, 100%. It's like, man, really? You really can just see that? Like, I don't know about that one, Chief. Like, especially if you claim to have all these triggers, all these traumas, like, you can just look at somebody and instantaneously know that they're faking crying. Like,
right.
Yeah.
Well, and to, I don't know, not to blow smoke up your ass, but I feel like that's kind of what has drawn me to your content a bit, is sort of this idea about like, philosophy is hard. Like, having a personal sense of ethics, I think, is like harder than we might think. And a lot of times we don't necessarily recognize when it's sort of like, wait a second, I just said something way outside of my ethical framework. Or I just said something way outside of my personal philosophy. Because, like it, if you believe in toxic masculinity and that kind of stuff, you really ought not be playing into some of that stuff. Yeah. And of course, grieving people can say bad stuff or, say harmful things. But it's a little frustrating. It's hard to see.
No.
Yeah. Damn.
Wait, why? Okay.
Yeah. Go for it.
Well, now I'm just going to pick your brain and everything. Why are psychology students so fucking crazy? Here's what I get. You know what? Here's what I think, okay? Oh, you're a psychologist, so I can use all the fucking words with you, okay? You're familiar with confirmation bias, right?
Oh, boy, yeah.
Yeah. It feels to me like, and this is why I don't even trust myself. So I've wondered for a long time if I have ADHD. I don't know if I trust myself to go to a professional and talk to them, because my child has ADHD and I did so much reading on it. I don't know if I would trust myself not to just give the answers that I know I should be giving if I have ADHD, right? Because I feel like I've looked at like the diagnostic criteria and everything. Well, I know what I would need to say to get that right. I feel like it must be so strange for psych students to start learning things And here's like the big, I took one psych class in my life, okay? It was honest to God the best class I ever took in my life. It was an AP psych class in high school, okay? It was so eye-opening for me. Oh my God. And the biggest thing that I took away from that psych class is actually the same I took away from philosophy, is it ultra undermined my confidence in my objectivity in the world. That's what it did. And I mean that in the best way possible. I was like, okay, I have so many biases that are functioning when I don't even fucking realize it. And it's good to be aware of that. I feel like so many psych students that I talk to go into psychology and they sound like what a person who has never studied psychology would start saying if they were introduced to psychology, which is like, I've learned 3 things. I can instantaneously diagnose your attachment pattern. I could psychoanalyze you. I can recommend you all these things. Like, bro, you've talked to this person for like 2 minutes. What the fuck is wrong with you? And they're like a year 4 psych student. Or there's somebody that graduated with their psych degree. They've got a BS or BA. Like, what the fuck? Why? Why do people do this?
Yeah, this might be disappointing or whatnot. I think it's exciting. I think there's certainly an excitement component, and that is kind of the idea. Like when you're working with somebody doing stuff, you have your set of theories based on your therapeutic models, and you end up getting very good at making predictions. And this person that you're working with, that you have a lot of respect for, they're an awesome person, they start doing things where it's like, aha, we kind of saw that coming. And what you don't realize is that theory is just not very helpful to anybody other than you. And what happens, and I feel like what I've seen online a lot, is like, we got to let the world know. You have to tell everybody about this theory and how you formulated your plan and everything like that. And when you talk to a real person in life, like, I'll give a hypothetical here. This is not based on a real person, but I feel like, your dad wasn't really around. And so, you will look to cling on to men, and there's a certain profile, blah, blah, blah. If you were to say that to somebody in real life, that's not helpful.
Yeah.
That does not help that person very much at all. And in times that I have done stuff like that, I'm oftentimes like, because I have made these mistakes, met with a response of like, okay, now what? Because it's just not very helpful other than to like put in a book or gossip about it, that kind of stuff. And so I think that part of it is that. And part of it is it's like when it comes to Dunning-Kruger, like there is a component of like if you know nothing about taxes and you watch a 10-minute video, that is very helpful. Like there is some stuff that is very helpful, but you don't know everything about people. And it's really important to have those experiences of one, somebody telling you to your face that you're not being very helpful. And 2, like coming out with some of that stuff and then realizing like, oh shit, we're not really going anywhere here. Like this is not what this person wanted to talk about.
Sure.
So I think that those are some big pieces of it. Damn it, you said something else I'm not quite remembering now. That's what I get for not having the notepad.
Fuck. Yeah, oh shit, I usually write notes down when I talk to people, so I don't forget.
Oh, you were saying that like these are the folks who seem to be like the least like aware of psychological biases. That's what you were talking about.
Oh yeah. So like if I diagnose somebody, eventually like that's all. Oh, I want to ask you I'll ask you a question about that later. Like is it helpful to give a diagnosis to a person? Something I have a lot of difficulty when I talk to some people, and I even have this difficulty with myself actually. Where like, so I'll speak personally. As soon as I started studying a lot for my child for what ADHD was, ADHD involves a lot of things that I didn't know before. And a lot of things that involve for reasons where I was like, oh, I can't have ADHD. Like I play StarCraft for 16 hours a day for 4 years. How the fuck can I have ADHD, right? I read a lot. I was like, oh shit, okay, hold on. Where it opened my eyes. And then I worry sometimes where it's like, okay, I want to sit down and I want to work on this thing. But like, can I do it? Or like, is my ADHD going to keep me from doing it? I don't know if I'm becoming trapped by my own information, right? Like, and I wonder, and I worry sometimes like, do I have the discipline to do this? Well, maybe I do. Maybe I don't because I have ADHD. And then sometimes I'll talk to friends who they'll say something and I never tell anybody this because I don't want to get into the argument and it's not my place to say. Sure. But anytime I hear somebody say like, oh, I want to do this or I could do this, but this is what it means because I am, I've got people that will say like, oh, I'm bipolar or I have BPD or I'm ASPD or I can't do this, like blah, blah. It's like, well, fuck, wait, hold on. Now it sounds like you've learned this vernacular and now you've like trapped yourself with it. Is it helpful to have like, I can understand from a diagnostic point of view it could be helpful, but like, is it helpful to share this with patients or what is your like stance or feeling on that?
Well, I'm going to steal your shit from you. Are you ready? Because you actually commented on this in a totally, well, not a wholly unrelated thing. And I thought you worded it in a really cool way, which is you were it was some video you did however long ago where you're talking about like knowledge and how valuable is knowledge.
Oh, as long as it
And
gives you a helpful prescription, right?
exactly. Right. And so to me, like a diagnosis that involves no treatment plan is somewhat useless. Like there has to be like some idea about like this is what is going on and this is what we're going to do about it. And without that, it's not particularly helpful. And I would say that if what a person needs is a break and the diagnosis allows them to take a break, like I'm easily overwhelmed, so I could do this thing, but I will probably have a bad time. So I guess there can be some utility in that, but ultimately, I being a person who kind of also has ADHD, like embracing that has kind of been very helpful because it's allowed me to sort of learn like, well, this is actually how I learn better. And when I do these things, like this actually allows me to do the things that I want to do because I recognize that like I take in information a little bit different, or I might need to move, or shake my leg a lot, or something like that in order to stay focused. I mean, I'm playing Factorio right now, in part because it actually helps with the focus.
Gotcha.
Yeah, so yeah, but I kind of going to that piece as well. There's some stuff that folks have shared about mental health pieces, things about their diagnosis and stuff, where I've definitely wondered, like, how did you come to know that about yourself? If
Oh
somebody's like,
yeah, because it's like, and this is like, it's got to be the hardest thing because like 25 years ago, it would have been a lot more rare. But like this, I feel so. I don't feel bad saying this actually because I'm not a therapist. I don't give a fuck. If I
Yeah, you
was
can
a
say what you want.
therapist and I
I'll be
asked
careful.
somebody what was going on, and they actually gave me like 1 through 8, like the textbook diagnostic criteria for whatever fucking thing they think that, I don't think I would believe them. I'd be like, well, hold on, we're gonna have to talk about all these because I would feel like, are you just regurgitating to me like the entry in the DSM-5 so that like for whatever thing, do you honestly have all these things, or have you just read the
Yeah.
article on it and now you can kind of identify? Because to be honest, for a lot of things you can identify with them if you stretch it just a little bit, right? Like you,
Yeah.
yeah. Have you seen like the selling? We talked about this earlier. The selling of like testosterone replacement therapy. Every single guy in the world, like part of having low testosterone.
Yeah.
Some of the symptoms are like, are you agitated sometimes? Are you sleepy a lot? Are you gaining weight? Like, yeah, this is like fucking 95% of men in America. Yeah, we all have low T, I guess, or you
Sure.
can do a lot of things for anxiety, for depression, for depending on how you stretch the conditions. Yeah, that seems like it would be really challenging from a therapeutic point of view. Yeah.
Sure. This will sound weird. And I don't. I should probably just be a little bit less careful with my language.
Okay.
I feel like your average person could take a 6-week course and diagnose accurately. Like diagnosis is just about one of the easiest parts of the job. It is not difficult to read a book and go through. There's something called the skid, and I just like for disclaimer, I am sharing this as entertainment. I am not telling
Sure,
anybody
to
to
go
use this on
diagnose
family,
their friend.
friends, all
Yeah.
that stuff. Yeah, don't diagnose. There's something called the skid. It is literally a form of yeses and nos. And it's sort of like a computer algorithm, but on paper, though there is a computer version. And if you say yes enough times and no enough times, it spits out a pretty accurate diagnosis. So it's diagnosing is not a very difficult thing to do. And I feel like, again, it kind of gets a lot of weight. Now, this is where the experience piece comes in that I think is really important. There are 2 recurring phrases in the DSM that is deviate significantly from social norms.
Yeah.
And not better explained by. And if you follow those 2 things, like those are pretty helpful. So somebody could say something like, "Yes, I do these things, these things, these things," but real life lived experience when you're working with somebody, there are some things where it's like, "Wow, that was a really remarkable thing that you just did." Like, you screamed at a partner for 3 hours. That's really interesting.
Yeah.
Or whatever it might be. So yeah, it would be very easy to say the right things. We can all do that. The diagnosis piece isn't the hardest part. The showing up to sessions every week can be a bit harder than that.
Are you I don't know if you're allowed to share this or choose to or choose not to.
Sure.
When you're seeing a patient that presents with issues, do you always share a diagnosis if you feel pretty confident about one, or is there some other thing that you appeal to internally to make the decision on whether or not you would share that with the patient?
It super depends on the person. If it's relevant, I might. So there are a lot of people who will downplay their symptoms, and those people aren't really online. Oh, zinger. But
Okay.
there are a lot of people who will downplay symptoms.
Uh-huh.
And in those cases, it could be a helpful intervention to be like, hey, is it okay if we read something together? What do you think about that?
Okay.
And then you go through and you read it off. There are other people where I might not want them to know that. Because of concerns about like I'm not necessarily sure what you would do with this information. Because maybe I know something about their interpersonal relationships, I know something about their family, and my thought process is like, if I tell you this might be weaponized,
Sure.
and I would not want this information to be weaponized against a loved one. And there are people like that, which kind of makes me think about the talking point a little bit about like invoking your therapist in casual conversation.
Yeah. Which I don't talk enough, but that's incredibly bullshit to do. I don't know if I've ever actually publicly said that before, because I try, especially because if I'm having conflict, I try not to give like big rules of thumb all the time, because I feel like it's going to sound very personally tainted, and it might be sometimes. I don't recognize it, but in my opinion, invoking a therapist who is not there to mediate or arbitrate disagreements between you and other people. They're not there to do that. So invoking them in a conversation with another person is a pretty bullshit like appeal to authority. And in my opinion, could be a form, depending on the mental fortitude of the other person, could be a form of manipulation. If you're invoking a professional to declare somebody else's behavior is incorrect, when that professional is never there to evaluate somebody else's behavior, is a really big bullshit thing to do. Yeah, for sure.
Yeah, and as you can imagine, like personally, I super do not like that. And that comes up sometimes, and it can come up in interesting times, and I really like everybody they work with, and heaven forbid somehow this whatever, But it has been come up a few times where it's like, hey, I did that thing we talked about, and I told my wife I was going to leave her. It's like, wait, what? Excuse me? I don't remember that part of the discussion where we talked about leaving your wife, and so you can be invoked in ways like that can be pretty uncomfortable. And the conversation that I might have with somebody, and everybody could do it different, is like, what was important about bringing me up in that space? Like, what was important about, using me as a reference in that conversation? And is there any way that, we could avoid that in the future? Because not super fair to me, boundaries.
Something that, not to reference any particular person, but something that frustrates me sometimes is when people will learn like a term, but they don't really understand the like terms in psychology are pretty worthless if you just know like the term and the 5-word explanation. You kind of need
not
like
to
more.
Cut you off, but like gaslighting's the big one. I feel that's
yes. Oh my god, yes.
The ultra mega.
Yeah, somebody lying to you is not gaslighting you, or somebody or somebody forgetting something, or somebody being mean to you isn't necessarily gaslighting you. Yeah. Another big one. Oh my god, I get so frustrated with this. Are you familiar with the term grooming?
Yeah. Oh, yeah.
So, and I don't approve of anything, of course, but like an adult fucking a minor, that's not grooming. Two people like abusing power dynamics is not grooming. Like grooming my understanding at least of grooming implies a very specific deceitful relationship, oftentimes between an adult and a minor, where you entertain a certain type of relationship with the goal of later exploiting that relationship to turn it sexual once you've gained the trust in like a non-sexual setting. That's my understanding of what grooming is. And it refers to something like pretty particular and pretty horrible for a variety of reasons. You're destroying this person's ability to trust me in the future. But sometimes people will have a relationship. It's like, oh, 20-year-old guy fucked 16-year-old girl. He groomed her. Or like famous person fucked a fan. He groomed that person. It's like, damn, wait, hold on. What the fuck? That's not what this means at all. Oh, it's super, super, super frustrating to see people throw around. Like gaslighting is another big one as well. Yeah.
Well, just to name it, groomers don't just groom victims; they also groom families of victims.
Sure, yeah, they can, because they'll be family
friends.
Put
themselves in a position where they are indispensable and all that stuff. And so, what can be helpful about knowing that is just like, oh, I rely on this person for a lot of stuff. How do I feel about that? Not that anybody who's helpful is that way. Yeah, no, those things can be misused a lot, and again, pure entertainment, not telling people how to do therapy stuff. Like that would be like where a narrative technique would come into play about like, what is important about this word gaslighting?
Yeah.
Like, why doesn't it get to just be like a lie? Like why isn't it just that this person was dishonest with you? And then saying that honestly, not rhetorically, but like, tell me about that. Like what feels right about that word? And then you would have like a conversation and discussion about what feels right about that word.
Sure. Yeah.
Yeah, another piece I wanted to share with you that I thought was interesting is, sort of not referencing anything here, but borderline personality in the
Yeah.
context of ethical entitlements.
Okay.
I think this is a very interesting idea. So, like, looking at personality disorders in general, I think they're very sexy because people kind of know what they are,
Mm-hmm.
and like they can be really intense. And I would say the simple, I like things easy. The way that I think about it is like this is like the filter through which you view the world
Mm-hmm.
all the time.
Mm-hmm.
So, like, if you are like avoidant personality disorder, you view the world through the lens of everybody can see your faults and failures,
Sure. My
and they're all just
understanding, you correct me
yeah.
if I'm wrong, but I think that for
Hmm.
personality disorders, you're not typically aware of them, right? Because it's a personality or
Yes.
yeah, okay.
Well, and that's tough.
Mm-hmm.
There's a thought experiment that I use with folks sometimes. We call it the depression shot
Mm-hmm.
thought experiment, which is this idea of like if I walk up to you and I give you a shot of depression,
Mm-hmm.
and you know that I have it, and you know that once I give it to you, you're going to have it for some length of time,
Mm-hmm.
does that matter that you watch me do that?
Gotcha.
And it's everybody's answers are remarkable, but a lot of folks will say like, no, it doesn't. Um, so is somebody aware? Is somebody not? They might be aware, but the emotional pain or the turbulence is so strong that it doesn't super matter.
Mm-hmm.
Um, and in the context of something like BPD, and I don't know if anybody's listening who has BPD, this
Mm-hmm.
might be an interesting concept. Like, I want to try to speed run this because I don't know. Maybe this will be interesting.
Sure.
So there's a model called contextual therapy, and this was a super cool thing I got to learn about in internship, and it kind of hits on this idea of like four components. There's like your history, which is really the history of your parents, what they did, how they acted, all that stuff.
Mm-hmm.
That informs your psychology.
Okay.
And like your psychology is how you view the world, like your sense of ethics, your workout, all that fun stuff.
Mm-hmm.
And that has a tendency to inform this idea of the ledger. And the ledger is sort of this idea of like everybody we meet, whether we're like aware of it or not, we keep a running tally of like, do we have a good interaction with this person or a bad interaction?
Mm-hmm.
So it's like, I needed money. This person gave me money. We had lunch together. That's awesome.
Mm-hmm.
He's a cool dude. I can trust this person. Versus like, no, he said no and that he doesn't lend people money and that made me feel bad, blah, blah, blah.
Sure.
And the idea behind an ethical entitlement is if I have a huge debt with somebody, if I feel like they've screwed me over enough,
Mm-hmm.
then I get to do bad things.
Okay.
Um,
Sounds
so
based. Yes. I agree
yeah,
with it. Hell yeah.
exactly. Like, you have been so mean to me that I can say whatever I want to you
True.
because I'm ethically entitled to do so. And what's interesting about this is like, let's say somebody steals, for example.
Mm-hmm.
You might be like, you're not allowed to steal. That's a bad thing. It's like the fact that I did says that I can. I am ethically entitled to. That fits with my system.
Okay.
So we can imagine that if somebody's struggling with something like borderline, where, you're watching a movie together and this person's talking and you say like, hey, would you mind keeping it down a little bit?
Mm-hmm.
And how their brain filters that information is like you were screaming and embarrassing them in front of the whole room
Mm-hmm.
to keep their mouth shut. They might feel ethically entitled to be like, you know what, screw you, you're going to be an alcoholic just like your dad.
Sure.
And you're like, whoa, that was harsh. What?
Mm-hmm.
But it comes from a perspective of like the thing that you said was far more hurtful to them than the thing that they said to you.
Mm-hmm.
There is no way they could match the pain that you caused them.
Yeah.
Interesting idea.
Yeah, I understand.
Mm-hmm.
Anything else?
Well, I was just thinking about like one of the memes I wrote down was the self-diagnosis meme.
Oh,
I don't know if that was.
Yeah, we talked around that issue earlier, but incorporating like two of the earlier things we said, the two problems I was at: one, a diagnosis should give you some utility. So if you self-diagnose and then you do nothing about it, why the fuck do you have this diagnosis? Fuck off. Just go do something. Yeah, that's the first thing.
You guys nailed it.
Yeah, and then the second thing was the kind of people don't really have a good understanding all the time of a lot of these personality or mental illnesses. And when you get more and more people running around, I think you are like legitimately destroying people's fundamental understanding of mental illness or even psychology in general.
Goddamn.
Yeah, it's like a really big one I think for me are like things like triggers, for instance.
Sure.
I feel like triggers are incredibly real And especially if you have some form of trauma or post-traumatic stress disorder, like a trigger can like evoke a physiological response from nothing for no good reason. That's why it's a trigger. And I feel like that's a thing where like people have, that word means nothing anymore. Like so many, I guess, words do. Where like people will be like, oh, if a guy walks up to me and he calls me the N-word, like that's a trigger. And it's like, that's not a trigger. That's a legitimately shitty, horrible thing. You should have a negative response to that. Like, what do you mean? Yeah, these aren't triggers.
Yeah.
These are just, you have negative response. Like triggers by definition, at least my understanding, a trigger is irrational. You have triggers and you shouldn't, right? These are things you want to get rid of. And that's just like one of like a million things where it feels like people like using all of these words all the time. Like they basically just mean nothing anymore. And that kind of frustrates me sometimes when they
when you're hitting on a huge boundary thing there that actually I wrote down the meme of like don't invite somebody to your house, and it made me so sad how much pushback you got around that one. Is that clear enough what I'm
referring to?
Of like,
I had a conversation where basically
Right.
Especially somebody who's bisexual and has experience with both sexes, at least for men, I would fuck somebody before I would invite them back to my house. It's like such a that is like probably one of the most intimate things, is showing somebody where I live. The only thing I can think of that's more intimate than that is like showing somebody where my kid lives, which is another thing that for single people that are dating that have children or whatever, is something to consider as well. And that seemed to be a very, very controversial take, and there were so many people like, what if you just want to play video games? There's so much crazy stupid shit said.
And that just made me so sad, because kind of like talking about what you were just there about, like the trigger piece, like boundaries are hard. And with almost everybody that I work with, within like the first 5 to 10 sessions, we will generally have like a concrete discussion about boundaries. Because I like, it's just good to know like how people feel about boundaries. Can they set them? Blah, blah, blah. And one of the things with boundaries, one, a lot of people don't know what their boundaries are.
Sure.
Like if you ask them point blank, like, what are your boundaries? They might not be able to tell you. And so there is this process of like figuring out those boundaries. So for somebody who has a hard time even identifying what their boundaries are, telling that person like, go do what you want, which that's mean, that's not fair. But, essentially like, to misread a cue, like that person may need to learn boundaries. And an important boundary component is the boundary of safety, which would be defined as like you can protect yourself from exploitation and you can read signs that somebody is abusive or selfish.
Sure.
Not everybody knows how to do that. And that's actually something of yours that I stole and I use. And sorry you don't get royalties off this. But it was one of the things where you were sort of talking about, like, I try to have my relationships in a way where it's like I can enjoy the good of somebody and parse out the bad. That's exactly what we want to go for. The way that I explain that to folks is like, if I'm like a level 1 RPG character, maybe I have no boundaries. I know nothing about them. And maybe at level 5, I'm like scorched earth. Like somebody screws with me, I cut them out of my life. They're done forever.
Sure.
But maybe at level 10, I can like enjoy the good and realize like, you know what? Doug is bad with money. I'm not going to let him borrow it. Or like, this person does some things I don't like. I'm going to avoid the path of harm.
Yeah.
So, that's the very long way of bringing back to that idea of like, triggers of being like, figuring out your boundaries is an important thing to do. That may be a way of kind of like understanding what the boundary is. But man, really sad to, I don't know, put somebody in a situation where maybe they're questioning their boundaries or trying to figure it out, if that makes sense.
Here's always be aware that these conversations might haunt you in the fuure. I don't know. Just always be.
Well, like I said,
so
trying to not say anything I wouldn't want anybody to, cancel me over.
I'm going to start with something I know to be true, and then I'm going to extrapolate to something I worry about, okay?
Sure.
I have a feeling, I spent a lot of time around children growing up because my parents did daycare, and then I have a child, so I've seen my child grow.
Sure.
I feel like children, I noticed this thing when my mom was doing daycare, it felt like. When a child hurts themselves, it almost feels like the first thing they do is they look to the closest adult to see what the reaction should be. I almost get that feeling sometimes, And I noticed that my son's grandparents do this all the time. It drives me crazy. The kid runs into a table, and then like you look at him and you laugh, you pick him up or whatever. They might like whine for a second, but generally they're off running away doing whatever.
Yeah.
Kids do crazy shit. But if you have like, I hate to use the stereotype, but if you have like the mom or the grandma that the kid runs to the table and I was like, oh my God. And then, they run into the table, they pick him up and say, oh, I'm so sorry. Like the kid will cry over nothing. It'll be insane.
Sure.
Do you
Talking about attachment styles.
Sure, it could be. Yeah, it could.
Transitioning into a little bit here. Yeah.
Okay, hot take. Okay, so
oh boy,
speak carefully, right? I speak about this thing now. I don't know if this is a term coined by Dr. Bunnell. Okay, maybe I made this up, or maybe this exists somewhere in the literature. Sometimes I get this feeling of like reverse traumatization or like a retrospective traumatization where somebody goes through an event. And actually, first, let me give the example that I know can happen. So I'm being responsible, okay?
Sure.
I think it is totally possible that you could undergo some fucked up things as a child, not be aware of it, and it has a negative impact on your life. And then through later discussion or therapy, you have talks, you realize, wow, I don't trust these types of people all the time because of these negative experiences. Now I can connect with that. Now I can fix that, right? That totally, I'm sure, happens, right? But sometimes I get the feeling there are people that they have like a shitty experience and it's bad or whatever. But then through like later discourse or dialogue years later, they start to like reverse traumatize themselves where they invent like a far more negative emotional response to that initial situation that really doesn't need to be there. It doesn't serve anything. Do you understand what I'm talking? Do you feel like this is like this retroactive trauma? Is this a real thing or am I completely imagining this? Or what do you?
Well,
yeah.
I would just I'd have a totally different take on it, and this would probably be really unsatisfying.
Okay.
So, part of the framework that I sort of work under is that like everything we do serves a purpose. Our goal is to figure it out. And I'll use the example of like eating glass. Like most people don't eat glass because there's absolutely nothing beneficial about it. It hurts, it will kill you. We just don't do it. But a maladaptive coping skill, like some way that I interface with the world that seems to be all bad, there is probably something helpful about it. And it would probably be worth our time to figure out what that helpful thing is.
Okay, true.
And I know in these communities, like you talk about this, and I'm not being mean. Steven's mean, but I'm not. I'm chill.
Okay.
They validate the hell out of each other. And so it's a space where you can kind of come on and discuss these things and get tons of validation. And it may be validation that was absolutely not present when it needed to be when they were younger. And that would be kind of my way that I would choose to view it, because, it's a pretty compassionate way to view it. You have no obligation to be compassionate if you don't want to be, though. So
So here's something that I'm kind of curious about, and this would be I could even personal advice on this. How do you figure out when you need to be compassionate and validating versus when you need to be challenging to to be effective in somebody else's life?
Yeah, talking about those therapy words, gotta sound cool. Empathic confrontation. When we engage in the empathic confrontation.
So to be clear, this is you're talking about being confrontational with somebody,
right,
but not just to shit on them, but because you're truly trying to evoke a better response or a reaction or something out of it.
Yeah, and the way that I tend to open that up is like, hey, I'm going to say something mean on purpose, and this is not something I believe. Okay, are you ready? And then I will say the thing, and that'll be my way. Again, this is pure entertainment. I'm not teaching people how to be therapists and whatnot. When a belief doesn't mesh up with reality, that's when that might come out. And again, not to stroke your ego, but like that's one of the things that I like about your content is sort of this push towards like, let's operate in reality. Like, let's read an article and get on the same page with what's happening in the real world.
Sure.
When somebody brings something up where it's like, that just doesn't really mesh with reality, I might challenge them on that thing.
Yeah. Although I'll concede, or not concede, but I'll say that unfortunately that conversation is far more difficult when mental health is the subject, right? It's easy to ascertain, was this conviction happening because of Russiagate versus does everybody actually hate you, right? One of these things is like we can point to the external world and know it. The other is people's assumptions of what is truly unknowable stuff, right? We can't reach anybody's mind. And those conversations get a lot more difficult,
But that's where the job gets really fun because then it's like, okay, if everybody hated you, how would we know? Let's just practice and assume that that's true. Everybody hates you. How do we know this? What do we observe in the real world that tells us that? And those conversations are really generally pretty fruitful and enjoyable to have with people.
So here's something that so here's a question that I have. I did a lot of drugs in my 30s. I'm 32 now, okay? I'm doing lots of drugs, okay? Prior to doing a lot of drugs, I would have said that like my thoughts are like 85 to 90% cognitive, okay, that my rational brain is working, and maybe I have this underlying 5 to 15% like vibe or mood or whatever, right? I have like, yeah, this kind of shit, whatever. But it's not really that important because I'm a smart guy. I can think my way through pretty much anything. I'm good to go. Post drugs, I've completely flipped that. I feel like I have a very healthy, strong, and good mind, but I don't know how much credit I get for that because like 90% of that shit is running under the hood and I don't think about it or do anything, right? When I wake up, I have a high drive naturally to do things. I'm excited to get out and achieve and talk to people and go to the gym. Like I have this excitement and I don't really do anything to get that. I don't like deserve it. I'm not like working hard. I just naturally have it. Something that I noticed is that I never thought about until my drug experiences is it seems like you have like this cognitive way of understanding things, and then you have like this emotional way of understanding things. And I didn't realize that these were two different things until I had very short like mental health bouts post doing lots of mushrooms. And something that I realized was that I don't know how you bridge a cognitive understanding with an emotional understanding. So there were very, very short periods of my life where I had something akin to
well, really quick.
Yeah, go.
Let's make sure we're operating on the same definitions. What is your definition of cognitive right now?
Oh, sorry. Okay, maybe I'm using it properly. When I say cognitive, I just mean like a mental process by which we think about things like consciously. So like, perfect.
Yeah, we're operating on the same wavelength. I just wanted to make sure that we were.
Gotcha. Okay. So I had like very small bouts of weird, something akin to maybe general anxiety disorders or major depressive disorder, where I could like read things and my brain still worked. I could understand stuff, but on an emotional level, I was like in a different place and I couldn't do anything to change that. How do you, when you're communicating with somebody, I feel like your answer is just going to be a lot of CBT or DBT. When you deal with somebody, it's one thing to have a conversation to say like, does everybody hate you? It's one thing to know cognitively, everybody doesn't hate me, of course. But it's another thing to truly feel that on an emotional level. How do you bridge that or reinforce that emotionally, I guess?
I really want to be like a lot of CBT, DBT. but the idea behind that, so like, this has popped up on stream before. I don't think this is not dense. Okay. But like, the triangle, your thoughts, your emotion, your behaviors are all connected. They all impact one another. And what is helpful
you're talking about like the CBT model, right?
Right. Yeah. But DBT builds on that. It takes from that and then adds a lot of acronym skills and also kind of hits on this idea of like the dialectic, the two opposite ideas can be true at the same time, or we can identify more than one truth at one time, which can be very frustrating for black and white thinkers.
Sure.
But what is helpful about that is it's sort of like, if I don't know how I'm feeling, I can look at my behavior and I can be like, well, I'm not really sure how I'm feeling, but I'm kind of acting like a depressed person.
Okay.
I'm playing video games. I'm not leaving. I'm not doing all this stuff. If I don't know what I'm feeling, what am I thinking about? Well, I'm thinking about how much I want to die.
Okay.
Oh, well, that's something a depressed person might do. So it kind of gives us some insight into like our stuff, and then we could look at how do we want to change that. Because a big component of, when we get into therapy, first thing you do is informed consent. There are risks and benefits to treatment. Risk of treatment, whatever you change in your life, you're probably going to feel worse before you feel better.
Sure.
Benefits, it can also be super helpful. So there is a good chunk of time that somebody might be using these skills and it doesn't feel very good. And it really is about sort of acting different to the emotion for a long enough time that we start to sort of see like the benefits of a situation, and then we can start to change the narrative. We can kind of change our story a little bit, and ultimately things might not bother us as much.
Gotcha.
Not necessarily a miracle worker. Like what we talk about may not stop like a panic attack. It's a biological response that hits you fast. But I think it can be really helpful, obviously, in the long run. Otherwise, probably would do it.
Gotcha. So okay. Here's a random question.
Sure.
This is a hard one. I don't know if there's a good answer to this. How do you determine, why does it seem like there are some people that have very high levels of resiliency and others that don't, even when, at least superficially, like the circumstances seem relatively similar?
Yeah.
Is there like a big, like the research says there's like this huge thing? Yeah, I'm curious because that's like a,
So first off, I love talking about this stuff, which is part of the reason I reach out because I really enjoy talking about this stuff. So at no point will I get sick of these questions. But two, as far as I can gather, that is a bit of a mystery. And I didn't come with, facts and logic. I didn't come with stats or whatever. But I feel like at some point in school, we sort of read this idea that it's sort of like a 25-50-25 deal, where it's like 25% of people who experience a traumatic situation might go on to develop PTSD. 50% might be totally fine. And another 25% might have like a euphoria experience where it's like that sort of like, like, wow, I had a heart attack and I got really healthy. I turned my life around. I'm a completely different person than I was. And your chat is incredible about digging stuff up, so I'm sure somebody can probably find that next 5 to 10 minutes. But there is a real mystery to, like, we don't necessarily know. There's obvious things like repeated exposure for sure. The more traumatic things you experience, the more intense it is.
So like stuff related to
yeah.
is it like ACEs, I think they're called, where if you
right,
have, like,
adverse childhood experiences, ACEs could do it. Repeated exposure to trauma, so if somebody's in like an abusive parent situation, physical, emotional, sexual, that's certainly like the repeated piece. The situation in Canada seems to be brought up a lot. That's kind of the famous one where I want to say like the 80s or 90s, there's like a 100-car pileup or something like that. And that was sort of utilized as a way to get data on like who developed this and who didn't.
Yeah. This is a frustrating one because, and I was so guilty of this in my early 20s. For whatever reason, I consider myself to be a very, very, very resilient person. And people that are resilient, that become public figures, often tend to like prescribe trauma to people as a way of strengthening themselves. And it took me a long time to realize,
no way.
Yeah, this is such a stupid fucking thing to say. The most egregious way that I would do this is and I still to this day I have to intellectualize this because I can't feel it at all. I cannot understand on an emotional level people that are held hostage or have problems with family members. And for the longest time, I'd be like, yeah, if your mom's an asshole, fucking cut that bitch out. You never talk to her again, right? Maybe show up at the funeral, maybe not. Fuck it, right? And I would give advice like this all the time. It's like, okay, wait, hold on. Not everybody necessarily like responds to situations the same way. It's really stupid and foolish to assume that. Or like I would say, like for online stuff, like, oh yeah, like I like just throwing myself into like crowds of people that boo at me and hate me and say mad nasty things. I think that builds a lot of character. I think it's really, you should try it too. And a lot of people have like almost traumatic, I would say traumatic responses to this in streaming communities to like receiving the level of hate. It's a really hard thing for people to learn, that like it's not. And you see it pop up everywhere, like, oh, we need to beat our kids again. That made real men. Or, back when men were men and they were 18 years old in World War II. It's like, damn, is that really where we need to go? Like, is that the way to do it? Yeah.
Well, and the reality, and, I'm not knocking you. I'm sure you've done great things. Like, the biggest thing you have done to be resilient in that way may be absolutely nothing that was into your control. Like, it's just your brain. Like, just the way you're wired. Like, it just doesn't bother me. There's a really interesting documentary. I want to say it was on a Myanmar general who like killed a ton of people, and it's a bizarre film. But they make like a Bollywood-esque style recreation of the events, and ultimately he comes to terms with the spoiler. Sorry, people.
Okay.
Well,
I don't think I have a lot of frequent Bollywood viewers in chat, so you're probably safe on this one. Go ahead.
But
people are saying the name of the movie is The Act of Killing.
Perfect. Okay. Yeah, and the one dude like has this complete visceral meltdown response when he realizes what he did. And there's another dude who did similar things who's just like had no problem going to bed at night. Just like that, the past is the past, present's the present. I don't think about this stuff. But damn it, you were talking about
resiliency. Some people are. Resiliency. You correctly brought up that a lot of people will take credit for their resiliency when the reality is maybe when they were 2 years old, maybe they saw some shit they don't even realize is what made them. Yeah, but go ahead.
Or they just don't feel it. Like they just don't have that bone in there. God damn it, I don't remember what I was gonna say. Shit, that's okay.
Wait, let's think about it. You were bringing up Myanmar general. They interviewed him about all the killing.
Yeah. They're talking about how he, one person felt it, the other person didn't, the resiliency. Oh, yeah, that's what I was going to say. Jeez Louise, sort of talking about this idea of emotional pain and trauma. Right. Yeah, that's a real dangerous one in terms of, like, one of the things that a conversation I'd have with folks is sort of like, just like with physical exercise, like, there is a good emotional pain and a bad emotional pain. And like, there's the emotional pain that's like going to the gym where your body hurts and you're sore, but it's making you stronger. And then there's the emotional pain where you're like a day laborer where your body's breaking down, your back's breaking down, your knees are going out.
Mm-hmm.
So like, breaking up with somebody that is not a good relationship might be a good, healthy emotional pain.
Sure.
The pain of like, if you're not in an open relationship, being cheated on
Mm-hmm.
might be a very significant pain for somebody. And that's not a particularly healthy pain to experience.
Mm-hmm.
Like, hey, just go out and be cheated on so you can get used to it. Like, we wouldn't encourage that because that will generally change the way people view relationships. They can get really unhealthy beliefs.
Mm-hmm.
That's where things like, I need to check my partner's phone comes from,
Mm-hmm.
because one person screwed you over, so now you're acting like everybody's going to.
Sure.
That's not very healthy emotional pain. So kind of like recognizing that there are some things where it's like, yeah, I don't traumatize yourself because you think it's going to build character.
Yeah, but something like the loss of your first pet or whatever, these can be like
That's valuable.
Yeah, valuable developmental
Yeah.
experiences. Yeah, or grandparents dying and stuff like that. Yeah.
Right. And then, of course, you're kind of alluding to what we talked about a little bit, like the response of others around you is also very significant in those situations.
Mm-hmm.
Which is kind of what can make it incredibly frustrating, when you're working in a situation where adults are not necessarily following through with their adult duties.
Yeah.
Acting like an adult.
You mentioned doing like especially like drug and alcohol stuff for younger people.
Yeah.
It seems like the biggest sympathy that I have for, I would say, educators in general, but then even
Yeah.
more specifically people that like do stuff that like what you do, is that so much of what you do is outside of your control, and
Oh,
more
yeah.
frustratingly outside of your patient's control as well sometimes,
Oh, yeah.
especially if it's a child. At least if they're like 20 or 30, you can say like, you need to change your environment, find better friends, separate something. But man, if it's a child and they have just a shitty home life, you're really asking the impossible, right? Like,
Yeah.
yeah, they don't even have a frame of reference for what a healthy life at home looks like. How could you possibly tell them what to change, or how could they understand what they need to change? Like, that's got to be an incredibly sad and frustrating experience to deal
Yeah.
with. Mm-hmm.
And it's tough because nobody that I work with, but there is a sort of a special kind of parent that you will encounter sometimes where it's like, we're screwed here.
Yeah.
We're nothing we do is really going to work because you can offer family counseling and a person can refuse.
Mm-hmm.
And there's that dynamic of like, I'm not the one with the problem, they're the one with the problem, fix my kid.
Yeah.
And it's that's hard, that's super hard. And actually the ASAM criteria, which is like the drug and alcohol, like what level of care should somebody be in, level 6 is recovery environment, and hits on exactly that. Like, you could be doing real well in all the other 5 dimensions, but if where we're sending you is a place where you have free access to use drugs or you have whatever, like, that matters. Makes it real tough.
Yeah. I think, yeah. Something,
Yeah.
something that I say I try to do this, but I don't really have many friends left anymore. But like if you know that like a friend has like certain mental health issues or whatever, it feels like learning from that friend's therapy, like techniques or whatever, to reinforce what they're learning, or to reinforce what they're doing. That kind of stuff is like exponentially more helpful than just that person working on it solo or something, because the environmental factors are so important in determining the successful outcome of any like psychologically therapeutic technique or whatever.
Yeah, that's one of the things that I can find a little bit cringy sometimes about like when folks are posting on like, mental health positive, like here's how to be a positive ally, and stuff like that. Not knocking anybody who does that too much. But it's like the simplest things are often that, like, hey, what kinds of things are you learning about that are really helpful? Like, what do you need from me as your friend? Like those types of things are ultimately way more effective in somebody's treatment and all that stuff. Yeah, that's one. Um, Real quick, I think we're probably winding down. I'll let you get to the rest of the stuff. Just drug stuff real quick. Uh, so the reputation of MDMA
Yeah.
is not very pure. There's a bad reputation of being the least pure thing that you're going to get.
Oh, yes, I'm definitely aware of this. The reason being, some drugs
Ah,
are like,
no pushback. Okay.
yeah, some there are so many other combinations of drugs, especially amphetamines, and then amphetamines with different like groups attached to them that are close enough to MDMA and are so fucking cheap to make that I think MDMA is like the most commonly faked drug, because you can get pretty close with a lot of other types of chemicals, research chemicals, or just other amphetamines that people will cut it with a whole bunch of shit so that they can sell like 10 times as much. Yeah, for sure. Yeah.
And just to be clear, like, you know, while I am a drug and alcohol counselor and that stuff, like I do have some serious issues with how you view drugs in the States. Specifically, it's like you are either an addict, in recovery, or normal. And once you are an addict, you never get to be normal again. And that kind of rubs me the wrong way a little bit. So I just I also want to make it clear that there's not like a serious business bias coming into play.
It really bothers me how bad all the education is on drugs too. I hate saying this, and it actually bothers me so much. Finding good information on drugs is incredibly difficult, and if it comes from a .gov site, out of rule, I don't trust any of it. It is so damaging that all of the .gov information available on drugs is so fucking dog shit. I hate that so much. Like, let's say that I want to do MDMA, and I'm going to do it because I want to do it, right?
Yeah, well, for sure.
What is a safe dose, right? What are my right? And when I go to like a .gov site and it's like MDMA means you have an elevated risk for STDs because you're more likely to fuck somebody. What the fuck kind of information is that, right? Or like, if you take MDMA, you might overheat and die. Really? Is that really a concern? It's like, well, yeah, it is, but like, you have to do a decent amount and you've got to be partying and like, there's a whole bunch of other shit. I hate that you can't find good information on any drugs. And even today, like people's understanding of like what's super addictive, what could be super harmful, what is the effect of what. I didn't know any of this when I was like 30 years old. And I feel like I'm a relatively intelligent person, and I didn't know dick all about any, like when somebody says like cocaine, that sounds like some serious shit to me. Like, if you're doing cocaine, you're a crackhead. You're fucking addicted to drugs. But it's like, no, that's not necessarily the case at all. And it's stupid to think that. That the lack of drug education understanding it drives me fucking crazy. But I don't know how old you are, but I was a dare kid growing up, 100%, you know? And
we're roughly the same age. I'm a little older. For sure. Most famous failed public policy thing, as far as I know.
Yeah, Jesus.
And I was thinking of actually what you were saying about like getting the STDs thing. That reminded me of Dare, because a lot of Dare stuff was like, wait, people are going to give me drugs for free? They're like, wait, people are going to have sex with me if I do MDMA?
Yeah.
Hell yeah.
Oh, sure. Yeah.
I might get an STD. Sweet. It's tough. And, you know, it's one of the things that I get to do trainings for drug and alcohol stuff. And one of the things that I like to ask in my training when we hit a specific drug is like, what's a lot? Because there will be sort of this perception about like, well, any amount of meth is too much.
Yeah.
And it's like, there's a very big difference between somebody who's going through an ounce of meth a week and like an eighth of meth a week.
For sure. And then especially like when you're talking about like meth is horrible and everything is bad, blah, 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 blah. And like people don't even realize that if we want to talk about other amphetamines, the physiological response can be pretty similar depending on what you're talking about. Because it's not like meth is in like this whole class of horrible fucking destructive drug all on its own. And then you've got, you know, like these other prescription Vyvanse, you've got these amphetamines, dexamphetamines, all these other things.
Yeah.
Like, I think that having that understanding is good, probably. Whether you're doing drugs or want to know about drugs or whatever. Oh, and for public health discourse, something that I brought up with a guy that was just here before. I don't know if you're listening to that conversation.
A little bit, just the tail end of it.
Something that I learned over the past few years is the reference range on healthy things in your body can be very, very, very wide, right? And what an overdose looks like can be very different from person to person. So,
Jesus, yes.
Yeah, so
shocking.
Something that was very frustrating to me was when George Floyd died, people were very quick to say, look, he's got this level of fentanyl in his body. He was overdosing 100%. And it's like, hold on. An overdose is not measured by you take a blood sample and boom, that guy OD'd. Like an overdose implies a physiological response to a certain amount of drugs that might vary from person to person for a variety of different reasons. Yeah, that discourse around George Floyd is like, oh, look, he had fentanyl in his body. He's dead. It's like, no, hold on. You know what? Yeah. Oh, it's very, 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 very frustrating.
Yeah, there's a certain type of personality and a certain type of person where, you know, just doing drug and alcohol assessments with folks, sometimes it's like, you know, somebody, I was drinking a half gallon a day. It's like, probably not. Like, I'm not that. But there's a certain type of personality where it's like, I know that you're not lying to me, and dear God, that's a lot of drugs.
Yeah.
Where someone will be like, yeah, I used to take like 20 Xanax.
I
And
know
it's just
people that
like,
do bars of, it's like, holy shit.
yeah.
Yeah.
And it's like, wow. And I don't think you're lying to me.
Yeah. And they'll pair it in the worst ways too, because they'll pair it
Yeah,
all
with
with like
alcohol.
cocaine and alcohol. Yeah. It's like, wait, what the fuck are you doing? Yeah. Jesus.
Yeah. No, totally anecdotal, but about 90% of the folks that I do assessments on who have overdosed, it's always been alcohol and Xanax. Like the heroines and the meths are pretty rare, but alcohol and Xanax is big. But that's also like location wise as well. That's probably a lot to do with where I live,
Sure.
more than anything else.
Yeah. And I think that unfortunately, I think because of like, I'll just say the popularity of certain artists and everything, I think that Xanax got wildly popular, I believe, over the past like 5 or 10 years when Xanax using benzos started to get way, way, way more popular as a recreational drug. This is another drug education thing.
Yeah.
It's so toxic. It's so horrible. Okay. There are 2 types of drug users. I don't know if you noticed this. There are people that do like psychedelic drugs, and then there are people that do pharmaceutical drugs, okay? And something that I hear from people that do pharmaceutical drugs is they always say like, oh, I don't mess with any of that. Like, I don't mess with like LSD or mushrooms. Like that stuff is really scary. But like the Xanax and all this shit, like this is safe. I get it from a pharmacist. Like I know who I get this from. Like this comes from like a pharmacy. Like this is safe stuff. And it's so wrong.
Where I come from, it's very much like the heroin people versus the meth people. Like the meth people are like, I would never touch heroin. Like, I'll do meth sometimes. I'm never. And then the heroin people are like, yeah, I do some heroin. I never touch meth. Yeah, the whole like natural versus unnatural thing is silly. And if anybody feels like I'm maybe coming off as like a little bit too permissive with drug and alcohol stuff, here's the thing that I do think is probably pretty helpful when we talk about drug and alcohol stuff, which as far as I know, last time I did the research, and again, I didn't come with my studies, sorry. Like, one of the things I found to be very fascinating was no drug beats 50% addiction rates. Or if they do, they're like right at 50%.
You're talking about like one-time use become addicted or just regular use become addicted?
It's not very geez, my memory's too fuzzy to be very clear about that, but I feel like it's just like ill-defined but use. And I feel like what can be very helpful about knowing that is sort of like, if you do something and you like it so much that you want to just keep doing it, you should probably pay attention to that.
Yeah.
Like, because there's a lot it sounds strange, but there's a lot of folks who might use a drug and they'd be like, I hate this. Like, I tried MDMA, it kept me up all night. I felt like incredibly uncomfortable. I felt really itchy. I don't know why people like this. Whereas another person might be like, this is the freaking answer. But I only want to do it once a month or less. And then another person might be like, I'm going to start selling this so I always have it.
For sure, yeah.
Like,
anecdotally, MDMA was the first drug I did where I was like, oh my God, I understand now why people get addicted to drugs. Holy shit.
Yeah.
Especially my day-to-day life is really good. But if I had a shitty life and then I did MDMA, I'd be like, bro, I would do this shit all the time. This is the best escape in the fucking world.
Yeah.
Yeah, for sure, yeah.
And I had kind of like, I had struggles with alcohol in life, and it was sort of like, man, 100% of the time I drink, I'm trying to get drunk. There is no beer after work. So that, that was like a pretty loud, like, hey, you probably shouldn't do this, pal. Like, this
is shit, is that a bad thing?
Not working so hot for you. So anyway, just throwing that stuff out, drug wise.
One of the things that I really like is kind of like general rules of thumb. You can always correct me if I'm wrong, by the way.
Sure.
I believe that in the DSM, when we talk about like addiction, there is a lot of shared criteria, I believe, for assessing whether or not somebody has an addiction. And I think a lot of these things are
it's the same for every drug. It's just the name of the drug changes.
Yeah, exactly.
The same 11 criteria.
Oh,
yeah.
Okay. Oh, I didn't know it was the exact same. So yeah, they're even better, right?
Yeah.
And I think that these are good things to look at for every type of behavior. We don't need to talk about drugs. Yeah. So like some of the shared ones are like, basically it all is like, is it impeding your ability to live a normal life? Are you compromising relationships? Are you unable to hold down a job? Are you not able to take care of your body, like being clean? Are you missing important engagements to have these types of experiences or whatever? I think that
do you have a medical condition that it would make worse, but you choose to do it anyway?
Yeah. Big one. And I feel like having an understanding of things, because a lot of people got really ass mad when, I don't know, it might have been the WHO declared like gaming addiction was a real thing. And I remember that like I read their whatever criteria they listed, and I was like, yeah, this is the criteria for any addiction, like gambling addiction. Like all of it looks the exact same, and you should be aware of these things. If gaming is something that like you're skipping work to game, you're not able to hold down a job, you don't have friends anymore, you're not taking showers, it's ruining your life, you can't maintain healthy relationships. Like, yeah, this is absolutely an addiction that you should be aware of. Yeah.
Exactly, and as you know, and this is what we kind of got the rundown in grad school is that it just barely missed the DSM-5. So it will almost certainly be in the DSM-6 whenever that comes out. But DSM-5 they just didn't have enough information to feel good about being like, it's a diagnosable thing. But there is more data out there now, so probably will be. Yeah.
Okay, this might not be directly in your wheelhouse. Okay.
Okay. Oh boy.
What do you feel about DID?
Oh, man, that's oof.
Well, I maybe ask more specifically. Do you believe that dissociative amnesia is a real thing? Do you think that this is an actual thing that people experience?
This is a
hard one.
I don't want to make anybody feel bad. Okay,
never mind. All right.
Gotcha. Yeah, I would say like dissociation. I think for sure is real.
Sure.
And dissociation is a very common thing. A model that I use called internal family systems deals with this idea that like we have a family living with inside of us. We need to learn how to talk to the different parts, which sounds a little bit wild, but it's essentially like Inside Out the movie, but like inside of ourselves. So like, describe the anxious part of yourself. What does he look like? What kind of clothes does he wear? How old is he? How does he feel or think about things? And it sort of like gives you an opportunity to view yourself in a different way so that you can like
interesting.
All that stuff. Super cool model. I would love to learn more. It's like $1,500 to do a one session, like one, I don't know, training module, and there's 3 of them.
It almost, I doubt it borrows from it all, but it almost sounds a little bit like, have you ever heard of something called transactional analysis?
No, I don't think so.
Oh God, this is so long ago, but it's like the idea that anytime you have an interaction with somebody, you're either having like a parent, adult, or child interaction, and the goal is to always have adult interactions and not like parent-child interactions or child-adult or something. It sounds similar to that, yeah. But
that sounds kind of old school. That's neat, though.
Yeah, very old school. So probably total bullshit, but it reminded me of that.
Yeah, we gotta be careful with that because the old school, like one of my pet peeves is when people like take a dump on Freud. Because it's like, his stuff is dated, but man, you can read some of the transcripts of his sessions that he's done, and some of them are brilliant. They're just like, holy cow, like this is a cool session.
Wait, what do we mean by brilliant? Let's be careful there when we talk about Freud.
Like the intervention that he uses and the way that he talks to the person and sort of like the micro skills of like validation and stuff like that.
Okay. So he was maybe unintentionally hitting on things that later on would be like validated as like therapeutically important.
Yeah, sure. Right. Yeah, okay. but when we don't know much, we're like, it's all about penises and poop and wanting to do your mom, and it kind of gets like reduced a lot. And it's I just find that to be a little bit sad because it's like some of this stuff is neat.
Sure.
Like there's stuff that we can sort of glean from it.
I think that the most important.
I'm not a psychoanalysis person.
Yeah. The most important takeaway that I had from Freud was that Freud is somebody that is invaluable because he was the first person to treat psychology like an actual discipline in science.
Yeah.
Start writing stuff down and that was like the most important contribution. And then there's other stuff, but it can get a little bit crazy. Yeah. We're talking about the frigidity of women or the 7 stages of psychosexual development or whatever that don't really have like a
that. Yeah, exactly. But anyway, so we got on that. So DID. So I don't know. I would say that I have known a lot of folks who question the validity of it.
Gotcha.
And there are folks who are going to say this is absolutely real for me. How dare you invalidate my identity? I'm going to be a coward and say there's a lot of folks who sort of question it a little bit.
Gotcha.
Because there's sort of this idea. Have you heard of like integration?
I know the word means. So maybe.
The idea of integration in the context of DID was sort of this idea about if you have DID, we need to work towards integration. So we need for all the parts to come together and become like one solid identified you.
Okay, gotcha.
And that's interesting. Yeah,
No underlying biomechanical explanations, no
Yeah.
good models, no good clinical data, no good
Well,
reading.
you were watching the video on the woman who did the sex cult
The
thing.
satanic sex shit.
Yeah,
Mhm.
and it's sort of like, man, I must have read this in like 2007 or something like this, but I read an article about at that chunk, it's because I was still in college, so it must have been around 2007-ish, that it was like, psych degrees were the most fake degrees in the country.
Okay. Is this like an opinion or a fact, or what do you mean when you say that?
No, it's like I want to say I read it in like Time
Okay.
or something like that. That was like, at that time, like it was like a very so there can be enough mystique around it, and there can be enough like I don't necessarily know what you're doing. Like you can get away with some alarming stuff.
Sure.
And I would say anymore nowadays you can't really. Like if you say some type of remarkable claim, somebody's going to want to do a study on it. Somebody's going to want to check your numbers, and so that's good. We obviously want to have like a very valid field, but yeah, some of that stuff is sort of like there's no way to check it, as well as the fact if I want to say like it were DID to be a thing, the occurrence rate is like in the fractions of a percentile.
Sure.
Like you will probably never work with that person, which is again, it's not meant to invalidate it. It's just like it would be an incredibly rare phenomena.
Yeah, for sure.
Yeah.
Um, let's see. Is there anything else?
I think I.
Oh, I was gonna. I guess on that thing. I guess this is like
Mhm.
another thing where a complaint about like I feel like as a psychologist you would know this.
Mhm.
The aspect of like you if I ever ask, do you know a term? Really what I'm asking you is like, do I have a good understanding? I'm not trying to condescend. It sounds so stupid. But like,
Yeah, no.
if I say like priming, my
I
understanding.
was actually going to give you some cheat codes for arguing with psych students if you ever want to do that.
Yeah,
One
sure.
of the
Always.
cheat codes is like ask them what their therapeutic model is and see if they can explain it to you like coherently in 4 to 5 sentences.
Gotcha.
That might sound mean, but if anybody's like listening, I like the spicy content. I like the argument sometimes. I'm old enough to know that I enjoy a little bit of drama. So
Sure.
yeah. Anyway.
Oh yeah, the satanic sex cult, that stuff where like I would be so afraid as a psychologist. Like I feel like stuff related to priming, even as a streamer, that's something that's like always in my mind. Where I know that just the way that I phrase a question is absolutely going to change dramatically, like the response that will be elicited. And there are so many cute little studies and in-class experiments and shit that teachers have done that have been like researched, Zimbardo's published about, blah, blah, all these people, right? Where it's like, yeah, like, oh my God, like the way that you can prime a question so minutely can like dramatically vary the results. Yeah, that satanic sex cult stuff was like, how can you not stop and think for a moment, like, man, am I hardcore priming the fuck out of this person to give me certain answers? Feels like something you should just be aware of.
I get to make myself look great. Like I would say you do, and I would say most of the folks that I know do, and you do think about that a lot. And sometimes I'll even bring it up a little bit in a session where I might say something like, "Okay, so I'm kind of tainting the narrative here. Like I'm injecting an idea or an opinion that didn't exist. So I just want that to be known that might change what we're going to do here."
Sure.
Because I don't know what people think about counseling or therapy, but it's not advice giving. You don't give people advice. You don't tell people what to do. Well, some people do, but you really ought not. And so it really is about kind of like understanding how somebody thinks and feels and how somebody does their stuff. Like that's the goal, is to understand like how you came to your thoughts and what it might take to change them. So yeah, you really do have to be conscious of things like priming. You have to be conscious of the power dynamic. Your implicit biases are huge. Like, am I going easy on this person because I like them? So I'm just not going to ask them tough questions? Or, is this person kind of lower on the socioeconomic status? So I don't really care if I show up like a couple minutes late to sessions. Like, those are things you got to think about.
Sure. Okay, here's something. Might be a hot take for mine. Maybe we find disagreement here, okay?
Oh, boy.
I don't know if you heard this one. So my view personally of therapy is that like therapy it's essentially like a collection of tools that a person can acquire if needed to kind of like aid them through problems in life. So if you have issues that come up and they're just confounding you constantly and you don't know how to overcome them, therapy is a chance by which you gain tools to gain control over yourself and your life.
Okay.
So something that, I don't know if I want to say I'm critical of this, but like when I see somebody that is in when I see that like people who are doing therapy for like 10 or 20 years, that feels to me like, I don't want to say there's a failure there, like the person has failed, because legitimately there might be like people that do need that level of help. But do you think that the goal of people in therapy should be eventually to not be in therapy anymore? Or
Oh,
should it be?
absolutely.
Okay.
Everybody, that's like day one, like day one grad school. Your goal is to work yourself out of a job.
Gotcha. Okay.
And so, but God, that's a tough one. It's tough because you connect with people and you meet with them, and they're doing really great, and it's hard to have that conversation about like, so what are you thinking?
Yeah.
Few more weeks, or what do you want to do?
How do
You know,
you,
because
or yeah, go ahead.
people meet their treatment goals. You know, people are like consistently meeting treatment goals. Life is going good, and you do kind of have to tone it down when that happens.
When it comes to things like medication, or even, yeah, therapy in general, like, is it ever your place to suggest, like, maybe it's time we stop this, or what is like an appropriate level of like discomfort? Because anybody that's leaving medication or even therapy
Yeah.
probably is going to have to endure some level of discomfort to do it. Is it ever, do you ever feel like it's your job to push them in that direction, or do you just allow them to do as they do? Or yeah, that seems like a really difficult thing to deal with.
Yeah.
Yeah.
Oh, that's an easy one. You know, you're real chill about it. And going back to sort of the idea about like you know, the psych students and mistakes that might be made. Like there's the APA code of ethics that ideally, you know, while you might not have them memorized, you would kind of know what they're all about.
Sure.
And it's things like, you know, supporting autonomy, non-malfeasance, fidelity, all that stuff. There's two others that I can't remember right now because I
Okay.
haven't memorized. But you know, I just throw it out as like, hey, what do you think about medications? If you want, I can make a referral to the psychiatrist. If you're anti-medication, totally fine. We don't have to explore that. What do you want to do? And then they kind of guide it from there. And then once they're on medications, I'm not a psychiatrist, but you know, we would do like monitor like how you feeling, how does the dose feel, you know, what are things you want the psychiatrist to know, because they will see that person less frequently than they'll see me.
Sure.
Meds are a deeply personal one. You know, some people view it as cheating. I think that's very sad. Yeah, I don't know. One of your takes that's not bad, but it's a little interesting. Is sort of talking about like, you know, when you kind of go on about like rates of medications are going up as a sign that maybe we're a little bit less happy.
Well,
And
yeah.
and you may be right there, but what I would say is like, how do we know that that's bad? And
It's
I don't
bad
want
that, wait, it's bad that we're less happy, or?
how do we know that if an increase in medication necessarily conflates to less happy? And
Oh,
of course,
sure,
there's
because the level one response is going to be like, well, maybe it's that there were a ton of people that were unhappy, but now we're just discovering it.
right.
Sure.
Yeah. And there's like different ways. I mean, it's been studied. This is like that would be real easy to look up. But and also I realize that makes me sound like I'm like throwing pills down people's throats, which it's a personal decision. If folks want to take meds, I say go for it. And if you don't, like don't do it. It doesn't mesh with your stuff. Yeah, but that's a pretty easy one.
Wait, so for the medication part, how, if somebody is on medication and it appears to be helping them, and then their life is in an area where they appear to be relatively stable, do you just open that conversation and you're like, hey, maybe it's time we lower the dose? Like, because it just seems weird, because it's like you've got a person, and I guess I would almost view it as like, I want to be very clear.
The easy part.
Oh yeah, okay, go ahead. Yeah, answer, go.
I don't.
Oh, this
That's
is just
a conversation between them and the psychiatrist. That is not my job.
Okay, gotcha. Oh, well, that's cheating.
Yeah.
You cheated your way to that conversation.
I have cheated my way out of that one. That is not my place.
Gotcha.
Which, you know, saying that a little bit tongue in cheek, but I do think that that's kind of an important thing for folks to know is like what is the wheelhouse of a counselor and what is not. Because sometimes people kind of do dip their fingers into things where it's like, I understand that you want to be helpful, but that is not really your place to do that. Or you're kind of going, you know, outside of your role right now, and that's maybe not the best thing to do.
I think I'll push you or ask you on that. A psychiatrist's job is to prescribe drugs. However, like a therapist and a psychiatrist generally work pretty closely as a team, right? To monitor like the response and everything, right? So you are going to have a lot of input there in terms of should this person be on a particular drug or not, I would imagine, right?
Yeah, well, for sure. Like the psychiatrist, like that conversation will be mostly around like, do you think this person's drug seeking?
Oh, so you're
Or
just looking for contraindications, basically. You don't actually.
yeah, like, do you have any reason to believe that they should not have this medication?
Gotcha.
And most of the time, the answer is like no.
Hmm.
Like it's not coming up or whatever. Sometimes it'll be like, yeah, this person's been addicted to benzodiazepines in the past, and
Hmm.
I would be a little bit worried if you were to prescribe them a benzo. But there's a lot of options for medications.
Hmm.
So yeah, I was chuckling a little bit because it's sort of like it's not like, well, psychiatrists are probably doing well, but it's not like we're making like big money
Sure.
referring back and forth between us.
Hmm. Here, here's a
Uh-huh.
question related to drugs, I guess.
Yeah.
What do you do when you have somebody that is incredibly, like, very suicidal, but whoa, Jesus Christ, sorry.
What?
You just fucking abuse me, okay? You're being abusive, okay? You're being abusive. What do
Cold
you-
and callous.
Yeah.
Ouch.
What do you do when you have somebody that is suicidal, but they've had a family member that's had like an adverse reaction to an SSRI? I say adverse reaction, but somebody, I'm thinking of Byron as an example, Reckful the streamer.
Okay.
So he had a brother that had, I think he was on SSRIs and he committed suicide. So obviously you know this. I'm repeating for the audience, right? But sometimes when a
Yeah.
person starts an SSRI, it can actually make them more suicidal, right? This is a possibility.
Yeah.
When you have somebody that has a family indication like that, or a family contraindication like that, but they still seem suicidal anyway, if you can't pursue drug therapy, at any point, do you ever say like, fuck it, we'll try it anyway? Or is it like strictly off the table? Or this is a very like specific like diagnostic thing
Yeah.
or whatever. Yeah. I'm just curious what your general thoughts are. I'm not asking you to like say,
Sure.
to be really clear, you're not telling people like, oh, even if you've had this, do this, whatever. Just as a general question.
No, I'm going to give my coward's answer. Like, that's a conversation between them and the psychiatrist.
Gotcha. Okay.
But I will also answer your question as because hot damn, that is a tough one.
Yeah.
I actually, had an experience in my family of a family member who had that experience. Like, they took a medication, they were very suicidal, and they completed the event. And it's just sort of like, God, you would, when you love somebody, you would hope that they would know, like, okay, one of the side effects is you're going to feel suicidal. All right, you're feeling suicidal. Please put two and two together. But it's tough. It's more complicated than that. And, ultimately, you got to respect the person's autonomy to the best of the ability. I think one of the things that was kind of interesting, I don't want to move too far off, but just hearing like the story about like the psychiatric hospitalization, man, I know that people have some bad stories. Like, God, that is just not my experience at all with that kind of stuff. Like, I much more often meet people who were not in a psychiatric hospitalization as long as they felt like they needed to be, as opposed to them being held longer than they thought against their will.
Are you talking about
Like,
people that have been like, is it Brady acted or whatever?
Well, here we call it the Johnson unit, but the
Okay.
ED, emergency department, like
People that have been
suicide.
committed against their will, basically, after a crazy, yeah.
Right. Which is pretty weird, but most of the time people they try to kick, get out of here. Like, we need to free up the space. It's rare that I hear about folks who are kind of held longer than they want it to be.
Gotcha. Do you think that might be reflective of that you're in a relatively better off, it seems like, economic community, or do you think that's like the general experience across the country that most people appreciate that committed
It's
thing
got
more?
to be different cross country. I must believe that because I know that it's been brought up before. Like, the United States, there's like a bunch of different countries inside of a country.
Yeah.
And like one state's view of something could be like totally different than another. And getting state parity for like standards is remarkably difficult. It's
Yeah.
hard to do. And there's a lot of stuff about like not wanting to do that. So yeah, I totally believe that a different states or counties MO could be like, no, we hold the people. And mine is just sort of like, no, get them out of here.
Gotcha.
They're not suicidal now, so away with you. And it's kind of sad.
Gotcha. Okay. Interesting.
Yeah.
Um.
I think the last thing I just wanted to sort of comment on was sort of the idea about like the good diagnosis versus the bad. So like one of the things that like stings me a little bit is hearing the term like clinical depression.
Okay.
Because I think we all kind of get what somebody is talking about when they say that. And this might just be my own stuff that, I need to think through. The way that I tend to hear that is like there's the good depression and the bad depression.
Okay.
And it's like you've got clinical depression, so you've got the real one.
Mm-hmm.
And I just find that to be very frustrating because it kind of turns like mental health into like a pissing contest a little bit.
Yeah, I feel that way. Yeah. I think that there is a great utility in understanding the difference between those two things. But yeah, again, because of the borrowed language, like,
Yeah,
oh, wow, I just have normal depression like a shitter. Like, what right do I
yeah,
have to be
exactly.
upset or that? Yeah, I
Oh,
understand.
I got loser depression.
Yeah, it might
Bummer.
have sounded like a kind of a meme earlier, but I truly do feel like one of the most damaging aspects of mental health is the shared vocabulary. I feel
Yeah,
like that does an unbelievable amount of damage towards people's understanding of mental health issues because so many of these words are borrowed from normal language and like, you know, oh, OCD, like, well, OCD actually, I guess, isn't borrowed. People just co-opted it from psych and like, oh yeah, I have
sure.
OCD. I always clean my
Which
room
is
every
so
day.
sad because hot damn is that a cruel condition? Like that is an awful thing to live with for
Yeah, for
anybody
sure,
who like
depending.
truly lives with it. It is terrible.
Um, Yeah, yeah,
Anyway,
yeah, or any, or, yeah, or somebody that has like you know, bipolar disorder, or oh,
right.
here's I guess here's the thing. We kind of had like a roundabout, almost maybe conversation about it earlier, but in a more serious conversation,
Hmm.
people with borderline,
Yeah.
um, do they? So I've heard this repeated a lot. I believe it based on my personal experience. Do people with borderline face a great deal of pushback in clinical settings? Or I say pushback, but like I'll be more blunt. Like people are scared to take on like borderline patients because they can be so difficult to deal with, and they just end up not doing it.
Yeah.
Yeah. What is? Yeah, I'm curious what your experience is
There's
with that.
a real interest. I think we're on a good track with that societally. Man, that was like the belief for
Mm-hmm.
a chunk of time. That like I would say, you know, because I came up in like 2009,
Mm-hmm.
and just in like that 12 years, a lot changed. But you know, I'm working with people who've been doing stuff since the 90s, you know, up through 2009.
Mm-hmm.
And there was like apparently it sounds bizarre, but there was sort of this idea about like you cannot treat a borderline person, you don't want to work with borderlines. I would hear stories about like clinics like refusing borderline people,
Mm-hmm.
and it's just very strange. And that's kind of like the backstory of DBT a little bit was, I believe, that you know Marsha Linehan, the lady who invented the model,
I think it was
was a
actually
person,
for like borderline was
yeah,
one of the main
for
things.
borderline.
Mm-hmm.
Which makes a lot of sense because, you know, the big component is like, how do you act differently than you feel?
Mm-hmm.
Which would be an incredibly important thing for somebody with borderline to work on. Um, so yeah, that stigma is there, like for sure. Like the behavior set can be very challenging for sure. Like I've worked with a couple of folks who have struggled with it, and you know, those folks, you know, they might call you out in session, which is cool. I like that stuff. It's tough because it's sort of like, you know, it's a lot of stories about like blowing up on other people.
Mm-hmm.
And that's hard because it's like, you know, you're really working on that. I know you're doing good stuff. Sad to hear that there's another explosive thing or, you know,
How?
whatever.
Okay,
Hmm.
here's a very difficult question. Okay.
Hmm.
Maybe even not even an appropriate question actually. If you feel like you know somebody
Yeah.
and you feel like this person maybe has a cluster B personality disorder, how the fuck do you even begin to approach that conversation? Is it possible? Is there a responsible way to do it? Can you ever? Or like, I'm super curious. Yeah, what is your feeling on that?
Uh, my answer is going to be really unsatisfactory.
Oh boy.
This is my job. I love it.
Mm-hmm.
That is none of my business. That is like if it was somebody that I was really close to,
Mm-hmm.
I might sort of push them towards counseling. Just
Mm-hmm.
be like, hey, counseling can be super helpful, all that stuff. But I think that part of the issue, especially when you get into the online stuff,
Mm-hmm.
is, you know, it's drama. It's juicy, it's fun, it's interesting, all that stuff. And there is a component, you know, of, you know, me drinking a glass of water and playing Factorio and listening to stuff on
Oh,
the
sure. To be
shift tab that's like, why do other people care so much about another person's diagnosis? Yeah.
Yeah, to be a little bit more clear, I'm sorry.
Yeah.
I didn't necessarily mean like
Oh,
in kind of an online meme sense. I mean, like, let's say that you have a close friend and you feel like, bro, you are fucking borderline or you are bipolar.
oh
Yeah,
my
you have,
gosh, I
yeah,
totally
yeah,
misheard that.
yeah.
My
I'm sorry.
bad.
I don't mean like the meme. I mean
Whoops.
like you have a real life friend and you're like, and it's more than just like you need to fix your. It's like you need to get help. How do you broach that conversation? Is that even possible? Yeah.
Oh, geez. Oh, that's embarrassing.
Sorry. No,
Whoops.
no, you're fine.
So
You're fine.
totally different answer
Hmm.
now. Um, firm boundaries. Very firm boundaries about like, you need help. A lot of validation, because a key theme about somebody who struggles with borderline is going to be that fear of abandonment. And there are folks who struggle with borderline, and there's some documentations of some conversations, and you can kind of like predict when it's going to swell a little bit, like, oh yep, we got a little bit of abandonment coming in, this person's going to amp up. And then they do. And again, this is not to belittle anybody who struggles with borderline. I think learning like your patterns, what makes you tick, can be super helpful. um, but then very firm boundaries with that person about, like, these are the things that I can do and these are the things that I can't do. And that's really tough, because folks, a person who struggles with borderline might seriously push those boundaries. And I think that that can be the hard thing for that person in your life, is there can be a behavioral component, again, not trash talking anybody with borderline, where that person will like follow you. Like, you might be like, I need my space, or I need whatever, and they will follow you to the next room, or they'll follow you through your space. And that can be very difficult.
Sure.
So yeah, thinking about what boundaries you can do, what you can commit to, what you can't, being very firm about it, being repetitive about it. Yeah, those types of things.
Okay, now I'm going to ask you a bit of a more meme. Well, no, I shouldn't say that. This isn't a question. So I'll ask you something a bit different then, but kind of similar.
Yeah.
I genuinely believe that I interface with a decent number of schizophrenic people. Is there any possible way to have a conversation with somebody like that in a way that encourages them to seek help, or is that not possible? Or have you ever heard of any of the experiences that I've had, or maybe you think?
For sure. Gosh, I listened to that one. So like, I feel like I have a healthy relationship with your content.
Okay, gotcha.
I generally listen to your YouTube videos. I don't really watch the streams.
Sure.
But yeah, man, I was listening to the one where you were reading out the letter that the person sent you. That just sucks, because you're incredibly limited at what you can do. Folks who struggle with schizophrenia generally tend to prefer to be alone. Kind of the biggest pieces that pop up, I think a misnomer about schizophrenia is sort of like people seeing and hearing things. What's much more common is sort of like beliefs.
Yeah, feelings of either persecution or paranoia or grandiosity, or center of big conspiracies, and
almost always follows the big three, which is God's, alien, and government. People trying to take...
shit, I didn't even know that. That is so fucking true, though. Yeah.
Yeah. Oh, you never heard of that before?
No, but
yeah.
For people that email me, it's always like we're some form of like angel or angelic thing or whatever, or that's a big thing. The alien shit, the crop circle stuff, like random articles related to aliens doing this thing. And then government sometimes weaves into there, but the God and the alien one, I've seen that a lot. Yeah.
Yeah. And people trying to put thoughts into my head, people trying to take thoughts out of my head. There's cameras in my apartment. I know that they're in the light socket. That stuff is much more common than like other stuff. Folks who struggle with schizophrenia generally, I'm repeating myself, generally want to be alone, so they don't really want to be social. That's not everybody, but that's kind of a thing. And I don't envy your position as a streamer and a public person, like, haven't said, because there really isn't much. I mean, if you were to, like, I could conceivably see, you saying to somebody like, hey, I'm seeing some warning signs, maybe you want to think about getting some help, and that person could be like, oh, they got to him as well.
Sure, yeah.
And that's not to belittle or undermine anybody who struggles with that. Again, it's a really rough condition. Medications can be very helpful, very, very helpful, if not necessary, for folks who struggle with schizophrenia. Throwing that out there. Yeah, that's just not a good position for you to be in. That sucks.
Gotcha. Okay. Well, so that was totally useless. Thanks. Sometimes I interface with people, sometimes in adversarial ways. And I feel like, I don't know if you heard any... I tell me to stop with this every. I hesitate to bring up specific examples because I don't want it to sound like I'm asking you as a professional in your professional capacity to evaluate anybody. So if you ever feel like I'm crossing that line, feel free.
Disclaimer: pure entertainment.
Sure. Well, yeah, but the disclaimer means nothing if we actually go to those areas, right? Yeah. So I just want to be responsible. Yeah.
Fair.
There are people that I've interfaced with one person recently. If you haven't heard of them, I guess it helps me more because then I don't feel you have more of an attachment. That she basically claims that she's uncovered like a global gamer rape force, And she's like, she always says that she's in contact with, like, I've reported this to detectives, I'm in contact with these governments, and I know these people or whatever. And she is adversarial towards me, and it's hard to just say, like, hey, you're psychotic, get help. That doesn't seem to be very effective. Yeah, I'm curious when I have, because if it's just people that email me, it's whatever. But when you start to get into adversarial positions with people like this, it becomes more, now I have more of a prerogative to actually get this person to get help. Is there like a way to approach a conversation like that where you can, like, kind of gently massage a person towards seeking that kind of help? Is there any way to get them to realize that something might be off, or is that just an impossibility?
Yeah, that's a rough one. I would say, yeah, like, so I guess from the liability standpoint, I would say you put it off to somebody. And what it may be, as simple as having, like, a sheet of resources that you could, like, somebody else would do about, like, hey, I hear what you're saying. I hear that this is really important to you. Like, I'm a little concerned about some pieces, and here's some resources for things that you could get connected with in your local area. And again, it's just a tough one because it's like, this person is seeking you out.
Well, unfortunately, it's even a little bit more. It's like they're not only seeking me out, but they're seeking me out and then threatening to, like, destroy me by exposing me as part of, like, the global. And then combine that with kind of the political landscape where, regardless of anybody's stance on it, if you have a woman saying that she's uncovered, like, a male rapist, a part of a global conspiracy, blah blah blah. Well, I think. Oh, I'm curious if you're talking about this. I've used the terms and some of the vernacular around schizophrenia quite a lot recently when I'm interfaced with some people. But it might be the case that I'm always waiting for somebody to email, like, you're totally wrong on this. It's not that at all. If you ever feel that way, feel free to tell me. I feel like something that bothers me with some people with certain, whether we're talking about cluster B things or whether we're talking about schizophrenic people, is people have this impression that these people wander the streets like zombies, sounding insane all the time. But it feels like, in my experience, that in talking to, even with people with schizophrenia that have some of these delusions, that if you're just having a normal conversation or if certain topics don't come up, they actually sound incredibly lucid and super normal and super sane. They don't actually sound out there all the time, depending on where the topics go. Yeah, does that feel
real
accurate?
People.
Yeah.
Yeah, and I think that to that effect, like, I think that, I would say that, one of the things that I think is important is just, like, moving away from pathologizing as much as we can.
For sure.
And so even if it's, like, to the point of, like, being able to compartmentalize, like, this might be a little bit of the schizophrenic pieces coming out, but this is the real person right here. I think it's kind of like a much more compassionate way of viewing some of those things.
I agree with the compassionate part. So I'm coming at this more selfishly, though. So my issue is, when I spoke to this person initially, I knew a lot of background information about them, but I didn't let that on. We had about a 2-hour conversation. For the first hour, I didn't breach any of the topics that I knew would kind of trigger some of the crazier things that I don't like to say crazy. Some of the more delusional sounds like an insult too, though, but I didn't entertain any of their delusions or go into those topics. And for the first hour, the person sounded, like, incredibly intelligent. Like, my whole chat loved this person. They're like, oh, this person's, this is super true. Like, they're really smart. They're into this. And it wasn't until I breached some of the more particular topics that I knew would kind of trigger their responses, then everybody's like, whoa, this person is absolutely out there. So it's a little bit frightening to me that somebody with that level of delusion could theoretically present a story to somebody and come off as incredibly lucid the entire time. And then if it ever comes back to me, I'm left saying, well, okay, listen, I know they sounded smart, but this person is, like, schizophrenic, right? It makes me sound like I don't want to use the term crazy making, but it sounds like I'm actually doing that. Like, oh, no, trust me, that person's crazy. So I guess
my question would be, like, what is the concern there? Because when we talk about, like, I think schizophrenia is very much one of those things that ideally would be destigmatized quite a bit. Like,
for sure.
There are doctors and teachers and, like, all kinds of folks who might maybe struggle with schizophrenia and are kind of going about their lives managing it. What would you say the concern is that you're having?
The concern would be this person presents a pretty compelling story to other people that I am, like, part of a big rape conspiracy and I'm covering it up and banning her from places to try to silence her, uncovering that, basically. And because she sounds, like, relatively lucid and everything, it comes off as being pretty legitimate. Yeah.
Yeah, I see. So they're saying I'm
glad it's entertaining you, but
it's not funny.
Okay.
It's not funny, but I feel like you're saying, like, they're lucidly expressing that I'm part of a rape cabal.
Basically, yeah.
Sorry
Or
about
that I'm being complicit in covering it up, essentially. Yeah.
Yeah, which sounds somewhat like an oxymoron. Lucidly describing that. Yeah, it's oof. Well, and I would say like, uh, you know more about this stuff than I do.
Mm-hmm.
Like, what boundaries do you feel like you need to set, and what makes it hard to do so?
Well, so this is the issue that I have as a public
Yeah.
figure, unfortunately.
Right.
I have been gifted with extreme resilience. I'll marvelize myself here, okay? So I have Batman syndrome, right? I can deal with anything. I'm fine. I don't give a
Right.
fuck about anything. But the problem then is that when I have adversarial relationships with some people and they realize that, then they start targeting people around me. And now all of a
Yeah.
sudden, my boundaries aren't enough.
Yeah.
I might not care what this person ever says about me or what they said to other people. I don't give a fuck. But
Yeah.
I do care what my surrounding group of people think about me. And if they start reaching out to those people, my boundaries are now insufficient to deal with that. And it becomes a very difficult
Yeah.
situation to deal with. Yeah.
And that's a terrible one, and unfortunately, I don't have much feedback on that one because that
Kind of a unique.
it's extraordinary.
Yeah.
And I mean that sort of like in the proper sense, like it's an extraordinary circumstance that your average person would not have to deal with.
Because ordinarily you can just not talk to a person and your life is
Right.
much more compartmentalized, if it's a
Yeah,
coworker
and the
or-
reaching out to people in your personal life, like just to say it out loud, it probably doesn't need to be able to do it anyway. Like that's a pretty significant boundary violation. And if that's happening, like obviously huge red flags.
Yeah.
But hard.
Oh, I guess here's like a general. I always like to get this type of feedback. I have my own thoughts, but I think it's good for people to hear, and maybe I improve my thing. How do you decide for yourself what is a healthy personal boundary versus what is an unreasonable expectation for me to burden someone else with? Yeah.
Sorry, I'm laughing because I feel like I know where this this one comes from.
Well, wait, maybe you might not know actually. So
Oh,
I'll
okay.
say,
Maybe not.
in a public sense, this might come from the one girl that I've dealt with who obviously seems like she has unreasonable boundaries. But I'll say in a personal sense, the way that I engage with people sexually, romantically, and on a friendship level, I have certain expectations that I have for my personal relationships, but then like I'll have people tell me like, this is not realistic. Like you are mind fucking people or you're drawing people into relationships that are untenable, like, or they can't maintain these. And so I kind of have to sit back sometimes and wonder, like, do I have like unreasonable expectations for people? Or is the way that I approach things like, I'm curious. I'm not asking you, I guess, for a therapy session, but like, how do you, how would, I'm sorry.
Let's crack this open. No.
But I'm curious.
I'm gonna
because
give opinions on it.
Yeah, go for it. Yeah. How do you decide like, okay, this is a reasonable boundary versus this is like a super unreasonable boundary? Yeah.
Yeah, I would say a big thing is if you're comfortable walking away. Because
okay,
I feel
but
like
this
that
is okay. Fuck. So this is the one I have to push back on. I am this is my standard response because anytime somebody gives me this thing where they're like, I don't think this is fair, my number one response is like, oh, okay, well then fucking leave. I don't give a fuck. So, but I feel like that's probably do you really think that's like the healthiest way to it? Because I can cut and leave on any situation. I don't give a fuck.
Here's the thing.
Yeah.
You are allowed to be a jerk. You're allowed to be mean.
Okay.
You're allowed to be unkind. And if that works for you, like, and this might sound like I'm talking trash right now. I really don't. I don't mean that, but it's sort of like my boundaries are important.
Sure.
And it exists to protect me.
Sure.
And hopefully the people around me as well. But first and foremost, it exists to protect me. And so if somebody is sort of like pushing that boundary. This is actually something that will pop up in session a fair amount with other people, which is like you can learn a lot about somebody by how they treat your boundaries.
I agree with that to some extent, but then it's weird because I feel like I'm playing devil's advocate against myself. So
you are. It's weird.
Sure. So the thing though is that like we can probably agree that there exists unreasonable boundaries, right?
Yeah.
So we'll say, I'll use an extreme one. My boundary is that if we're going to be friends, I'm going to constantly call you the N-word. That's my boundary, right? Now, that's a boundary that I might set that I genuinely feel comfortable with and it makes me happy and blah, blah, blah. But I imagine that if we had a session and I talked about this boundary and, I'm okay not having very many friends and I don't because of this boundary. And, I imagine I would imagine you would say something like, okay, well, maybe this is a boundary that we don't need, that doesn't serve a greater purpose, that's not a healthy boundary. Like, yeah, or would you just say whatever boundary you want, you can...
No, you talk about the idea of sort of like violating other people's boundaries as a
Mm-hmm.
problem, things that pop up with like too much closeness.
Mm-hmm.
So when we're too close to people, we run the risk of sort of like violating their boundaries. Like, oh, I'm comfortable talking about these things, so you must be as well.
Mm-hmm.
Um, and there is a component of that of like acceptance. So it's sort of like if I accept the outcomes, then we're kind of done here. But if I don't accept the outcomes, then that's important because a big thing to think about is like if this is not a problem, then why are we talking about it? Like
Sure,
if
I
you're
understand. Yeah.
comfortable accepting the outcome of an action, then we're done here.
So then the
But if
question
you're,
would be, if you do
yeah,
you feel like your boundaries are causing you to be unhappy by, let's say that we have a boundary that drives people away from us. Well, is that
right,
upsetting to you? If it's not, then okay, yeah, all right.
yeah, um, yeah, and I'm not gonna, I am not going to give you feedback.
Sure, that's fine.
But
All
that
right.
would be, yeah, like if something is rubbing a person the wrong way, like I don't like these outcomes,
Mm-hmm.
well, then it's worth investigating. But if you're fine with the outcomes, then you're fine with the outcomes. Which, is always like, again, kind of going back to it a little bit, is a curiosity that I have. When I listen to folks, and I kind of get it, I suppose, but I just sort of feel sometimes like, boy, man, it is really tough for folks to leave. Um,
Yeah.
and,
Holy shit.
yeah, and I'm not talking about like yours. We just recapped this, so I don't want to hit it again. I'm not talking about
Mm-hmm.
your situation, like where you're kind of trapping a public person,
Mm-hmm.
but just in general, like man, it can be really tough for people to leave. It's just
Yeah.
like
So
you
something.
set your boundary, now walk away,
Mm-hmm.
now go. But I get it; it's hard.
Mm-hmm.
That's not lost on me how hard that is.
Yeah, for sure. That's something that I mentioned before in my early 20s. I take that for granted because it's very easy for me to cut when I feel like it's not working for me anymore. But then obviously with my relationship with Melina, most people I don't think can do that, or it seems to be the case. It's very hard for me to understand that type of thought process where people will stick around in negative situations. But I understand that it happens, and there must be some, whether it's maladaptive or whether it's like ordinary healthy social human behavior. Yeah, it seems like it's very difficult for a lot of people to do that.
Yeah, I mean, there's reasons why we break up with people, and there's reasons why friendships end,
Mm-hmm.
and some of those get to be acceptable. And I would say, like, we talked about like the safety. The other big two when it comes to boundaries are like flexibility and connectedness. So, like, can I be flexible when I need to be flexible? It would be a thing that a person might talk about.
Sure.
Yeah. Um, awesome.
Okay. Well,
Well, jeez, I appreciate you indulging this time. It was a lot of fun for me. Like I said, I enjoy your content. I was a little bit shocked that you emailed back.
mhm.
I don't think that's mean, but it was cool. And yeah, any final things kind of before we get there?
No, but if I ever say anything dumb that you disagree with, or if you hear anybody else say something dumb and I don't pick up on it or catch anything, yeah, feel free
Mhm.
to always shoot me an email, and I like the feedback is good.
Yeah, no problem. Yeah, I can definitely do that. And hopefully this was a positive experience with a mental health person as opposed to some of the stranger ones you've had. Between
Yeah,
myself and the last fella you talked to. Hopefully that's
yeah, yeah. He was really cool too. Yeah,
changing perceptions as well.
gotcha. Yeah, yeah, true. We need those more positive perceptions of yeah.
Awesome. Right on. Well, thank you so much and you have a good night.
Yep. Have a good one.
Bye.
Bye. Lunatic, absolute crazy person. Mm-hmm. I feel like I've done so many things today. It's not as late as I thought it would be. That's good. Okay, hold on. There's another person that gets triggered by some of the shit I say, so maybe she'll give a different opinion. Do you actually respond to emails, or do you just read them? I read it. I don't want to say this, but I read everything because a lot of it is trash that you guys email me, and then I'll respond to things that are worth responding to. Okay. Well, I read everything that gets to my email and everything that Eris forwards me, but she might not forward me everything. So, please more talks with actual experts. That was a nice change. I guess like this sounds like I'm gonna jerk myself off a little bit, but it's a little bit disappointing to me that I feel like, because I like to dip into talking to experts because it makes me feel like I'm getting better opinions. I hate that I feel like I disagree so much with my peers or like other politics streamers or YouTube people. And then I feel like if I dip into like the expert world, like it feels like we're very, very much in sync. So I guess I wish at some point I would very much like to talk to an expert that super disagrees with me on a lot of things, because these are like my biggest learning experiences where, oh, here's a guy, he knows a lot of shit on this topic, and damn, he says I'm wrong about a lot of things. So that's cool. I like to get that feedback because then my opinions can evolve and change to a better position. Yeah, but it's really frustrating when it feels like a lot of the opinions out there and kind of like the YouTube and Twitter world and the Twitch world are just absolute fucking dog shit. And then whenever I talk to people that are more sane or more real world grounded, then yeah, it feels like we pretty much line up on everything. Yeah. Why do I have a tier 3 sub called 4 Doors More Whores? What are you doing, dude? I've publicly disagreed with your statements on STDs a number of times, but you stopped talking about STDs, so we're good. What do you disagree with? You're the chemist guy in chat. I think I can already tell. I'm guessing if you disagree, can I tell you what I think your disagreement probably is? And I'll probably agree, actually. It's probably you. I think I've said in the past, I'm like, STDs aren't that big of a deal. If you get it, it's not the end of the world, blah, 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 blah. And I'm guessing that your pushback would be, well, actually, we do have a lot of issues with like antibiotic strains of chlamydia or gonorrhea coming up. It is kind of a big deal. We should be more careful about preventing these types of transmissions of diseases because the antibiotic resistant STDs could have long-term negative effects on us that we should be more worried about. Am I close to it? Destiny, it's fine to agree. You don't need to fight all the time. It's not so much whether I agree or fight all the time. It's more just like, it sucks sometimes when I feel like, yes, gonorrhea is one of the most resistant pathogens we should actively avoid. Okay, gotcha. Yeah. It's not so much that we fight all the time. It's that it feels bad if I feel like my opinions are so, like, I feel like I give a lot of takes that are really milquetoast, are very non-controversial, but then I'll like blow people's minds. And people will like find me something like, you don't think we should invite people back to our house? You're rape victim blame. It's like, damn, really? Is that really? Or like people, I didn't ask either of these two guys about people being afraid of social workers. I feel like we agreed on almost everything else. I'd be surprised if either of them disagree that like people can absolutely be afraid of social workers. I should have asked that question. Oh, fuck. But like, I'll say something like, yo, people can be super afraid of social workers. Like, what? That's impossible. Nobody's afraid of social workers. They're just friends. It's like, okay, whatever. Milquetoast is the worst correct spelling of anything ever. I actually super disagree. I hate the word judgmental. I think there should definitely be an E in there. I'll even like auto correct it or whatever. I actually just hate this word, judgmental. I don't know why the E gets cut out. It drives me crazy. All right, you're third up. What's up? Hello? Are you on a cell phone? Is your internet connection fucky? Are you being held hostage?
Can you hear me now? Can I hear you?
Hi. Yeah, I can hear you loud and clear. All right, what's up?
Okay, great. Okay, so first of all,
Uh-oh.
fucking Ben, dude. I've wanted to talk to you about this shit for so long, and this motherfucker comes in and has all these amazing takes. Every take that I fucking have. Like,
well,
motherfucker.
That sounds like you should have got here earlier.
I fucking tried to. I literally tried to talk to you like 2 days ago and then yesterday, and I'm being like,
there's a lot of stuff going on, okay? There's a lot of
fucking stonewalled by you, and then Ben swoops in as like this fucking shit, man.
Well,
so unfortunate.
Okay, wait, give me 1 second. My whole other computer is lagging. I don't know why. Hold on.
This is what you get, okay? This is fucking karma.
Your mic is very fucking loud, okay? I need you to figure out how to turn it down a little bit, because I can't do anything on my other computer. It's completely fucking frozen.
Okay, I need you to calm down.
Okay.
I need you to calm down. Take it down a notch.
Okay, hold on.
How is it now?
You didn't change anything. Whatever microphone volume you're changing is not the microphone that you're using in your computer.
I just pulled the microphone a little further away from my mouth.
Okay, well, pull it farther away, okay? Put it across the
Okay.
room, okay?
How about this? Is this different?
Um,
Is this different?
a little further.
Is this different?
My computer is completely frozen. I have no... Hold on, just... Wait, why can't you just turn the volume down? Is that not possible?
What do you mean turn the volume down? Turn what volume down?
It could be the volume on Discord. It could be the volume in your control panel. It could be the volume in your settings for your microphone. There's like 7 different volumes you could turn down. What kind of microphone are you using?
I have a Yeti.
Okay,
Blue
so
Yeti.
there's actually on the back of the fucking Yeti, there's a gain knob.
Okay.
What about turning that one down?
Okay, is this different?
I
turned it
yes,
down.
it's different.
It's different?
It is different. Okay.
Good.
Hold
Manageable?
on. I've got... My mouse is working. It's just very laggy. I need to close Windows. Hold on. Not Windows, the OS.
I'm getting fucking triggered, Steven. Please fix your shit before I lose it.
Okay, guys, also, if you're on my Discord, everybody's trying to scam you with, like, fucking, oh my god, it was this... God, dude, Chrome, what happened to you? Holy shit! It is so hungry for memory now. Okay. Oh, wait, what is this? OBS browser page, OBS browser page, OBS... What is this shit? I'm about to just start... Wait, did my stream just start? I'm killing all of these OBS things. I don't know what it does. We'll see. Good luck. Boom, boom, boom. Okay, do you want to introduce yourself?
Yeah, so I just go by Tin. I got my undergrad in psych.
Oh god.
I'm currently, I know, slow down. I got my undergrad in psych, and I'm currently finishing up my master's program for psychotherapy and counseling. And I'm like really close to finishing my placement. So I've been doing therapy at like a trauma clinic.
Okay. What would you describe your
yeah.
therapeutic model as?
Did you learn this from fucking Ben, eh?
I'm
So
just curious. You said psychotherapy, so talk to me about it.
Yeah, so the clinical model that I use, so it's kind of different. So there's usually like these big name ones, so like CBT, DBT, psychodynamic, psychoanalysis, solution focused. Like there's this breadth of different types. The one that I operate from is like kind of this really weird niche thing that my supervisor created. But essentially, a way to properly explain it is it kind of uses like somatic based work. It has some elements of art therapy. There's some developmental neuroscience in there. And then there's some EMDR, if you are familiar with that.
Jesus.
Yeah.
Okay.
There's a lot.
How many times does the word holistic appear in your description of your...
Yeah.
I'm just kidding. Okay. No. Okay, that's cool. Gotcha. I'm sorry. I'm giving you shit, but okay.
No. It's funny because that's part of the name of like where my clinic is. I won't say
that's fine. That's okay. That's all good. Okay. You have had problems with, I think I've said in the past, that you want to fight about or have a general conversation about. Where do you want to go? Where do you want to take this conversation?
There's so many things. So you had like a really great conversation with Ben that I kind of took some things from. Mm-hmm. But like originally, I kind of wanted
Oh my god. Wait. It just said my OBS crashed, but I don't think it actually did. Okay.
Oh my god. Destiny?
Just...
Steven?
I closed so many random things in my task manager. I shouldn't have done it. Okay, just give me 1 second. I'm gonna...
Oh my god.
Chill. Should I restart my stream or should I just leave chat not working on screen, guys? What do you think? Okay. I'm gonna restart, guys. Hold on, it'll take me 2 seconds, okay? I know like 2,000 of you fucking ADHD dipshits are gonna fucking leave though, okay? Go pop your fucking Vyvanse and come back. 1 second.
Okay.
What the fuck? Hey!
Is that allowed? I also don't have much fucking time either, so clock's a ticking. fucking bedtime, okay? I got a bedtime that I gotta be. This is my schedule, all right? Okay, are you sure you're ready? You can figure out your OBS bullshit?
Yeah, everything's figured out. We're good. Okay.
Fantastic. Okay. All right. So I gotta look at my shit. Okay, so there's this thing that you had mentioned about like memory and like I think you had this take about how you don't think people can actually like forget when they've gone through something like traumatic or something along those lines. Is that ringing a bell for you?
Well, it depends. If we're about to argue about this, I'm gonna clarify the fuck out of what I meant. There's gonna be a
Well, we can. I mean, I
okay.
want to talk about it because based off of what I've learned
Mhm.
from my background of like trauma and stuff.
Mhm.
Um, so I can give you sort of like a breakdown of like the psychoeducation piece of
Okay.
trauma and stuff. So basically, there's are you familiar with the window of tolerance?
Nope. I can try to bullshit my way through what it means, but you could just tell me. Go ahead.
Go for it. Make a
You want me to
guess.
bullshit?
Yeah, bullshit me.
Window of tolerance. What is this in relation to?
What do you want me to give you hints?
Fuck it. Okay, if I had to guess,
Talking about psychology.
window of tolerance. There's probably like some spectrum of behavior that you can tolerate and have like ordinary emotional responses to, but past that window of tolerance, it's going to provoke some sort of or invoke some sort of traumatic response or long-lasting like trauma that you're gonna have to deal with in a more exotic manner or whatever. That'd be my guess.
Okay, you're actually like pretty spot on.
Okay.
So essentially, like exactly you said, you have this normal range of
Mhm.
like tolerable levels of emotion,
Mhm.
and when you have like that traumatic experience, you go outside of that window, and that's what's defined as like the traumatic experience. So
Gotcha.
it can go either like or stuck on off is like what we like to call it. So like stuck on would be like the anxiety, the panic, hyperactivity, startle response, unable to relax, restlessness, hypervigilance, like all this shit.
Mhm.
And then stuck on off could be just like depression, flat affect, lethargy, exhaustion, disorientation, dissociation is like a huge one.
Okay.
Um, so yeah, so that's the
And I'm
window of
guessing that
tolerance.
to this window of tolerance is probably going to vary from individual to individual to some
Yes,
extent.
absolutely. It's like
Okay.
super specific to individual.
Okay.
And like another thing, another part of it too is like
Something. Let me just ask: when you for
Mhm.
this vernacular window of tolerance, is this something that's going to be like well understood through all therapeutic models, or is it something a little bit more particular to like the psychodynamic or psychoanalytic model?
I would say that it's kind of just like a general thing.
Okay.
But it kind of depends too, because usually with trauma and like the trauma reactions,
Mm-hmm.
like that's where you'll see this like verbiage used a little bit more.
Okay. Gotcha.
Um, yeah. So moving on to like the hand brain model, like how we sort of like think about the brain and stuff like that. Like
Mm-hmm.
this is what I normally talk about with my clients, like teaching them about like their brains and how it's normal like to have these reactions.
Mm-hmm.
So like you have like if you were to hold your hand up as in like a fist,
Mm-hmm.
your wrist would be like the brainstem, and then you go up into like the palm. This is like the amygdala.
Mm-hmm.
Like I don't know if you're familiar with the amygdala and stuff.
Emotion or control. Yeah. This is like the you're talking about like reptile brain, like the brain stem, midbrain, and
Yeah,
then
yeah,
yeah, sure.
yeah, exactly. So like the amygdala is like that watch center that kind of like is always looking out, even if you're not like super conscious that
Mm-hmm.
it is. Um, and then you have the like fingers, the finger parts, and those are like the executive function, the neocortex, like that sort of stuff.
Mm-hmm.
And that's where you're going to have like your coping mechanisms, your logic, reasoning, that type of thing.
Mm-hmm.
And typically, when you experience like that traumatic event, your amygdala like, sends that signal, and then your like neocortex like goes offline. Like it
Sure.
doesn't function in the same way.
Mm-hmm.
And this makes sense on like a practical level. If you just think of someone who's having like a traumatic experience or gets triggered,
Mm-hmm.
they're responding in a way to like protect themselves. So like evolutionary
Sure.
reactions, right? Um, so that's kind of explains the psychoed piece. Um, and then typically with with that trauma, so like if someone experiences like a traumatic experience,
Mm-hmm.
the hippocampus, which is the part that sort of like
Memory.
integrates memories and stuff,
Mm-hmm.
yeah, that doesn't integrate memories in the same way if you're going through a fight or flight response.
Okay.
It operates to sort of help release cortisol.
Okay.
And I'm sure you're familiar with
Stress
cortisol,
hormone,
like
yeah.
stress hormone. It does a lot more than that, but
Mm-hmm.
yeah, so that impacts memory. Like just explaining that, like it doesn't function the same way. So
Sure.
when someone is going through that trauma piece, that can impact how they recall the experience like later.
Okay.
So do you still have that same sort of opinion? Like, how can you forget what happens? Like, if you're going through something intense, like, how do you forget? Like, does
Yeah,
that
of
sort of
course.
tie?
I think definitely I still have the same opinion. I understand. I feel like I understand some of the underlying structures or whatever, but just because we like codify memory differently, I feel like if I think about this in a lot of different levels, all of these would point towards the same like answer. So from an Evo Psych perspective, traumatic experiences would probably be the most important experiences, and it would behoove you to forget these. So I would think of it on that level. From a biomechanical perspective, I don't think your hippocampus stops recording memories. It seems to be that like these associations and everything will still be made. From like I guess from a clinical setting, you can still draw associations to traumatic experiences. Like people will have a traumatic response to some stimulus or stimuli that is related to a traumatic incident, especially noticeable
Yes.
in animals. So if an animal was abused by a male, you might have a cat that only likes women, stuff like that. So it seems like on all levels, I feel like traumatic responses are probably the ones I would guess that are codified in memory harder than any other type of memory. Now, that's not to say that they might not be prone to some forms of exaggeration or all of our memory is faulty to some extent. We don't build it byte by byte, right? We do it with associations. And I understand that, but the idea that you could have these like traumatic experiences and forget them seems to be like the most maladaptive way memory could ever work, like the most anti-survival, right? Like I just don't understand it at all. Yeah.
Yeah, so I don't think I agree with the I don't really know for sure, but
Mm-hmm.
based off of my experience, I don't think that there's sort of an experience where you completely forget entirely because you can get into some weird areas. I think you've heard of this sort of thing in psych where like therapists were implanting memories into people like that
Sure.
they didn't have.
Mm-hmm.
Um, so it's more of just how it operates differently than it would typically. So like for example, like dissociation is like super common with individuals who've experienced trauma,
Mm-hmm.
where they sort of have this, the best way to describe is like this out of body experience
Sure. To
where
be clear,
they
real
just
quick,
separate.
my understanding is that there's three terms, and all of these I don't think have like strict definitions. They're still argued about in terms of
Mm-hmm.
like what is dissociation, what is depersonalization, what is derealization. We have like ways to explain these, but it's still not the best understood. They're real things, obviously. So like ketamine is a dissociative drug, and you can induce a dissociative experience, and then people can have. I had a lot of dissociation after panic attacks. I would experience that a lot. So I have like a firsthand basis to understand it. I know there are drug ways to get there, but I think that the understanding of these things is still. I don't want to say contentious, but they're not like the most understood things in the world.
Yeah.
That's my understanding. Yeah. Okay.
Yeah, I would agree with that too.
Mm-hmm.
But from what I've seen from like my clients in particular, like dissociation, like they'll explain like a traumatic experience or something, and then they'll have bits and pieces in their memory.
Sure.
So there are particular parts of the experience that will be more salient,
Mm-hmm.
and their brain sort of latches onto, and then the thing that happens afterward is no longer something that's like it's no longer something they're holding on to because the thing that happened before it was more salient and it needs to be remembered more. So
Sure.
like that's one way that I could sort of remedy that like confusion there.
Mm-hmm.
Um,
And
and then
I
like
totally agree with that. From a personal
yeah,
level, I've had a few traumatic experiences where like the traumatic event I remember very, very, very well. The traumatizing parts of it, but I couldn't tell you like, like an hour later what was going on, or maybe like things related to it, like what was a particular person wearing or like what was on the wall, or I couldn't do that. But I can remember like those particular events very, very, very well.
yeah.
Yeah, but I wouldn't expect it to be like a photo perfect recreation of everything surrounding it for sure.
Yeah, and it could be like you don't know what led up to that either. So
Sure.
like that might be really problematic if you're trying to like testify in a court and then someone's like, "Oh, well, what happened before then?" It's like, "Well, I don't fucking know. I just remember what happened because that's the most salient thing." Like
Mm-hmm.
um so yeah, I guess we just both like agree on where that is. Is there any other questions about that?
I don't think so. Well, damn. What did you feel like I super? My big issue was I don't believe without an injury or without drugs, I don't think you can forget something entirely. Or maybe in highly exceptional. No, without the presence of a disease, drugs, or an injury, I don't believe that there are traumatic experiences that you just completely and totally forget. I don't think
Like
that
in
there's
their entirety, like from start to finish.
yeah. So like for instance, like you might not remember the events well or something, especially if time has passed. You might not remember events surrounding things, but I don't believe you just completely forget traumatic experiences. So like you were raped multiple times as a child, you just boom, you don't. It's all gone from your brain. You don't remember it until a psychologist, brings it out of you. I don't believe that any of that. I don't think there's any
Yeah.
models for that or yeah.
Yeah, so that I feel like that's pretty tricky as well too, because sometimes people who've experienced trauma, they don't like their coping mechanism is like avoidance and like not talking about it ever. And sort of that can happen where like let's say I'm talking with a client and then like something will trigger like a memory because they've never really gone down this like cognitive path or talking about this particular thing in this particular way. It might trigger that like memory path that has always been avoided, and then that might spur up those memories. But I don't think that like that's not completely forgetting. Like that's still accessible on some level.
I could totally believe that somebody has a very traumatic experience related to a person and they don't think about it anymore, and maybe they don't even realize it's traumatic, and then through conversation in the future when you start to explore that, when they bring that up, a whole bunch of emotion comes to the surface that they didn't even know. I could believe that for sure, 100%.
Yes. Yeah. Okay. Yeah, perfect. Okay, so we totally agree with that. That's great.
Okay.
Another thing. Oh God, there's so many topics. I have to choose wisely because I can't.
Go for the most contentious. What are you the most mad about?
So okay, so this is another thing. I guess this is more topical. So like, the thing with Rittenhouse, you had
Oh boy, yeah.
you had made this fucking dumbass take where it's like, oh, if anybody has PTSD in their Twitter thing and they're making fun of Rittenhouse, that they like you can totally like write off everything they say
Yeah,
about
they're fucking
PTSD.
fakers. Amen.
No.
They're either fake. Okay, I'll amend that statement. Okay.
Okay, please do.
Sure. I'll give a second thing. They're either fakers or they're subhuman fucking trash that doesn't deserve to be believed anyway. So it's one of those two things. I'll amend my statement there. Okay. Is it more agreeable now or?
Oh, okay, a little better, but still not great. So like, the reason why I bring this up is because typically I think that's like the opposite of what's happening. So, usually with people who have PTSD or trauma or whatever, what I've typically seen in the research, and I could be proven wrong about this, because I am not like I'm not fully registered or I'm not an expert, but based off of what I've seen, people who have had these experiences typically have lower compassion, lower rates of like perspective taking, than people who haven't. So it would make sense to me how these individuals who have like, oh, PTSD in my profile or whatever, that they haven't worked through that and they struggle sort of taking that perspective of Rittenhouse because they lack those types of characteristics. So that's one version that I can see. Like, does that make sense? Would you agree with that?
So this is like the therapeutic, or this is the nice way of saying they're subhuman trash. We're saying that they lack empathy for reasons that might actually be directly related to a trauma. So
I don't
rather
agree with
than
the behavior of them being like, oh, fuck this motherfucker.
But rather than like this is evidence of them not having experienced these things, what you're saying is on the contrary, it actually could be like direct evidence of them having experienced these things.
Yes.
Right? Sure. Okay. That might be possible. I still think most of them are faking losers, but okay, go for it. I'll note it. I'll remember.
I'm glad
this.
I shifted you a little bit on that.
Sure.
So.
Another perspective to consider.
Right.
Okay, what else?
Okay. I feel like this is like 20 questions. So, DID.
All right. Do you think dissociative amnesia? We kind of just talked about it a little bit, but yeah, go for it. Hit me up. What do you got?
So, let me back up a little bit. My clinic that I'm at right now, they don't really have a super diagnostic focus. So, we have a lot of assessments that we run through with clients, but we don't use it as like a way to sort of diagnose an individual. Like, you have this, you have DID, whatever. You have PTSD, this and this and that.
Okay.
Because we're trying to sort of look at the trauma and then work from the root, as they like to say, the root. And then typically, like I've only experienced really one super complex like DID type individual, and this individual had severe trauma, like severe trauma. And the way that the way that my supervisor has explained it to me in that sense is like these individuals have separated parts of themselves because they've sort of had to.
Mm-hmm.
Like it was sort of that survival response, and the way that they cope with what they've experienced. So like they may have like a child version of themselves.
Yep.
They may have like a parent version of themselves, and they lack being able to properly like connect them together,
Mm-hmm.
because it made sense for them to separate when they were experiencing trauma when they were like a kid, and
Yeah.
that's just sort of
And this is the
yeah.
explanation that I've heard. I just think it's total bullshit, but I've heard this. Yeah.
Why do you think it's bullshit?
I don't think that the structures exist for this to be possible. I've never heard it or seen it demonstrated, and I don't want to
What
like
do you mean
appeal.
structures exist?
I don't think we have separate compartments in our brains for different personalities
okay.
that don't communicate with each other. I don't think that we don't have the like
No,
absent
okay.
your Phineas Gage or something. I don't think that a person can do this, right? Yeah.
No, so I think I understand where there's like sort of separation. So
Okay.
you're saying that there's not this concrete separation that is like quantifiable in a sort of sense that we can analyze with maybe like a scan or something we can see in like that sort of aspect.
Mhm.
Whereas something that I'm saying is like they've made sense of their reality in this particular way. It doesn't necessarily mean that they actually have particular splits. It's just this is how they've learned to cope with it, and this is what they're doing. Does that make sense?
Yeah. So we're kind of. I don't want to use this word as an insult. So I don't mean it if it sounds this way. So we're kind of shifting this from like a real physiological description of something to something a bit more, I'll say psychosomatic, but I don't mean that in a derogatory manner. Is that a little bit more agreeable? So like this
Yeah.
is how. Okay. Yeah. Sure. I might be able to buy that. Sure.
Okay, yeah. So that's the way that we look at it.
Uh
Like
huh.
we don't look at it in the way that people like to say it is
Because
because
I'm
it
putting
sounds
100%.
pretty unreal. Like
Mm-hmm.
yeah, so like the way that we think about is like parts work. So um the usual way, like let's say someone's experienced trauma when they were a kid, typically the way we try to get at that is like, oh, a child version of yourself, like what message would you like to offer like that child version of yourself, and
Okay.
typically that child version of themselves hasn't fully been able to like express what they were going through at the time, and that's sort of carried through to their adulthood.
Sure.
So like separating that part, and that's sort of where the DID I think comes into play. So yeah.
Sure. I'll build a bridge and then I'll destroy it. I can accept that level of, I can accept that explanation for why somebody would present with something like DID. But I think I would still reject the concept of DID because I think DID takes a much stronger descriptive foundation than what you've explained. Or than how you're understanding it. Because like if somebody were to say DID is a person might experience trauma through this idea that they have like different personalities or different aspects of them that they've kind of sectioned off in their mind, I could agree with that. But the claims of DID seem to be much stronger that are
Yes.
foundationally resting upon this concept of dissociative amnesia that is highly contentious and that you actually have like almost, or I would say actually a physiological splitting off in the brain of different like personality compartments that present at
Yeah.
different times. Yeah. So like, so I can kind of buy your explanation for DID, but I still wouldn't call it DID because the DID claims are much stronger than I think what you've
Yeah,
said.
I can agree with that. Like
Mm-hmm.
yeah, there's like
Just say it.
yeah.
Let it go.
I
Yeah. Tell us how
no,
you feel. Yeah.
well, to be honest, I've never seen it that extreme. Like the ways that I've seen it is in the ways that I've explained it. Like
Mhm.
it's not. I don't like to call it like DID. Like we don't even call it that at the clinic. It's
Mhm.
just sort of that split of identities or the split of parts of themselves and yeah, coping. So
Gotcha.
yeah, I think we
Okay.
agree on that. Okay. Um.
All right. Well, what else?
Oh gosh. Let me see. Let me review the notes. Um. Oh, something you fucking said too.
Oh, man.
That's a
Okay.
good thing. It's a good thing. You said something so insightful in your conversation with Ben is like that separation between like the cognitive or like the reasoning part and like
Yeah,
the
and your
emotional
emotional.
part.
Yeah.
And like bridging that gap is so hard. Like you can logically know that you're not experiencing a threat,
Mm-hmm.
but you'll feel like there's a threat.
Yeah.
So that's something. So that experience on its own, like within my clinic,
Mm-hmm.
the way that that's sort of targeted is through like imaginal exposure or like visualization. Um, I know that kind of sounds like floofy,
It sounds like
but
some form of like mental exposure therapy, basically. But go ahead.
it kind of is, but it's a little bit more than that too. Like it's not
Mm-hmm.
just about the trauma, but it's also about like giving people different templates. So, for example, um, if an individual has the experience of not feeling loved, and let's say they have that rejection from another person, and
Mm-hmm.
then they can cognitively think like logically, oh, this person's probably not rejecting me, but it feels like I'm being rejected.
Mm-hmm.
The best way that we can sort of target that is to give them like a template of what they need and what they want, and try to invite the body to like imagine them getting that. So the reason why we do that is because it's based off of some literature that sort of has this idea that when you imagine something happening,
Mm-hmm.
your brain and your body don't technically know the difference. I don't know if you ever read anything about that, but like they've done like brain scans on individuals where um, they'll have them play like a music piece,
Mm-hmm.
and they'll have them imagine them playing the music piece,
Mm-hmm.
and the parts of the brain that light up are pretty identical. Like it's very hard to tell the difference.
Sure.
So that's where,
It almost sounds like you're trying to invoke like or we're kind of like harkening to the CBT model without like having like any of the physical stimulus present. Like you're trying to invoke like a certain feeling or whatever, and then see if you can get the behavior to
right,
change or
because
something.
we can't like actually have them experience love and affection, right? So the best we can do.
Jesus, but okay, yeah,
Okay, well, slow down. But like in a therapeutic
yeah.
context, like the best we can do is that visualization piece. So
Mm-hmm.
that's usually how we try to do that. And like a more concrete example could be like an ideal mother figure.
Okay.
So like have them think of like what an ideal mother figure would be. Like, oh, she's like loving, caring, compassionate. Okay, try to imagine what that would feel like, and really have them try to feel that, like
I am
be in that moment.
curious. Something that I would challenge this on is that, like, I
Hmm.
totally believe that research exists that shows you that thinking about an experience might be similar to of having had that experience. But I wonder how important it is to have ever had the experience initially to be able to think of it. So, like, for instance, if I were to ask you to imagine the coolest, like, post-rock new metal EDM song in the world, if you don't have like a frame of reference by which to imagine that, or more concretely like your example of like a
Mm-hmm.
mother's love, if they can't actually envision that, what are they modeling those thoughts or feelings after, or how can you be
Yeah.
certain that they're having those thoughts or feelings?
Yeah, so I hope I'm getting at this your question here. So
Mm-hmm.
like this is one of the hardest things with clients that I've worked with. Like one of the hardest things is like they don't have a template.
Yeah.
Like they literally have not experienced a mom that actually gives a shit about them.
Mm-hmm.
So whenever you sort of try to establish this with them, it's immediately like met with resistance.
Sure.
Like I can't imagine this, and it
I feel
triggers
like I've
some
outpaced him
experiences. They have
intellectually.
sort of intrusive memories of like their mom being like abusive or
Mm-hmm.
something like that. So the best we can do is just try to clear out those experiences first
Mm-hmm.
before sort of integrating this ideal mother figure. So once that's cleared out, once we process that trauma initially,
Mm-hmm.
it's less likely that those intrusions will happen when we're trying to create this ideal mother figure. And like logically, it can be like we'll just put out a list of attributes and qualities, and it can be as small as just like what would a face look like from a mom, like what would that just even look like,
Gotcha.
and then
Okay.
having them just picture that and then just trying to build on that
Gotcha.
until you can actually get to a point where they're like actually being like feeling the love from the imaginary mother figure. I know it sounds like really floofy, but that's just like the best way
Mm-hmm.
that I've seen it targeted, because yeah, you can't have them just have a mom that gives them love. Like it just doesn't work. So
Sure.
yeah, makes sense.
Yeah, I think so. Yeah, I understand.
Okay, yeah. Um, yeah. Anything on this topic you had?
I don't think so. Is there anything else outside that triggered you? Yeah, what do you got?
Oh my god. So people, like, you've touched on this thing about like the self-diagnosing stuff, and like people that say, oh, I have PTSD because I've taken this like assessment that shows me that I've had PTSD.
Mm-hmm.
And like that is like their way of sort of um objectively validating that their experience that they received was unjust.
Mm-hmm.
And I don't know, like that just triggers the fuck out of me. That I've seen happen to you in particular with Anna.
Okay.
So I don't know, like if you had any thoughts on that in particular.
That people are kind of looking to get some kind of credit by validating a negative experience with some official, like, medically diagnostic term or something.
Yeah, so like you can go, like the one I'm thinking of like right now is like the PCL-5, which is based off of like the DSM.
Is that the one with
Um,
like whether you've been in an abusive relationship or something, or
no, it's like, are you experiencing
oh,
in the
symptoms of
past?
PTSD?
Yeah, like have you experienced in the past intrusions? Are you having trouble sleeping related to this event?
Mm-hmm.
This and this and that. And then people will then use that as like, oh, I've been like, my experience is real,
Mm-hmm.
rather than being like, maybe I have a wrong interpretation of the experience.
Sure.
Yeah. So, um, yeah, I don't know. I thought you would have more to say on that, but I
Well,
guess.
what am I? I mean, obviously, people are using it in an improper way. I think that's stupid as fuck. Yeah, of course.
Yeah.
Sometimes I think, I guess if you're looking for more feedback, oh my god, all of your guys' donations got fucking dumped earlier when I had to restart my shit.
I've been on a crypto binge for months, missed
I
you,
fucked
buddy.
all of you so hard. I'm so sorry. Oh, sorry. I think that sometimes people have a negative event and your response to an event are two distinctly and completely separate things. And I think people don't realize that sometimes. And when you bundle them together, I think that it's easier sometimes to, depending on your goal, in this particular sense, we can say to vilify a person or to feel like you have some redemption. So, for instance, it might be the case that some innocuous thing that somebody does either traumatizes you or triggers you. Maybe that's possible. But figuring out that you have some like traumatized response doesn't necessarily mean that they did something horrendously wrong. The problem might be with your perception and then your emotional response to events. So you might be able to take some assessment, and you might actually be able to accurately assess that you are having an incredibly negative response to something, but that doesn't necessarily mean the other person has done something even wrong at
Yes.
all. Yeah.
Exactly. That's exactly what I'm saying. Yeah. And that's where you and Ben sort of talked a little bit about like how do you get a client to like think
Realize that their
about that
interpretation of
differently?
events or assessment of events is
Yes.
actually biased or incorrect. Yeah.
Yeah, and that's why it's really important. Like it's super tricky in therapy, like super tricky because you don't want to over validate someone. And that's what I think a lot of newer therapists kind of fall into that trap of, where it's like, oh, it sounds terrible. Like I can't believe that happened to you. Like this and that, and it can just reinforce that like victim sort of mentality.
Yeah.
Um,
I
and yeah,
Something more broad, and I guess it's a bit permissible because it happens outside of a professional setting. I would hope that the fact that you even said that it happens in a professional setting is a little scary to me. But like, people have this idea in their head that validation equals good, and I think that one thing that
yes,
people ultra do not understand is that a trigger to somebody can be just as bad as not compensating. Fuck. There's a specific word for when accommodating. That accommodations can be equally bad. That over accommodating somebody that has certain negative
yes,
reactions is an incredibly damaging and negative thing to do. And
right.
yeah, I don't think people understand that side of it all. And that bothers the fuck out of me because then you're in a world where people
Yes.
feel like they have to infinitely validate everything. And validation can be really harmful if you're validating an irrational response to something. Yeah, sorry. Go ahead.
Yes. No, fucking absolutely. Like this fucking triggers me so fucking much because I see it so often with like the people, like the people that I'm learning with, like the people that I'm around, like they'll bring shit up in supervision and they'll like mention about a particular experience, and then they'll say, oh, you know, like I can't believe she went through this, like this and this and that, and it's like, okay, you don't want to go too far into that realm. Like you want to be really, really, really fucking careful.
Yeah.
So
it feels like it's really hard. I don't know if this happens or sorry, finish. I don't want to cut you off. Go ahead.
No, yeah, so like that's just what I was gonna say. Like, you just have to be super careful. You have to like be really mindful of your biases, and like what you were saying before earlier is like people in psychology, like they learn about the biases but they don't check them. And it's super easy to get to like fall into that trap, and then it perpetuates the cycle, and then you have someone that always goes to therapists because they experience that validation, and then once they get actually a good fucking therapist that like gently challenges, tries to get them to reality test,
then it's a garbage
that
therapist
feels like
too.
attack.
Yeah.
Yes, and then they leave, and then it just makes it worse. It just keeps going. So
I feel like that. I feel like it seems like it's always a negative thing, or like validation becomes synonymous with good, and challenging becomes synonymous with bad. And I feel like it's just it is like such a destructive mindset to have, where any form of challenge feels like a negative experience, and you become like incapable of working through anything challenging at all. It destroys your ability to exist in the real world and interpret and deal with like challenging, like genuinely challenging events or negative events or whatever. Yeah, I think it's really, really, really damaging, really harmful.
Yeah, and it's super tricky too. Like.
Yeah, because you don't want to go to a therapist and it's like, I have a big fear of spiders. And you're like, well, good, because I've got 15 tarantulas and you're going to fucking have all of them crawl over your body. Yeah, you don't want to go like,
surprise,
overboard.
motherfucker.
Yeah.
Yeah, exactly.
But you'll get like these, maybe this is, I don't know how personal this will be to you, but like, so something that I've noticed more and more is, there's a form online called 2X chromosomes, okay? And the amount of validation that you see for hating men, and like, being like validating these insane responses where it's like every single man I talk to I feel like is a potential rapist, and I have all the, and everybody in the forum's like, yeah, true, it's totally true, yeah, one, or like it's not that it's all men but it could be any man. It's like, damn, like I don't think that type of validation is really not healthy. These aren't good ways to view the world. This is incredibly maladaptive. But if you even like so gently try to challenge any of these things in a public setting,
it's attack.
Yeah, there's like, it's victim blaming, your tone policing. There's like a million of these like terms that people have developed to kind of escape all forms of emotional challenge. Yeah, and then there's like an infinite number of loops that they can cycle back to where it's like, this is why I can never challenge this idea, and this is why I have this thing, and nothing you say will ever change me. Yeah, and it's, oh god, it's super, super, super annoying to see.
It's super fucking, it's so awful. It's so awful. And like the best way to like get around this, in therapy, besides just like having a good supervisor and good program, is just like you establish that rapport with the client, like the therapeutic rapport. That's why it's like super important. Once you connect with a client, the more they sort of understand that you're no longer like that threat, they can sort of start to become a little bit more vulnerable with you and take those challenges more as genuine instead of like attack defense type of thing.
Yeah.
And that's why I think you see that on like the forums and stuff. Like you don't have a relationship with these people, and immediately they're assuming you're coming from a place of like aggression, because they're probably operating on the frameworks that they've come from, like their own traumas, like all that bullshit.
Yeah, and it's frustrating for me sometimes too, because and I can't know, so specifically for Anna, I feel like she's lying about what her therapist says, or she hasn't given her therapist the whole story. But there is a part of me that's genuinely afraid. Sometimes there are toxic people that I deal with, and I can tell when I'm talking to them, I'm not just fighting with that person anymore. I'm fighting with them plus 5 friends that have validated their toxic behavior. And now it's like, it's over, because this person has all the positive reinforcement they need behind the scenes, or behind enemy or behind friendly lines or whatever. And whatever I say is now completely lost. And whatever their friends thought they were doing to help this person, that validation just completely made okay every type of like toxic or abusive behavior this person got. And it's like, fuck, like it's over at that point. Like you're done. And once that person, you said this earlier, once that person has received like I don't know what the actual number is, but I even remember this in high school feeling this way. Once it seems like a person has received a certain level of validation, they can't be challenged anymore, because any challenging friend is going to feel like a fucking enemy, right? Like, I've got all these friends that tell me I'm great, everything is fine, everything's cool. Why the fuck would I want a friend that's critiquing me all the time or telling me that this is wrong or bad? Yeah, it feels like a tax. Yeah.
Yeah, exactly. And that's like so damaging and just the fucking worst. It is the absolute fucking worst. And like I said, the best way to get around that is just really trying to establish that relationship with them initially, because the only way to get through to them is to have them try to at least think, okay, this person is trying to understand me, they're trying to work with me, they're not trying to be a threat, it's a safe environment. Like, what do they have to say, and really try to hear them out. But yeah, that's not going to happen over the internet.
Yeah, for sure. Especially if it's somebody you have an adversarial relationship with, of course.
Yeah, especially. Yeah, exactly. Yeah, but I unfortunately don't have, like, I have to go, but good talk. I do have more things. Maybe we can talk another time.
Yeah, sure. Let me know. Just message me. One more. Give us one more thing. What do you got?
One more thing? Oh, God.
We're doing the hippy dippy review after this, guys. Don't worry. We'll do it tonight.
Let's see. Okay, so kids, you mentioned before, like, kids running into the table, the parents' reaction.
Oh, that they mirror off of, yeah.
Yeah, so can you run that back a little, like, again?
Hold on. Run it back or play it back? Because I ain't running shit back about children. I'm a dad, okay? I'm a parent. No, it seems that, like, whenever kids get into certain types of events, they'll look to, like, role models close by to see how their responses should be to it. That seems to be a thing.
What do you think, if I can interrupt, what do you think would be the optimal response from a parent in this situation?
I think that, like, oh shit, hold on here. I'm just gonna make sure I'm not saying anything really fucking stupid. My emotional response would be, I think that the proper response is to just be chill, like, pick them up, make sure they're not hurt, and just be cool. But I think if I think about that a little bit more, it's probably really important for you as a parent to assess what's happened so that you don't come off as indifferent if there is some, like, real or perceived injury that happened.
Would you say anything to the kid? Like, what would you like, what words would you use?
I'm trying to think. Fuck.
I'm testing your parental skills.
Yeah, well, if I'm auditing my behavior, I think I could have done better, because my typical response, if Nathan, like, ran at anything done, I just, like, oh, come on, get up, you're okay, let's go. But that's probably not the ideal response. The ideal response would probably be, if he runs into something, would be to pick him up, make sure he's okay, and then ask him, do you feel okay? Are you hurt anywhere? And then if he says no, then send him off. I mean, I guess that'd probably be a better response.
Yes, absolutely. That is the ideal response. So, like, what you're trying to teach the kid is, like, when they get hurt, you're not overreacting, but you want to know if they're okay and see what they have to say about their experience.
Sure. So, because it's probably important, like, for them to know that you care about their experience. If they are genuinely hurt, it would be a really negative experience for that child to feel like they're not being taken seriously by the parent. And then, yeah, or,
like, they have to alter their emotional reactions in order to fit the setting.
Yeah, that too. So, like, okay, I hurt, but, dad tells me that, like, it doesn't hurt, it's okay. You probably develop bad habits.
Exactly, and then that's like pushing down your own emotional experience. They sort of learn, internalize, my emotional reactions aren't okay in this situation because of my parents, and, like, you're a child, so you're in a vulnerable state, so obviously you internalize that. So yeah, the best ideal reaction would just be, being curious, being attentive, and, like, being available, and then encouraging them to have, like, that emotional autonomy and that space for them to have that, so that they can say, like, whether they're feeling a particular way, that's accepted, and I can speak about my experience in an judged space. So yeah,
that makes sense.
Yeah,
I think something that I feel very intuitively, it's with humans in general, but especially with children. I don't know what is your approximate age? Do you mind me asking? Are you, like, younger or older than 30 or 25? Or
I'm 26.
26. Okay. I don't know what it is then. I get this weird feeling that like when people become parents, they like completely forget everything about their childhood and they act like they become different creatures. Or maybe that was just boomer parents. I don't know. My parents were fucking clueless when it came to like teenagers and children. I blew my fucking mind. I don't understand. Something that I strive for with my kid, and I notice it's really easy to lose this, and it's really sad, is having a child feel like they can approach you with anything that won't result in judgment or punishment is a really difficult line to walk. And if you lose that, then it almost feels like it's gone forever in a way that makes me sad. Or maybe it's just because I don't live with Nathan now. It's harder for me to rebuild that. But like something that really frustrates me, something I said I'd always be really open with my kids about, are challenging topics like sex and drugs. I feel like parents never talk to. I don't know if it was everybody's baby boomer parent fucking experience. My parents didn't say anything to me about either of these fucking things other than don't ever do them, right? And then I hear fucking horror stories. For guys, it's whatever. You get random boners, who cares? Your parents don't tell you about it. It sucks, but who cares? But for girls, you like have your first period and nobody prepared you. You're just fucking
bleeding and you
out of
no,
yeah, and you have horrible pain. Yeah, and it's like, Jesus fuck.
Yeah.
And I remember that so like when Nathan started to get fucking boners and would fucking, I probably shouldn't talk about kids exactly because whatever. Like things would happen, would have conversations of like, hey, like you need to understand this, you need to do this. I'd have no problems talking about these things. I noticed that his behavior regarding these things changed a lot at one point in terms of his openness to me. And I found out later on, there was some movie that his grandpa was watching, and I don't know what exactly it was, but there were like boobs on the screen or something. And he got like shouted at a lot for seeing that, I think at his grandparents' house. And ever since that one experience happened, it's been so hard to talk to him about anything related to it. And that actually, it infuriates me so much because it feels like just one incredibly negative or judgmental interaction relating to your adolescence can lose you so much trust with like your parents. Yeah, and it's like, fuck. Yeah, that type of stuff really drives me crazy. When I hear of children that can't talk to their parents about something without feeling like their parents will attack them, that's like the saddest thing in the world to me. I feel like you've fucked up so hard.
Yeah, or there'll be this huge fucking overreaction, and it's like, obviously the kid wants to avoid those situations. Like they don't want to be put in those experiences. Like what it's also the case is like you have to take into consideration the mental capacity of the child. Like they can't make the same mental conclusions that adults can, obviously. So when they interpret, I see boobs on the screen, I'm watching them, my parents freak out, I did something wrong.
Yeah. And it's like, and parents will do this thing where it's like, or they'll find out like their 14-year-old like drank alcohol or smoked cigarettes, and they'll lose their mind. It's like, bro, are you fucking serious? How long ago were you a kid? Like, why are you going to act like, and I remember my mom, I love her to death, okay? My parents were awesome, okay? But I remember my mom would say so much. Me and my sister would fight and she would lose. She'd be like, normal siblings don't do this, Stevie. This isn't healthy that you're always antagonizing. Normal siblings never fight. And it's like, now that I'm old, like, motherfucker, every fucking brother-sister fight. What the fuck are you talking about? Like, why the fuck did you make me feel so crazy for fucking trying to, fuck with my sister? Like, every pair of siblings does this shit all the time. Like, and I didn't realize this till older. Yeah, but
that phrasing, like normal siblings don't do that. Like, what is a child supposed to take away from that?
And then I find out growing up, and I feel like everybody has this experience. I found out growing up, like with my mom's fucking brother, this guy was a fucking crackhead for some of his life, and like beat the shit out of like his fucking uncle. I was like, Mom, your family was fucked. How are you gonna tell me this shit isn't normal? What the fuck is wrong with you? And baby boomers, something happened to those guys, and they like forgot everything about what it was like to be children. Like, were you like? I remember even being 12. No, I must have been 10 or 11. Like my sister would come home reeking of cigarette smoke. My older sister, and my mom would be like, "What were you guys doing?" And my sister would be like, "Oh, nothing." She'd be like, why do you smell like cigarette smoke? And my sister would be like, oh, her mom smokes. And I remember even as a kid thinking like, wait, really, Mom? Like she smells like grandma. She was obviously smoking all fucking night. Like, and my mom was like, oh, okay, that's fine. It's like, wait, what the fuck? I'm sorry, that's like a rant. Dude, some parents, like, I don't understand how they forgot everything about being a child. Yeah.
Oh, I know. And it's mad fucking cringe, and it's like really not healthy for the kid. Like it gets to a point, like this is kind of plays off of the idea that just because you've like parents sometimes they feel like because a child is being exposed to something that exposure will then result in them behaving in that certain way, in that particular way more. Yeah. When even if that is true, at least if you were to have that conversation with them, they're engaging in it in a like a safer way, right? So like a good example of that is like video games. So like if a younger kid is like playing a bunch of video games and you like constantly tell them to get off the fucking phone, like You can't be playing all these video games all the time, like restricting their access, this and this and that. It's just going to make them want to do it more. You can't have these conversations because they've learned that, you know, I can't come to my parent because I can't have this conversation with them because every time that video games are involved, they take this extreme stance. So like it just completely shuts down that avenue of like communication, which is the only place that a kid can properly learn like how to not only emotionally regulate, but like what is like the safest way, what is the best way to handle these types of situations.
Yeah, so, for sure.
Yeah.
Yeah.
Okay, but
okay,
I gotta go.
Yep. I appreciate the conversation. If there's anything ever yeah, you disagree with them or you want to chat again, just let me know. Okay.
Yeah, I hope I've sort of made a dent in that assumption that all female psych majors are like dumb fucks. So,
listen, this is my first conversation with you, okay? You could absolutely be fucking insane, okay? Don't think that I'm not here to evaluate your sanity right now, okay? I don't know what the fuck kind of shit you do behind closed doors, so, all right? But I appreciate it. So far, you're doing okay, all right?
All right, great.
Okay. Have fun. Be careful, all right?
Take care. See ya.
Never trust a psych major, okay? Not even Ben or the other person, all right? You don't know with these people, all right? They know all the tricks to make you believe them, all right? Okay. Guys.
Stop stuffing your fat fucking mouth.
Also, we're going to go over
Potato cropstony.
We're going to go over the hippy dippy stuff. We're going to do it, guys, okay? Let me use the restroom real quick. 1 second. You don't have any sponsored streams coming up, do you? Fuck, hold on. Let me check. What do I have coming up? I've got a...
Imagining a loving mom thing is basically hypnosis.
I feel like I've outpaced
Not for a while.
Intellectually.
I'll be right back 1 second. Let me use the restroom real quick.
This problem is what caused so many hurdles between me and my wife. Not to sound incel, but the over-validation is a more common thing in females.
Yo, Dest. I struck gold. I got that sweet, sweet unlimited funding from CIA. All I got to do is shill for some crypto money or some shit. If you want in on this, I'll send you my contact. Agent D. Pacman. Shout out to Bitcoin.
You're a fucking statistician!
Keep up the good shit, my dude. I'm heading out for the night. Love these conversations.
Ayo, Dest. And Matt, keep it a $1.350. I'm up pretty good today. Went big dick on the sleuts and hit 200,000. But I still need you to refund all my other donos. And since I'm a bro, I'll still suck you off. Bro job.
It's unreasonable for you to keep stealing Melina's Chip's destiny. You're a potato fecking her, and it isn't normal. I've been on a crypto binge for months, missed you, buddy. When I was in college, my mom, who's from Brazil, freaked out on me when she caught me smoking weed and called me a loser. Probably the worst feeling I've ever had in my life. I try not to hold it against her since we grew up in different environments. The imagining a loving mom thing is basically hypnosis.
Do you ever feel like an NPC in like someone else's life?
Who is he talking to?
Shut the fuck up, Mutin, alright? It's a stupid fucking meme.
Who is he talking to?
Thank you, Steven!
Who is he talking
Because
to?
I'm putting 100%.
Do you ever feel like an NPC and like someone
Who is he
else
talking
like...
to?
Thank you, Steven!
Who is he talking to?
Fucking dubstep.
Who is he talking to?
Shut the fuck up, Movement, alright? It's a stupid fucking meme.
Yo.
Yeah.
Yo.
Yeah.
Yo.
Yo.
Who is he talking to?
Because I'm putting 100%.
Cock.
You're a genius, dude!
Bababooey.
He's gonna kill me again. Shut the fuck
Who
up,
wins?
Movement, alright? It's a stupid fucking meme.
Who asked?
Shut the fuck
MMM
up,
wins.
Movement, alright? It's a stupid fucking meme.
Nuts question mark.
Why do you guys donate when I'm not here?
Love you, buddy.
158
Do you
messages in
ever
my
feel like
D&D
an
chat.
NPC
What the fuck are
in
you guys
someone
talking
else's
about? Based train take. Not like you respond anyway.
Who is he talking to?
Somebody donated subs in Twitch chat earlier. Thank you. Although I didn't see. Decided to see Dune because of all the OIQ, zero IQ idiots that I knew were idiots just timing it
Stop
up. But I
stuffing
gave
your
them the
fat
benefit of the
fucking
doubt and I
mouth.
regret it. What an absolute trash movie. So
Who is he
fucking
talking to?
based.
Vinkelin.
True.
Spooky, scary skeletons. Thin shiver your spine. Shrieking skulls will shock your soul. See your doom tonight. Spooky, scary skeletons speak with such a screech. You'll shake and shudder in surprise. You hear these shriek.
Did the illegal weapon charge, did that get tossed or is that still on the table?
Can
for
we go back
Rittenhouse?
to being a low terrorist while Mountain is gone? Can we please see some league?
It's still on? Is there a reason it would be dropped? I don't remember if they'd ruled on the legality of the weapon yet. Like the curfew, for instance, apparently was not a legally enforced curfew, so. Another maybe she will bang her. Oh, shit. Still on, and he'll likely go to jail for that, so I doubt they ever drop it. Wait, what? I thought that possession was like a misdemeanor thing that he probably would already have time served for. What do you... Okay, man, I am... the whole trial may come down to one video. Holy yikes. Whether or not Kyle Rittenhouse gets like fucking convicted of like fucking murder or completely walks might all come down to this fucking video. Holy shit. Is he raising his gun? Is he just running and then standing still? Is it pointing down? Is he brandishing his firearm? Is he just moving around? Like what? That video will not be allowed. I believe that today, I think the judge ruled that the jury is allowed to decide. So they're going to allow this video to be presented as evidence, and the jury is going to decide on this. Yikes. I've seen people, so somebody's linking this thread on like trying to break down what they think they saw. I want to say it looks, that analysis that I saw looked fairly compelling, that it doesn't seem to be the case that he was raising his rifle. Oh, this is actually a different thread. I saw another one earlier. But like, if I'm going to be intellectually honest, which I think we all should be, I don't think you can draw any conclusion. I don't think you can do any conclusion one way or another. For instance, I wouldn't be comfortable saying, after seeing this footage, I wouldn't be comfortable saying there's zero chance that Rittenhouse raised his gun. I wouldn't say that. I don't think anybody honest can say that. But I absolutely would not say, oh yeah, definitely looks like he raised his gun. Like, man, it's crazy. Well, no, I'm not sure. But so here is how it's supposed to be, okay? If we can't tell, that's not enough to convict Rittenhouse of murder, right? Like, is there like some reasonable doubt that this could be something else? Absolutely. But it's a jury trial and anything can happen. The jury might see it and go, well, it kind of looks like he did. Fuck him. A jury could absolutely say that and rule that way. So it's going to come down to if he's raising it here, he's doing so left-handed, but he normally shoots right-handed. Yeah, so I've seen a lot of analysis bring down like, oh, he didn't. I feel like the thing that hurts the most is the thing that it hurts the most is I don't think they have a single other witness to corroborate this raising of his firearm. There's not a single other person. It's just this video. Man, that is just a wild world where 20 or so pixels are essentially going to determine potentially the outcome of this trial. Even with no corroborating witnesses. But I guess we can watch this real quick. What is this? I don't think I've seen this yet.
Alright guys, last night I did a video showing you the drone footage, if you zoom in, what we're looking at and what the prosecution's trying to show with Kyle, right? I explained in the video above what the prosecution was getting at. This was their Hail Mary. They've been getting clobbered in this case, and they figured their last-ditch effort, no matter how bad they look to the jury, no matter how much they piss off the judge, they had to try to get Kyle to admit that he knowingly would be assaulting somebody by aiming the gun at them unless he was defending himself. He can't protect property by threatening to shoot somebody, right?
If you raise your gun at someone, can you not claim self-defense still? Kyle's self-defense case looks really, really, really bad if he raised his gun and threatened Rosenbaum first. It's almost destroyed completely. Keep in mind, remember when I was giving you hyperbolic examples a year ago, and I was like, the only way I could ever see this case changing is if Rittenhouse like actually threatened somebody and then started running right after. That, remember I said that exactly. This would be that example, right? If Rittenhouse literally like raised his gun and said, I'm gonna shoot you or some shit, and then Rosenbaum's like, fuck you, I'm gonna attack you, and then Rosenbaum run after him, after Rittenhouse threatened him with a firearm, it substantially undercuts his self-defense claim. Now, the problem is that Rittenhouse here isn't aiming his gun at Rosenbaum. He's aiming his gun at Zeminski, which is what the defense brought up. They're like, well, hold on, this isn't even relevant because he's not even aiming at Rosenbaum. But then I think the prosecution argued, well, you know, if he's threatening one person, maybe other people. And then the judge ultimately said, you know what? We'll let the jury decide. And the judge allowed this to, I think basically that the prosecution can use this as provocation and submit it as evidence as such. It still doesn't 100% mean it isn't self-defense, though. I'm being honest, and the fact that it's a jury trial, I think that if it was the case that he raised his gun first, I have a hard time believing a jury would still see it as self-defense. But again, anybody can, it's a jury trial. Anything can happen. Do you trust a jury anymore? I think a jury is the best way to do it. Fuck it. Depending on the trial, you know.
I feel like I've outpaced him intellectually.
Destiny. I live to simp, my patron. Obama 7. Obama 7.
The judge in the Kyle Rittenhouse trial on Friday said he'll instruct the jury that unless the state proved the teen's AR-15 style rifle had an unlawfully short barrel, he can't be convicted of a minor possession of a firearm. Oh.
Vinkelin.
So he's just not allowed to have is it SBR, a short barrel rifle? Is everything else okay? Because if that's the case, then it seems like if this is true, he's going to walk on the minor firearm charge. The curfew charge he's already walked on because there was no legally enforced curfew. So basically, the only thing, the statute isn't clear. I think I remember the statute being not clear because I think me and Riley argued over it like a year ago, and the phrasing of the statute was very confusing. So in my personal experience, Pisco's here so he can advise. If there's ever like a law that's unclear, you don't try to read into the law to figure out what it means. What you do is you try to look for case precedents. You try to see like, okay, I don't know what the fuck this means. Who's been charged with what? We'll see how it's actually been ruled upon in the past. So if you find out that like historically, okay, well, 10 kids have had AR-15s, they all walked on the charger, it probably doesn't matter. Or if you see like, oh wow, people have gotten prosecuted for walking around with AR-15 standard length barrel, then yeah, it seems like this is probably right. Yeah. The judge has also said the law is unclear. Okay, so if there's no like precedence in terms of who's been convicted and the law is unclear, then yeah, it seems like that's probably not going to do anything. Destiny, that wasn't your argument at all. That was Vosh's argument. I don't know if you're a gifted sub or like a random dipshit sub, but I've said a billion times over the past year, I've said over and over and over again, I'm not going to use I think or in my opinion. I know for a fact I said this. So you're either wrong or you need to go to get a diagnosis. I have said millions of times, it is highly unlikely that Rittenhouse would ever get a not self-defense thing. The only thing I could think of, which seems unlikely or implausible, it's possible, very unlikely, is if Rittenhouse like threatened people, like, I'm gonna fucking shoot you, I'm gonna fucking shoot you, I'm gonna run over here and shoot you, blah, blah, and then started running or whatever, and then like somebody chased him or whatever, then like, okay, that hurts self-defense. I've said that a million times, or some variation of that a million times. I know that I've said it a million times, some variation of that a million times. Want to bet? No, because I'd be stealing your money. I know I've said it. Because I bring that up almost every time, because I'm not delusional. There are worlds where Rittenhouse has acted in some manner where it's not self-defense. It absolutely could be the case. I would be an idiot to pretend otherwise. For instance, before the trial began, it is possible that, I'm pretty sure I've said, I don't know if I've said this exactly, but I'm sure I have. If Rittenhouse would have texted friends saying like, I'm going to bring my rifle down, we'll see who wants to start shit. I'm going to blow some of these BLM motherfuckers away. If Rittenhouse was saying shit like that, and that's brought up in discovery, that's probably going to undermine, right? These are all possible things that could happen, you know? Yeah. Bet then? I mean, I can bet whatever. I know I've said this. I know I've said this like dozens of times. Yeah. Destiny, this is completely different from what the prosecution is trying to prove now, though. Well, what the prosecution is trying to prove, my understanding, what did I say that's wrong? Wait, are we even talking? Do we even disagree? My understanding is that the prosecution is trying to say that Rittenhouse threatened Zeminski with a firearm, or Zelminski with a firearm, and then in response to that provocation, Rosenbaum charged Rittenhouse, and then he ran after brandishing his firearm towards Zelminski. Is that not what the prosecution is trying to say? Am I missing something here?
Please look at iNhq1PoSA's Twitter. There is a clearer video.
How soon before the initial shooting does the blurry footage happen? I don't know what the time is before the shooting here. I imagine it's like within a minute or something, no? Doesn't Rosenbaum start chasing him shortly after this? Like almost immediately after this happens? If the jury follows instructions, provocation doesn't mean self-defense is not legitimate. He still retreats after, and it probably qualifies it. Potentially, but it definitely weakens it. You have to admit, this would be the strongest piece of evidence that the prosecution has brought, if it is the case that he brandished a firearm prior to this. Wouldn't we then want to know if Zeminski did something to provoke Kyle pointing his rifle? Potentially, but I don't know if the defense has that that footage on hand. But this is why we need a fact finder, and Connor is so stupid. You see how this fact dependent this whole thing is? Wait, do you think I disagreed with you? Why wouldn't they lead with this since it's their strongest piece of evidence? Because this evidence sucks. This is shit evidence. The video is blurry as fuck. They had to argue to even get this into admission, to admit it as evidence. They have no other testimony that corroborates anything that's been seen. This is the only, it's not great evidence. But the problem is that this is like the Hail Mary. This is the last thing they have. Yeah, there's just, I think it feels to me, at least in the I haven't watched the full trial, but I have watched some hours of it, and what I've seen, this seems to be like the only possible thing that the prosecution has. Like, absent this, it almost feels like a 10-minute deliberation. Like they're in and they're out, and then it's whatever. Yes. So what somebody said, if they buy the narrative set by the prosecution, it makes a huge difference in everything else here. It absolutely does. Yeah. Couldn't the defense just shit on that in closing as well? Casting doubt would be pretty easy. Maybe, but you have to be careful. Remember, okay? All a trial is, listen, okay? At the end of the day, law can be, you can pretend it's complicated, whatever. At the end of the day, all a trial is you're telling a story with pictures to 12 people, and the other guy is trying to tell a better story with pictures to 12 people, and you're seeing who can tell the better story. That's it. That's all that happens at the end of the day. It's not any more complicated than that. It might seem more complicated than that. TV might make it more complicated. Lawsuits might make, but that's really the end of the day. That's all it is. It's one guy is telling a story to 12 people using a bunch of pictures. Another guy with the same pictures is trying to tell a different story. So a trial jury at the end of the day can be anything. You have no fucking idea. Now, we can kind of guess, or in rare cases, like the judge might rule, like, I'm dropping this is bullshit. But at the end of the day, Rittenhouse could get convicted on every fucking charge. It could happen that Rittenhouse is like on fucking death row. I don't know if they have death row in Kenosha, Wisconsin, whatever the fuck state. I don't even know what fucking... Yeah, Kenosha in Wisconsin. It might be that Rittenhouse is on fucking death row in 3 weeks, or however long sentencing takes, right? Or it might be the case that he walks on literally every single charge and has nothing. Either of those outcomes are possible, you know? Apparently there's different angles of this moment. I mean, if there is, I mean, I would hope that the, it's a guy in a wheelchair. I don't know if I would trust Jack's Twitter for the most honest answer on this. But, like, you can see how, like, any dude, who the fuck knows? Oh, fuck, do I have this? Do I have this? Do I have this? Do I have this? Did I save it? Did I save it? Did I save it? Did I save it? one interesting way to look at upscaling is we can take an input like with missing information, and then we can generate an output to see how an algorithm might fill it in. And then we can look at the reference picture to see like, well, what was it actually? Now, I'm not saying that pinch to zoom or that low pixelated video that gets anti-aliased or has like a bicubic filter plot or whatever is going to be this off. I'm just saying there's a lot of wacky shit that happens, right? So like you might give this input picture to something, and then this is what an AI generates, but this is what the reference photo was, right? So like I could show you this output photo and it looks like a real photo, but it's not. There's invented information here, right? And you can see how AI is like, oh, like here's an input. You give it half of this, you let an algorithm chew through it. This is what it generates. And then, but this is the actual reference photo, right? There's, who knows, man, so much stuff. Anything is possible. Here's a pixelated input image. So this is just trying to remove artifacts. A pixelated input image. Here's an output image, but here's the actual reference image, right? So this output image is not real. It's what was, Destiny, that's not what anti-aliasing does fucking at all. Okay, I never said that this is what anti-aliasing does, you dumb fuck. Okay? Anti-aliasing is one form of inventing information in order to make a picture look better by doing things that aren't referenced to reality. Okay? My understanding is anti-aliasing is literally done where you're like averaging edges and shit to give the illusion that they're smoother than they actually are. Right? Then what's your fucking point? You know what? That's going to be for you to decide. Write me an essay, and in 1 year you can come back, okay? I upscale Destiny's small-ass webcam for YouTube thumbnails, and sometimes I get really wacky results. Ooh, August sent me one of those pictures before, and it was actually really fucking creepy.
Protect property by threatening to shoot somebody, right? So, right here, this is the footage that they're talking about.
Did you personally?
Didn't we watch this already?
Did you personally purchase that 223 Full Metal Jacket ammunition?
I did not.
Who did?
Dominic did.
Did you ask him to purchase it?
I did not.
So you didn't know what type of ammo was in that gun. Is that right?
When we listened to this, they didn't go into this much at all. Or at least I don't remember them unless this is a different line of questioning. But something that I think that the prosecution could have harped on more is if you are truly showing up to an event and if you are truly carrying a weapon in self-defense, unless there's something fundamentally different with rifles than handguns, this was a different day. Okay, you should absolutely be using hollow point rounds. Bringing FMJ Full Metal Jacket rounds to a self-defense situation in public with a rifle, this is a super high muzzle velocity or whatever, is incredibly reckless to do because over penetration, shrapnel from rounds, ricochets, like that is such a horrible idea. I feel like you could use this like, you brought this for self-defense and you're running around with FMJ? What the fuck are you thinking? Why didn't you have JHP or jacketed hollow point rounds, right? Ones that would be more appropriate for self-defense rather than other crazy shit. But I think we watched one line of questioning, but maybe this is a different day. We can watch this real quick.
I knew they were 223 Full Metal Jackets. The first time I shot it, I had to load it into the magazine.
So you knew the type of round, but you didn't know what those rounds were capable of doing. Is that fair?
Why are FMJs available to civilians? Because if you're gonna go shooting targets, they're cheaper. Full Metal Jacket rounds, there's a lot of like military surplus ammo and shit. Like Full Metal Jacket rounds are just way cheaper than hollow points in almost every circumstance. And before somebody links an example building it.
Say?
Believe a bullet's a bullet.
We did watch this. I remember this.
As you sit here today, you know that there are different types of bullets, right?
Yes.
You know that hollow point bullets, for example, do different things to a animal or a human than Full Metal Jacket bullets.
He didn't think about the ammo because realistically, I don't think anyone here, sane people at least, were thinking about shooting people. I think I would disagree. I don't know. There were times when I lived in Omaha where I would conceal carry a lot. If I was ever conceal carrying in public, I always had hollow points loaded in my Glock. I would never conceal carry with my range ammo. Range ammo and self-defense ammo those are different things to me. I would never walk around with full metal jacket 9mm rounds in my gun. Why would? Because if you ever, there's like, it's just a bad idea for self-defense rounds. Why would you do that?
Don't you want FMJ or 15 for tumbling?
I still think you're worried about like things like over-penetration, ricochet, and like shrapneling rounds. I don't think you want that to happen in a self-defense round. I might be completely wrong, but don't hollow points do a lot more damage to targets you hit? I think according to the medical shows I watched, hollow points do damage is more difficult to fix. Yeah, but a hollow point is good because it stays in your target and it's less likely to cause like collateral damage. That's why you like hollow points for self-defense. They are more effective rounds, but they reduce collateral damage. That's like the big point. Would you use FMJ on any other circumstance other than the range? In war, you use FMJ because hollow points, I think, are banned by the Geneva Convention, maybe?
That's correct.
Yeah. Full Metal Jacket is a...
People are saying hollow point, good damage to flesh, but bad armor penetration. Would Kevlar armor really stop a 5.56 hollow point? I don't know if that's true. That seems really unlikely to me, but I could be totally wrong. I could be totally wrong by that. Because 9mm, you can get unlucky and I think can punch through Kevlar, right? I feel like a 5.56 hollow point round would fuck you up even if you had Kevlar on. But I could be wrong on that. But 5.56 rounds are pretty strong. Like I think, don't 5.56 rounds punch through helmets? If you have like a full helmet, if you get directly dinged by a rifle round, that might only be the 7.62. That might only be the battle rifle rounds. I'm not sure. Not Kevlar, but plate. Okay, well, who's showing up to a fucking protest wearing plate armor? What the fuck?
Like a defense round, like another type of defense round. I know people use Full Metal Jacket for hunting, and hollow point is something that causes more damage.
Hollow point bullets are designed to hit the animal that they're being shot at. Let's say a deer, for example. And
hey, this is kind of weird because I don't think, do people actually go hunting with hollow point rounds? Is that actually a thing that people do? That seems fucking crazy to me. Like, hey, I've got some deer jerky. There might be a little bit of lead in it, but you know, it's good shit. That would be, yeah, that seems like it would be, that seems funny to me. Maybe it's possible. I don't know. I truly don't know the answer to that. I feel like that probably isn't the case, but.
Explode inside that body, correct?
No, I don't think so.
When you say explode, are you saying expand or explode? Because there are such things as exploding bullets.
Sure. Let me rephrase. Mr. Rittenhouse, what is your understanding of what a hollow point bullet would do if it were shot at, say, a deer?
I think we did watch this, but I feel like
people use.
I think the prosecution could have asked better questions here to show that he wasn't carrying responsibly for self-defense.
Hollow point.
I don't know why the prosecution is talking about this when the guy doesn't know. Dude, the prosecution seems like it fucked up so hard in this case. Holy shit.
My question, sir. What is your understanding of what that bullet would do? Let me rephrase it then, because you're aware that people use hollow point bullets in their pistols to defend themselves against other people, correct?
Yes.
Ryan Balch, for example, testified in this trial that he was carrying a pistol loaded with hollow point ammunition for self-defense. Do you remember that testimony?
I do.
So what is your understanding, if you have one, as to what hollow point ammunition would do to a human?
I believe it would do the same thing as any other bullet. Like I said, a bullet's a bullet.
Rittenhouse just doesn't understand the difference here.
I just believe hollow points. I'm sorry, I don't know much about ammo. I'm trying to think of what I remember, but I just don't know much about ammo.
So you didn't know the difference between what a full metal jacket bullet would do versus a hollow point, right?
I believe a hollow point, I just don't know much about this. I believe a hollow point would cause more damage
to the first target, but it wouldn't continue through to any other targets, right?
I don't know the answer
Whereas
to that.
a full metal jacket bullet is specifically designed to continue through its first target and keep flying, correct?
First of all, the hollow point is not guaranteed to stay in the first object struck, which is, so what you said was not correct. Secondly,
There's no testimony on that, Your Honor.
no, but you've been testifying, and that's what Mr. We're going to take a break for lunch.
Good afternoon, Mr. Rittenhouse.
Good afternoon.
You testified earlier that there were times that evening when Mr. Rosenbaum had threatened you. Is that right?
Yes.
And you described him as wearing a red shirt with a blue bandana. Is that correct?
I feel like I could be totally wrong. I don't know. I feel like bringing in an expert witness here maybe could have benefited the prosecution. Like bringing in like a cop and asking like, why do you, I think police officers use hollow points. Why do you use hollow points versus full metal jacket rounds? And then talking about like, oh, well, hollow points are really good for self-defense. Full metal jacket rounds represent a much larger danger to the public. They're irresponsible to use in self-defense situations. Like I could be wrong, but it feels like the prosecution going down that line of questioning could have actually cast some doubt on like, why is Rittenhouse carrying a weapon for self-defense with inappropriate ammunition? Why are you wielding a AR-15 with full metal jacket rounds in public? Right? I feel like that. I actually feel like that could have been a legitimately good line of questioning to go down to show like Rittenhouse is at the very least carrying irresponsibly. Now there was no collateral damage, so maybe these questions are irrelevant, or maybe the judge would throw it out. Like I don't know. Yeah. Yeah. I think Kyle's one saving grace that will sway the jury in regards to the pixelated video is the fact that the prosecutor did a bunch of credibility damage things throughout the trial. Maybe, yeah, I don't know. We'll see. Did they talk to you about your ammo in your CC classes? I'd assume it's common knowledge, but I don't know. I don't know. To be honest, I always talk about my concealed carry class, but those classes are a joke. Like, there's not much. Um, 11. What is this Bad Bunny tweet? 11 ways fascists and their sympathizers are defending Kyle Rittenhouse. If you see anyone using them, don't waste your time on them. Don't debate them. Don't try to teach them. Don't defend them. Know you're dealing with fascism. Block and run the other way. Top 11 ways fascists are defending Kyle Rittenhouse. Number 1, he was acting in self-defense or defending property. That's literally the subject matter of the case. But glad she's already decided that. Okay. Number 2, he was crying real tears. Number 3, he deserves due process. By the way, denying people due process, that's actually like a really important part of being a fascist. Undermining your institutions and saying certain people don't deserve rights to like legal process, that is actually, now I know that none of these people know what fascism is or whatever, but that's actually a pretty important part of like undermining your institutions in that way, having some authoritarian central body that just hands down punishments and judgments without like due processes. But okay. Number 4, this isn't about white supremacy. The victims were white. Number 5, he's being vilified by the media. We don't know all the facts. Number 6, sea lioning. How is Kyle racist? How is this white supremacy? He was not acting in self-defense, and other incessant questions. Number 7, the facts of the case, ... Number 8, put yourself in his shoes if it were me. Number 9, the victims were no angels. Number 10, but I thought you were anti-prison. Number 11, the court system is impartial, and if he is acquitted, we must respect the results. This is actually unreal. Is she memeing with this? I actually can't tell anymore because she's actually so fucking stupid. Oh, no, this is true. So beneath it, she says, for the record, deserves due process was mentioned because fascists and sympathizers are alluding to Rittenhouse's right to due process as under threat. This concern serves to control the narrative and paint him a victim. Actually... and Pisco can tell me if I'm right or wrong here. Actually, depending on how politicized cases get, it can actually be a threat to due process. I believe that one of the big challenges of really public cases are that
the Ano hype.
If a case gets so public that it's impossible to find an untainted jury, this does represent a threat potentially to a person's constitutional right to due process. Now, a few days ago, I shit on the UK because the UK will do a lot of gag orders around big cases because they don't want reporting to taint the jury. There are actually legitimate reasons why you might have these types of gag orders. And even in the US, I believe they do these sometimes, I think. Because like if the case gets so big and everybody's talking about it and it's all on the news and everybody's got an opinion, it's really hard to imagine that there's an unbiased jury. So like, let's say for instance that this same jury is going home and they're reading all the headlines that we're reading about white supremacist Nazi sympathizer Kyle Rittenhouse showing up to murder BLM supporters. If they're reading that every day, is that really his right to due process? That's a totally legitimate concern. But is there an example of that in what? In the UK or in the US? I can't think of any in the US. In the UK, there was one over some of the white nationalists. There was some white nationalist dude, and there was a gag order in a trial, and he kept trying to report on it. I don't remember what it was, but there were some arguments from Chauvin on that too. During the George Floyd trial, yeah. Oh my God, dude. The Bad Bunny simps are insane. Going across state lines and with a weapon, no less, is my issue. I wish I could get all of these people in a room and be like, what do you think about illegal immigrants? Like, because everything that conservatives have said for the past for the past 100 years about illegal immigrants has always been like, they're breaking the law, they're here illegally. They're already aggressing on us. Check Jenna Twitch response under the Bad Bunny tweet. Oh, Jenna Twitch. Okay, I legit don't understand what's going on with this anymore. Isn't a murder case about providing reasonable doubt? They've successfully done that with the self-defense route. He isn't on trial for being a white supremacist, which he is. What am I missing here? Oh, so she thinks he's a white supremacist kind of down, but she actually has like a correct take. He's not on trial for being a white supremacist. Literally half the jury and judge were on his side to begin with. Nothing about it is a fair trial. And why do people say... oh no, and he convinced her. So this guy said, literally half the jury and the judge were on his side to begin with. Nothing about it is a fair trial. And the only reason it's being successfully proved is self-defense because his defense team and the judge have banned all relevant information that would show it wasn't. Jenna replies, thank you, I really needed this. You were not on trial for being a dwarf. True, I have been my whole life. My favorite thing about the judge is people keep saying it's a biased judge, and all the examples that they've given of the judge are him being really fucking tough on the defense. Like, every time. Like, okay, maybe he is biased, but like, in your favor. Tough on the defense. Yeah, the judge has a history of being like, apparently he has a hard-on for like punishment and shit. But like I'm not saying that he's like in the wrong or anything in the past, just that seems to be the type of thing. The prosecution was asking those questions to prove the use of FMJ recklessly endangered others. Yeah, of course, I was going to before. Yeah. The tweet thread you linked from earlier today from the local reporter says he's a hard-on for defending defendants' rights. No, he has a hard-on for constitutional rights, but it seemed like he gave like pretty tough like stuff like that in the past or whatever. Thoughts on this brain dead image people like to post. Combat veteran here, just a perspective. If you arrive armed to a place where violence is happening, prepared for violence, and you engage in violence, there is no self-defense. If you are in fact a willing combatant, if you do this without being sanctioned by a government outside of a combat zone, you are also in fact a terrorist. This is all bullshit. I don't know why the fuck we care about what combat veterans think now. No offense. If you arrive in a place where violence is happening, prepared for violence, you engage in violence, there is no self-defense. That's just not true. I'm sorry. It is my constitutional right. I can go wherever the fuck I want. with a firearm if I have a right to do so in that state. Fuck you for anything else you think otherwise. Okay? So I can absolutely go wherever the fuck I want. I have a Second Amendment right to bear a firearm. As long as the state isn't restricting the type I have, I can go wherever the fuck I want with it. And if I am in that place and something happens where somebody does aggress on me and I do have the legal right to defend myself when I do, fuck you for trying to say I'm not allowed to. You're absolutely, completely out of line for saying anything otherwise. You're just wrong. Nothing is sadder to me than combat vets that have no fucking idea what constitution they put their life on the line for. Go be a partisan hack in another fucking country, you dipshit. What a stupid fucking thing to say. You absolutely have a right in this country to bear firearms. And if the state hasn't infringed on particular types of firearms you can bear and you're within your legal right to do so, you absolutely can. There being threatening people around or some intimidating force does not deprive you of your right to be in an area with a weapon.
Stop stuffing your fat fucking mouth.
Did Kyle have a right, though, if the state restricts it for people under 18? My understanding is that that isn't the case. I think that was thrown out. But drinks up for Kyle, our Lord and Savior. This is going to be one of those takes that Destiny looks back on in 5 years and talks about when I was 32. I thought I had it all figured out. You can say that. Maybe it is the case. You're probably like 21. Okay, fuck you. But I actually, throughout my entire life, and I don't think I've ever changed on this position, I actually really like the freedoms and rights afforded to me in the Bill of Rights. I like all of those freedoms. And I don't think I've ever felt like... Now, like, we can talk about how, you know, should there be certain types of gun restrictions, blah, 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 blah. But if I have a right to something, then goddamn, you're not going to tell me that I don't. Fuck you. Like, absolutely not. I think that was the one thing that we almost got in a fight over. And by getting a fight, I mean, I probably would have got my fucking ass kicked or whatever. Was when we were... When we were in that,
I hate it when we're supposed to believe an argument, not based on the merit of the argument.
True. When we were leaving that protest in Beverly Hills or something, and those kids told me that like I need to leave, or I couldn't be there. Fuck you. I have a right to be wherever the fuck I want. I'm an American citizen. This is fucking public property. I'll stand here all fucking day. Bullshit. Fuck you. No. If I have a right to carry a gun somewhere, then God damn it, I will carry a gun somewhere. Okay. If you want that change, you need to pass a law to say otherwise. Okay, or you need to show me why what I'm doing is illegal. But otherwise, no, fuck you. Peak American take, good. I like our rights in the United States, okay? I like my Miranda rights. I like that I can say fuck you to a cop that walks up to me without probable cause. I super cherish and appreciate that part of my American Constitution. I think some of those things are relatively unique. I think in a lot of European countries, the cop walks up and asks you questions, shit. I think you have to respond, even if they have no reason to do so or whatever. So, I don't know. I like that shit. Sorry. I like my rights as an American. We do fuck up a lot of shit, but I think some shit we get pretty right. I like a lot of our legal system. I think a lot of it is pretty cool. I think the due process we have in the United States, the rights that we've been afforded by our Constitution, the fact that we have a federal government of enumerated powers, I like those facts. I think that's really cool. And yeah, fuck you. There's no such thing as Miranda rights. It's a warning. I am almost positive that's not the case. I believe that Miranda rights come from a 1986 Supreme Court case where these rights were given based on the defense of the Fifth Amendment. Your Miranda rights aren't just your constitutional right. Like the Miranda rights, I think, were spelled out after a specific court case. They're referred to as, you can call it a Miranda warning, but I don't think those specific Miranda rights were spelled. That came from I don't know if you would call it case law, but that came from a Supreme Court case. Miranda versus Arizona, sure. Sorry, fuck. I hate it when you're supposed to believe an argument not based on the merit of the argument rather than the identity of the person. True, it's really cringe. It's cringe when racist people do it. It's cringe and everything, yeah. A state having a lot of power over here is nice, but if we ever get some scary government, then we are more fucked than Americans would be. Maybe not. I'm not saying that like every law or thing given to the American people is necessarily good or bad, but if you have it, then fuck you, then you have it. That's all I'm saying. Do you think the right to carry should be allowed during protests? Some states have outlawed it. I don't know. I'd have to think a lot about that one. I'm not sure. my default is heavily leaning towards yes. When you ask me if you have a right to do something, my brain instantaneously goes to the worst case scenarios and what I want that right. So when you ask me, do you have the right to protest? Let's say that you have a situation where you feel like your town is ran by Nazis or KKK or white nationalists, and you get a bunch of black people together and they want to go protest. Should you deprive them of their right to carry firearms during that protest if they legitimately feel like they might be met with armed resistance? I feel really shitty. I'm like, nah, they don't have the right to. Everybody else can, but not them. I don't know about that. Yeah, I'm not sure. I thought the Miranda rights already existed, but maybe weren't called Miranda rights, and the court ruling was that law enforcement had to make sure you understood your rights. I mean, like, Miranda rights are just like, fuck, I shouldn't even try to do this. Ask Pisco, okay? Miranda rights weren't like a specific thing that were spelled out. It was more that, like, once some guy got arrested and confessed some shit because he didn't understand his Fifth Amendment rights, your Miranda rights are basically just like, you have to be read. Not just read, okay? You have to understand your rights before before you submit to interrogation. So if they don't speak the language, if they're deaf, you have to make sure that the person understands their rights. That Miranda warning, those Miranda rights, that wasn't formalized until after that court case. Yeah, like your Miranda rights are basically an explanation of how the Fifth Amendment applies to you in a particular circumstance. And that wasn't a thing that had to happen beforehand. Deepak stuff? I can't watch Deepak stuff on stream, okay? I know this is asking a lot, but after today, would you still say the trial is still leaning towards Rittenhouse? I would say it's heavily leaning towards him walking, but again, anything can happen. And oh boy, man, if Rittenhouse gets convicted, you better fucking believe that there's going to be a disgusting amount of celebration. Like, we knew it. Because if Rittenhouse gets convicted, it isn't that he got convicted on murder or failed his self-defense. It's that he was convicted of being a white nationalist Nazi that showed up to murder BLM protesters. That's what this conviction is about, basically. Which is gross, but yeah. Bad Bunny is legitimately like a disgusting fucking human being. Holy shit. Oh, God. Okay.
That's Kyle running right in the middle. You can see that white bar directly in the center of the screen. Kyle is running up and dropping that fire extinguisher. Let me show you. Again, right here. This would be Kyle. This is the fire extinguisher. He drops down. Keep an eye on that, and you'll see what I'm talking about. He runs up, drops the fire extinguisher, and they're going to claim that right here, boom, he just takes his rifle. See? Drops the fire extinguisher, rifle, boom, aiming the rifle. Can you guys see it? Aiming that rifle. This would be...
Jesus.
You'll see it when I zoom out. That's Kyle's head right here. This should be his elbow. And that would be the rifle right there, right? Let me slow it down and do it one more time. Drops the fire extinguisher. Aims the rifle. Boom. Aiming the rifle. That's what they're claiming. Now, it's obviously not clear enough. There aren't close to enough pixels here. We don't know who he was aiming it at. We don't know what else transpired. So I don't think it's going to be catastrophic to Kyle's case, but this is obviously what the DA is going for, and this gives you some insight into what you can expect next.
If pinching to zoom is an unacceptable use of algorithms, then this tweet is better than DLSS. Okay, hold on. I'm sorry, let me please be really fucking clear. Please let me be clear about shit that I've said, and please do not fucking misquote me, okay? I have never said, or if I said it, I was wrong, or if I said I didn't mean it, or you should have heard what I said better when I was saying this. I never said that pinch to zoom is bad or wrong or can't be used. What I've said is that if you want to use pinch to zoom, you probably need to bring in an expert witness to testify that it's a legitimate use and it's not going to alter the data in a way that changes the facts of the matter. That's what if I didn't say that exactly, that's what I meant. And I'm pretty sure that would have been what you'd have taken from what I said earlier if you listened to. And yes, this is explicitly what the judge called for, okay? I didn't say you can never, ever, ever use pinch to zoom and that's always bad. I'm just saying if you're going to, you probably need to bring in an expert witness to testify that it's a legitimate use. When we're talking about a couple pixels determining the outcome of a fucking case, you probably need a really good argument for why a pinch to zoom here is legitimate. That's all I'm saying. Jesus fucking Christ. Okay, Tam keeps linking me something. One more video.
Hey, I don't have time to make myself look like a human. I have 3 kids under 3, so deal with it. In the Kyle Rittenhouse prosecution,
Wait, not this.
Things you're going to want to notice here. If I zoom in over on the right of this, now a couple things you're going to want to notice here. If I zoom in over on the right of this image, you're going to see all the way on the right that's Joseph Rosenbaum doing his Superman impression with his little cape, and that is Kyle Rittenhouse in the green shirt running with the rifle. Now, look up here. As the camera pans around, you're going to notice something. The first shot you have of...
Wait, there's not actually shooting in this video, is there? Okay.
Kyle. He's standing there, but he's backing up slightly. His left arm is loose, swinging. Now, if I take a picture of this, you'll notice another interesting detail. As Joshua Seminski is walking towards him, he has a pistol in his right hand. This armed man is walking towards Kyle. Kyle's retreating. There's the pistol in his right hand, right there.
Is it? Oh, man. I don't know. I don't even know. Dude, this has got to be so stressful that your life is riding on pixels, on 10 or 20 pixels.
There. He's walking towards Kyle as Kyle retreats. Now, when this first pans around, he's not holding up the rifle. He is walking backwards. And then when he does grab the rifle with his left hand, he holds it under the barrel. He's holding the handguard and begins to run. When he grabs that handguard, he's holding it righty, which is his natural side. He only holds that rifle righty. In the picture where they claim he's aiming the rifle at the Zeminskis, he appears to be holding it lefty, which...
Oh, that's really weird. Imagine shouldering your rifle with your offhand. I would have to actually stop and think to do that. And now imagine a 17-year-old with not much firearm experience doing it. Like, why would you ever, like, unless it swung around, I would have to actually stop and think to, like, because it's going on your shoulder here. It would take me a while to do that. I would need to think about that. Oh, yeah, and would it even be possible with your strap on? Because the strap would probably come around like this. You probably could do it. It would just be awkward, maybe, or you'd have to fight the strap a little.
Again, wouldn't drive with the facts and what we know. The other thing that's interesting about this, which I just noticed, if you look at the FBI FLIR footage, now I know this is really grainy and pixelated. I apologize for that. Unfortunately, the FBI lost the HD footage. I can't imagine how or why that happened, but you'll notice something interesting here.
No, wait, no one's getting shot here, right? Hold on.
If you take a look at this, you see that blob? Same exact sequence. You can see there's Rosenbaum all the way on the right, gives chase, starts chasing Rittenhouse. Now, earlier, before that, if I zoom in on this area, The blobs on the left are the Zeminski, the blob on the right is Kyle. That round circle on the right, in the middle, that round little blob of pixels, all of a sudden, boom, this white rod points out on the left of it. See? Boom. That white rod appears, that goes out and comes back down. That white rod goes out and is now pointing at the Zeminskis. What could that be? Well, it can't be the rifle unless you're going to tell me that the rifle somehow has the same body temperature and registers the same color on an IR camera as Kyle Rittenhouse's body, because the laws of physics don't allow that to be the case. Therefore, it's pretty obvious. At one point, he lifted up his arm and pointed, probably when he was saying friendly, 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 and trying to address the fire, before an armed man began to approach him and he was forced to retrace his steps before being chased by an even more aggressive man in Rosenbaum.
Maybe, yeah. Man, I hate to, I don't want to get too emotionally invested in this case because, like I said, and you guys should prepare yourselves. I'm just giving you honest advice, okay? This trial could, honest to God, go either way. Anybody pretending to you, anybody saying with confidence, like, oh no, he's 100% gonna walk, that is absolutely not true. This could totally go either way, but we'll see what happens. Yeah. Jeez, man, dude. I personally feel like I've seen enough that, assuming the jurors are acting as they should, no possible way does anybody really feel like we've proven beyond a reasonable doubt that Rittenhouse did not act in self-defense. That is impossible to me. But the jurors could decide. The jurors could decide otherwise. Just saying. If you had to bet $1,000 guilty or innocent with no odds, right now I think that I would say that it's squarely in favor of the defense. Absolutely. But Destiny, Bad Bunny meme. What? I need to watch this Dylan panel. I'm gonna.
Thanks everyone, and I'll see you in the next video.
I want to be in the ethno state.
I don't need to see this, okay? Do you agree that this is completely ridiculous? Is there a chance anyone can make out what is happening in these videos? There's always going to be bias. People, yeah, I mean, it is what it is, but in a perfect world, he walks on the self-defense killings and catches some kind of charge for being incredibly reckless. I don't know if I agree with that. Incredibly reckless. Like, I don't know what the precedent we set there is, right? You have a right to, well, assuming that he didn't break any laws, you have a right to have a firearm in these areas. You don't lose that right because people are protesting. One thing that I think you need to be very careful of, here's what I'll say. When you're saying things like, I agree that legally he was in the right, but morally was in the wrong, what do you want to change about the law? And if you don't have an answer there, then you don't believe that he was morally in the wrong. Don't say that, okay? Because if we're talking about immoral things related to firearms or whatever, it probably should be at the very least against a rule, if not illegal, right? Do you think we'll see a protest if Kyle gets to walk free? Based on how the media has been reporting this case, yeah, of course. Rittenhouse is clearly a white nationalist neo-Nazi murderer who showed up at a protest to kill Black Lives Matter protesters. If he walks, it's because the judge was a Trump fanatic who was constantly belligerent towards the prosecution, who loaded the jury with all white neo-Nazi jurors, who rigged the case from the start. So, I mean, like, that's essentially the media narrative on this case at the moment. So, yeah, if Rittenhouse walks, I would protest, of course, if that's what people think, right? And that's what every other fucking loser on this platform and YouTube has reinforced, and on Twitter, so. I think it's legitimate to make ethical criticism of a decision, to be there and to walk away from the first shooting. Just because something is legal and ought to be doesn't mean it's ethical. I don't know, maybe. The problem is that, like, I guess it depends. I feel like the bar for legal self-defense is higher in my eyes than the bar for moral self-defense. Like, there are self-defense cases that morally I felt like they were in the right, but legally they lost the case. So I guess for me, they're like, if legally they beat the self-defense charge, I feel like morally they've like over-cleared it. But I mean, like, we probably disagree on that, obviously. So. Do you expect riots if he walks? I don't think there will be riots. I think that I think there'll be protests. I don't think there'll be like super riots. Maybe for one night, but I genuinely, I am, bro, when you're calling American judges fascists, right? This is like, it is such an unbelievably horrible and damaging thing to say. You are undermining this is my criticism. One of the best thing about the United States of America, and conversely, the most damaging thing to do, right? The best thing about the United States of America is that our institutions are unbelievably stable. I don't know how, and I don't know why. I don't have the education. I just know that they are. Our institutions are very stable. The worst thing you can do is undermine U.S. institutions when you're in a position of power, in my opinion, because I don't even think anything else in a country matters besides the strength of its institutions. But once your institutions fail, nothing matters. Everything falls past that, right? When like rule of law collapses, when your currency collapses, when your government ceases to function, right? When you need to be, if you're undermining an institution, there needs to be a very fucking good reason for it. Something needs to be ultra fucked up. For instance, the government not recognizing that black people are humans. That's a good reason to go to war with an institution, right? Like there are reasons. I'm not saying it's impossible to say there's not a reason to undermine an institution, but like, why would you call a judge fascist? Like, that's like such a huge. But I guess like technically nothing I'm saying matters, because actually calling somebody a fascist isn't a huge charge these days. It's like calling somebody a racist. It doesn't even mean anything anymore because people use these words all the time. But Vox. Dude, it's like, don't link me this. Kyle Rittenhouse's tears. The 18-year-old who shot 3 men at a protest took the stand and resorted to a tried and true strategy for white men in trouble. Wait, so is it toxic masculinity that men don't cry, or is it toxic masculinity now that, where is the idea that men cry for sympathy? Isn't this a white woman thing more than anything else? Like, where does that idea even come from? Well, like, whatever. This article is horrible. This must be an op-ed, but like, Rittenhouse's victims were all white men, making them somewhat of an exception in American jurisprudence. Typically, such prejudgment is saved for people of color and is handed out by law enforcement. If people of color even survive encounters with law enforcement and live to see the inside of a courtroom for the chance to be wrongfully convicted or disproportionately sentenced, it feels like a small miracle. Like, holy shit. Do you think that cops just run around indiscriminately killing black people in the United States? Is that like the... Whatever, dude. Jamil Smith. Okay. Did you see this meme? Judge asked for veterans in the audience. One guy raised his hand and judge asked for a round of applause. Turns out the guy was a defense witness. Sure, I saw this. People are saying it's another example of bias. Would it be irresponsible to call Trump fascist adjacent then? I think you can legitimately make arguments for Trump, if not being fascist, then like attempting to be. But I think he fit the quality. But that's also like specifically talking about fascism. I don't like. I don't like everybody's uses that word to mean anything. Yeah, I don't know. It's like fuck it, whatever. Come on, Destiny. No, I'm sorry. You're not moving me off of that one. You're absolutely not moving me off that one. I'm sorry. When Donald Trump tries to mobilize the fucking military to enforce his insane fucking racist immigration law, which it was, like without getting the will of the American people, by trying to violate all the checks and balances, by working as unilaterally as possible, like, yeah, by trying to undermine our electoral process, by trying to act as like the single-armed head of state, by trying to attack our media, the institution of our media, the institution of our political system, by attacking, yeah, Trump is at the very least fascist adjacent. I have no problem saying that. But I'm not going to sit here and say like the whole Republican Party is fascist or every cop is fascist or blah, 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 blah. Trump's biggest problem wasn't his fascism. It was his stupidity, his political illiteracy and incompetence. The only thing that surpasses Trump's ego is his astounding stupidity. Okay. Man, I got an email from a math guy. It was really interesting. Did I ever read this before?
Is Alberman kink shaming in this tweet?
Fuck. Oh, I don't know why I just thought of this. This is a really interesting email to me. I'm sorry. I'm reading this anyway. Stay mad, okay? And then we'll get into the hippy-dippy stuff. Sorry. Hello, Destiny. I'm a mathematics student at university, and I'm listening to your conversation with the right-wing people. You're talking about the metaphysics, and you pose the question about the objectivity of mathematics with respect to the fake equality 1 + 1 = 3. You said that it would not be possible for you to imagine a world where anyone thinks 1 + 1 = 3, and that mathematics was in some sense innate or natural. While I might agree that this mathematical truth is well known by everyone, I do not agree that it is natural at all. Example, Shepherd is observing two sheep grazing in field every day. She observes 2 sheep grouped together, and then she observes 3 sheep disperse. In this case, 1 sheep and 1 sheep came together, and then the 3 resulted from this. 1 + 1 = 3. This example just goes to show how mathematics is socially constructed too. What seems obvious to us, that 1 + 1 = 2, is so because of the context. In the context of the sheep, what truly happened was that a male and a female sheep came together and bred a sheep baby. Another example, in the form of a joke/riddle my professor tells to illustrate this, is if you have a room with piles of hay, say 4 in the north corner, 5 in the east, 2 in the west, 1 in the south, and you push all of the hay piles together in the middle, then if someone comes in and removes 1 pile of hay, how many remain? Well, 0, of course, because a small pile of hay and a big pile of hay is a collection of all the small piles, and it's still just 1 pile of hay. Now, of course, we can understand these silly examples in light of our third-person perspective and education, but typically if you pose them to unsuspecting people, they either deny that the question is possible, they say, no, you cannot possibly observe 2 sheep come together and then 3 sheep leave, or they will point to their higher understanding of what is going on as a way to show that objective math prevails. Mathematics is a tool humans invented to describe certain processes, and according to whether or not it succeeds is sufficiently approximating these processes, according to whether or not it succeeds in sufficiently approximating these processes, we have amended it. But the ability to very closely approximate reality, the laws of physics, for example, are what we might consider very good approximations, in practice is something that we invented through trial and error. Mathematics today is often presented as coming from some basic axioms, but its origin historically was not from basic axioms, but rather mutual understandings of groups of people. Therefore, it must be that math is socially constructed, invented to suit the needs of the times, as is science and economics and all other fields of study. I'd love to hear your opinions on this. I've only been watching you since the start of this semester, but this is the first time I've seen you talk about anything related to mathematics. Sincerely, the person's name. I thought that was an interesting email. Fuck, my response to this is, I appreciate the perspective on this. I'll be keeping this in mind for future conversations. I didn't actually respond well, but I thought that was an interesting point. This was on October 12th, a while ago, but... Okay. Fuck. All right, link me this hippy-dippy thing. I can't believe we're staying up this late. Fuck. We're going to be late to stream tomorrow. Do I have anything scheduled? This guy doesn't know anything about actual modern math, but sure. Damn. Twitch chat. Shutting him down. How long is this fucking panel?
Wait.
Oh boy, Vouch is here.
Club sandwich with fries and a side of mayonnaise. Wonderful.
Mayonnaise and fries.
A little judgy, don't you
That's
think?
weird. So weird.
Wait, well, I'm pretty sure. Hold on, wait.
This is where it starts? Let me get a protein shake. Hold on one second. Hey man, I'll speak up for chat. Can you fix your schedule? It's honestly really shitty for people in the EST. My schedule's fine for EST. The only people that are truly getting fucked are Europeans. Fuck off. Fuck. I'm eating so many trash calories today because of Mel. Blame Mel. Okay, if I get fucking huge. Oh my god, we've already got like 4 soy faces in here. Oh boy. Dusty, I'm sorry, it actually starts here.
Divisive issue. So I'm just
Oh, okay.
caution. So I'm just going to ask everybody to heed some caution when trying to engage with others on this, because I will mute people if you do not like quiet down when I start talking, or and I will use it liberally. We're being law and order today, okay? So we're going to start this time in the bottom right hand corner with the person who was just talking, Vouch Vidya.
Yeah, first of all, more like Shittenhouse. Happy to get that one out there. I think that, so the trial right now is going over a number of charges. What we're mostly looking at here is the self-defense claim, which I'm not a legal expert. It seems like the self-defense claim that he has towards the homicide charges is legit. The circumstances of the killings are such that he would be, that he'll get let off on that. There are some other charges he might catch, but that's what people are really paying attention to. But I think that the conversation here on whether or not what he did legally falls under the definition of self-defense isn't really the pointed issue to me. It's more about the cultural forces that would lead somebody like him to not only feel it's necessary to, but actually go out and essentially act.
Here's the real conversation that nobody wants to have. Okay? Here's the real conversation that nobody wants to have, all right? So, if you want to talk about the cultural forces that would push a 17-year-old conservative to go carry a gun somewhere, that is a totally legitimate conversation to have, and it's one that we need to have. Absolutely. But a big part of that conversation is going to be the implicit endorsement of the riots that have happened so far. If you are going to stand in front of a burning fucking car lot and have the headline mostly peaceful protests, you are contributing to a culture where people feel like they need to bring guns to defend their shit. So if you want to have the conversation that we need to have a talk about the greater cultural aspects that would lead somebody to feel like they need to take a gun somewhere to protect their shit, then we need to talk about why people feel that need. Now, is some of it Republican fear-mongering? Absolutely. Absolutely it is. Were the majority of the BLM protests peaceful? Absolutely they were. But there was a lot of it that wasn't. And I didn't really feel like, outside of when it got really bad towards the end, didn't really feel like Democrats were too keen to call that out sometimes. And if you're not willing to condemn that violence, and there's this implicit acceptance for it, and if you're in part of the communities that are negatively affected, and all you hear is people saying over and over again, bro, 93%, 93%, 93% of all protests are peaceful. Okay, that's fine. I live in the 7%. Okay? We should have learned this with Trump. We should have learned it with Brexit. 95% of people benefit from globalism or whatever, right? The 5% that don't, though, you better believe they're going to feel like they're getting fucked hard by it, right? You have to understand this. It is essential to understand this. Okay, why is Bad Legal Takes copying my fucking Twitter? Ban these motherfuckers. Sorry.
As a right-wing militia during a civil rights protest under the, the guise or perceived intent of defending property. It's a symptom of a disease, a broader cultural issue that extends well past the legal definition of self-defense.
Well, it feels like he always is envisioning himself as like a video essayist in real time. The problem, well, I surmise, is a great many conditions that would lead us to believe that this isn't only a problem that exists in a vacuum of Rittenhouse. It's actually a greater cultural problem. It can be contributed to by three leading causes. One, the overall air of entitlement that conservatives have towards their firearms defending property. Two, the greater circumstances. It always feels like, bro, be a normal fucking human. This is so fucking cringe. Stop doing this, okay? You're not a walking video essay, okay? Save it for your actual video essay. Yeah, 2, capitalism. 3, white men.
Okay, next we're going to throw it over to Riley.
So, are we talking about just anything having to do with the Kyle Rittenhouse trial, or is there anything specific?
You can interpret the question however you want.
Okay, so I guess going a little bit off of what Vosh was talking about, I would disagree that this doesn't have to do with the legal issues. Something that's been very troubling to me just watching, because there are criticisms that you could raise about some of the decisions that the trial judge has made. For example, like there was a ruling that they could not refer to the people who Kyle had killed as victims, but that if the prosecution laid, or if the defense laid the proper evidence, that they could refer to them as rioters or looters. It's weird to specify that they could do the alternative. It's not necessarily...
Wait, okay, hold on. Where's Pisco at? My understanding is those people being rioters or looters, that's not material to the trial. We're not here to determine whether or not they were rioters or looters, right? What we're here to determine is whether Rittenhouse is a fucking murderer or not, right? So the subject is like directly related to, are these people victims? That's my understanding. Now, maybe this is like not like a 100% clear-cut thing, but there is an argument there, right? I feel like if you're having a self-defense case, calling somebody like a victim, I mean, well, if it's a victim, you're kind of begging the question, because you can't be a victim of somebody else's self-defense. If you're a victim, they fucking murdered you, you know? Yeah, but...
unheard of to rule in that kind of way. Usually has to do with like a 403 evidentiary ruling, but it's weird to specify that they're able to do the alternative. And then other things like, for example... having the court clap or applaud for the expert in the case. Now, granted, it was on Veterans Day, and they were the only veteran in the room, so you could argue, like, well, it's plausible, like, they could...
I could be I'm just pulling this out of my ass, okay? It would not surprise me if judges all over the fucking country did some shit like that, where it's like, hey, guys, it's Veterans Day, like these are probably some of my guess is, they're probably some of your most patriotic fucking people, if you're a goddamn fucking judge, right? So this does not surprise me at all. Now, is it bad optics that the only fucking veteran was an expert witness on behalf of the vets? Yeah, for sure, it's bad optics, but like, is it bias? Are we like championing I don't know.
Could do it, but it's still like a little weird.
He said he learned how to publicly speak that way, and his autism makes talking that way the easiest in front of others. What do you think? I think you'd have to be to believe that answer. No, he speaks that way because everything he says is a fucking performance, and he's trying to perform for an audience to make it sound like all of his points are really good. That's what the answer is, okay? Anything else is a lie.
That being said, just from what I have seen at the trial and going over it, it seems like a lot of the evidentiary rulings have been reasonable. I haven't seen like any major red flags flaring up. I'd be interested in hearing what Lecture Fan has to say on that front, since he also has legal background. But I was talking to Pisco yesterday, and that seemed to be like the consensus among us looking at the case so far. But there's a lot of people online who are talking about this as if the case is rigged, and that's troubling because I want to make sure that we don't end up in a situation where just because the case may not go over how we want it to personally, that we start saying that we should not trust the results of the of the election.
I love that she almost said of the election. That was such an awesome Freudian slip, and I know she believes it too. Riley's awesome. I love Riley. It's such a good Freudian slip because that is true, right? Like, the system is rigged. I don't believe the election. The system is rigged. I don't believe the judicial outcome of this case, right? It is the same thing, essentially. Yeah.
Similar in that respect, but trusting the results or the outcome of this case. Appeals will happen, and we should trust that process, but we need to make sure that we still trust the process. I also agree that, like, this does not mean that we can't morally talk about what he did, but I just want to make sure that we're all, like, separating those conversations. I'll leave that there.
Okay, next is going to be Lumi.
All right. I think Bosch already hit the point I'm most concerned on is why did he end up here? What are the social sources there? As well as what are we doing to actually have justice in terms of how do we get our communities towards an area where we're not having these white supremacist militias, and especially in the middle of the time when we do need to be expanding these.
Just to be clear, my understanding is I don't think there was any evidence that there was any white supremacist militia people there. As there, the only evidence that I saw that Kyle Rittenhouse was white supremacist is that one of the people in that militia had liked white nationalist memes or something. I don't think there's any evidence that there was a white nationalist militia at this event. I don't think that's true at all. At least I haven't seen any evidence saying as much.
These conversations on racial justice. So those are my primary concerns with this case.
Okay. Also, Lumi, I sent you a DM. I'm going to throw it over to Lonerbox.
Yeah, I'm definitely not swayed by like 90% of the arguments I've seen, especially like on leftist Twitter about the trial being rigged or the fake crying white supremacist sociopath or anything like that. I think the most productive criticism that could be made has already been kind of mentioned, is just that like every role model in Kyle's life convinced him that he was doing the right thing to go there. Like whether it was the person who gave him the gun or the adults from the Facebook group who got him down there, the cops who were giving him water and saying, we appreciate you. And then obviously all of the conservative like groups afterwards who were not only like elevating, but just like making like a martyr out of him. And I think there's a pretty dangerous press.
What the fuck is this fucking accent? I always feel like people that speak with this accent always have good shit to say. What is this? I feel like as soon as I hear it, I was like, fuck, this, I'm probably gonna agree with everything this Bonger? Scottish? Oh, ew. It must be a particular, okay, not Bonger. Jesus Christ, we need to wipe that thing from our minds. If it's just a Bonger accent. Scottish people don't count as Bongers though, right?
In that of the idea of like letting a 17-year-old walk around with a semi-automatic in the name of defending property, and they kind of know that. Like they've said that his behavior during those shootings was like exceptional. You know, like he let his gun down when someone had their hands up. He only shot people who were attacking him. It looks like he's going to get off in self-defense. And the thing is though, like 9 out of 10 17-year-olds in that situation would have probably just panicked and opened fire into the crowd. Like, this isn't the kind of behavior you should be encouraging. And I think especially if we're talking about role models, I think Kyle is like basically like a very misguided child who has been surrounded by very toxic role models who are just giving him all the kinds of reinforcement and elevation that is probably going to set a precedent for, you know, other young people to maybe try and do something similar. And we probably won't be as lucky with, you know, only 2 dead. We might have 20 next time. So I think that's Yeah.
Next, we're going to throw it over to Lecture Fan, the first conservative of the program.
Okay, so these are essentially these local crime stories that get blown into national stories because the media and the Democrats think it fits the narrative. There's shootings, there's killings, there's all these things that happen all the time, all across the country. They never get talked about, they never get brought up, except when Democrats in the media thinks it fits their narrative and they think it's a good thing to push. So that's what happened with Kyle Rittenhouse is, oh my gosh, this fits our narrative that there's all these white supremacist militias out there. And so that's why it got turned into a national story, even though they're shooting.
Every piece of national media is going to be, quote unquote, selected for. This is absolutely true. Whether it's Democrats choosing to talk about Kyle Rittenhouse's case, or it's Republicans choosing to talk about one set of curriculum in one city, in one small town that they say is evidence of CRT being taught across every fucking school. There's always some selection bias when it comes to national level news because you can't report everything. So you're necessarily making a choice to choose what to report.
Self. Don't be a
shootings
linker.
And there's killings like every day in the United States. We never hear about them. And here we are talking about it first topic. So what's funny, though, is that the trial's actually showing that what the narrative and the Democrat line was completely false, and that Kyle Rittenhouse has been completely slandered and defamed by Democrats and the media throughout this whole thing. And now everybody finally admits, oh, yeah, he's going to get out on self-defense. Well, it's interesting that it takes a trial to prove what the media and the Democrats were pushing as a complete lie. And so this also shows the politicization of our justice system, and it's really sad that
some fundamental misunderstanding. I don't know if Lecture Fan is a real lawyer, or maybe he's not a trial lawyer. I have no idea. I don't think lawyers are very intelligent, by the way. Sorry if that offends anybody. But lawyers, I consistently run into lawyers that just talk way out of their area of expertise, that say so many dumb things. I don't know why, okay? But regardless, okay? The one thing that drives me crazy is when I hear this over and over and over and over again, right? I don't think we needed a trial to prove this. You don't know that, motherfucker. That's why we have trials. Like, how many people, how many black men have been lynched under the, like, I don't need a trial to know this. I don't need a trial to know. What the fuck? You don't fucking know that until you, at the very least, go through the discovery pretrial process. You don't know if you need a trial. I hate that expression because when you say something like that, like, we don't need a trial to know any of this, like, you're kind of missing the entire reason why we have trials, right? Like, it's literally the entire purpose of that legal system to exist.
A kid like this would get prosecuted here solely because of politics, not because of the facts, not because there is probable cause to believe he committed a crime, just for politics. And Vosh and these other people here are admitting that, well, yeah, he's innocent. Yeah, he's innocent. But it's still a concern that he was there and stuff. It's like, no, these were rioters literally burning the city to the ground. And it's good. And I mean, frankly, the Democrats don't want the police there actually pushing back against these violent criminal rioters and looters, literally burning the city to the ground. And so somebody, there's nothing wrong with somebody saying, okay, somebody's got to like push back against this criminal activity. This is insane. These people are burning the city to the ground. And the Democrats and the media are saying this is fine. This is justified in the middle of COVID because, you know, racism is a public health crisis too. So don't worry about COVID here or anything. Let's just let this burning and rioting go on. And it's like, come on. You guys never talk about crime until it fits your narrative and you can go around saying white supremacists, militias. It's like, no, it's got nothing to do with that.
Okay, next is going to be the Hake Report. Got it right this time.
Well, I appreciate it. I call him Kyle Jack Bauer, John Wick Rittenhouse, not to glorify violence at all or glorify unjustified violence, really, because as everybody before me just laid out.
Okay, hold on. I have to back up for a second, okay? I'm going to speak as a father, all right? If you are glorifying Rittenhouse and trying to make it sound good that you saddled violent problems in your country on a 17-year-old kid, you are beyond fucked in the head. There is something that is wrong with you on levels that like humanity does not reach, okay? Regardless of if Rittenhouse is right or wrong in self-defense, regardless of the outcome or anything, this kid is probably going to be scarred for life. Normal human beings don't shoot 3 people and kill 2 and walk away from that okay for the rest of their life. Like, anytime somebody charges this kid, anytime he watches a certain type of fucking movie, fuck, he might even hearing a gun go off or a car backfire or whatever is going to fuck with this kid's head dramatically. When you're sitting here championing that kind of thing, there is a whole slew of circumstances that led to that is just appalling. And for you to champion the outcome of that, like, if you want to say anything good about Rittenhouse, he survived the situation. Congratulations to him. I think I would go as far as say that. Good job. You got it alive. But to pretend that, like, this is our fucking hero defending our streets. Bro, go out and defend him if you believe so fucking strong about it. You've got just as much a Second Amendment right as any of these motherfuckers. Be a fucking man. That's how you want to play it. Get a fucking gun and you go out there and do it, okay? This shouldn't be shit that we saddle our children with. You're failing as an American, as a human, as a fucking man, as a Republican, as a whatever, as a media person, whatever the fuck you want. If you think that this is the type of shit that should be championed, you are fucked in the head. It is such a horribly disgusting fucking thing to do. Sorry. Seeing that kid broken to people like Son was actually exact discussion. Okay, yeah. In a video game, by the way. I didn't mean to say that he should go out and fucking... I don't know what the interpretation... I don't know what the interpretation of that comment is. I don't mean to say that he should go out and actually, like, do that. I'm just saying that, like, don't saddle your children with these types of responsibilities. Like, you need to figure out how to fix these problems on your own. Fuck, I just realized how that sounds. We got him, boys. See you on YouTube. Doesn't Destiny own a gun and was showcasing it? You're actually so fucking stupid, I'm permabanning you, okay? And then I'll explain why you're stupid, all right? 17-year-old kids going out into the street and shooting people is not a cause for celebration or hero worship. That's not, and I have never said as much. I've said it before, and I will say it again. I would never go out and die for somebody else's property. The only business I would defend with my life is like a family business that I need to feed my fucking kid. All right? That's the only thing that I give a fuck about. So I don't think it's smart. I don't think anybody should do it. I don't think Kyle should have done it. And I don't think the environment should be created where somebody feels like they need to go out and do that. Unless you're literally about to like lose your fucking like means of surviving for your family or whatever. Oh, Jesus.
He handled himself perfectly once he was on the scene and faced with these criminals attacking him. And I'm just...
What criminals? I don't know if any of the people attacking him had been charged or convicted of any crimes. Unless you mean they were criminals in the past. Are we doing the no angel argument? Like...
So impressed with him. I think he seems to be an upstanding young man. I know he had a right to...
Hold on. Rosenbaum's prior conviction history, 1, is irrelevant completely, and 2, was unknown to Rittenhouse at the time. So, no, neither of those things are relevant.
Own and carry a gun. I don't care what the Wisconsin law says. They call it an illegally purchased gun. The real issue seems like everybody has conceded that...
What the law says... is not only important, okay, but it is perhaps the most important matter at issue here. What the fuck are you talking about? Like, what the law says here is pretty important to determine if what we felt like he was doing was a reasonable, correct thing to do or an incredibly wrong thing to do. There might be other circumstances where it's not. Like, if somebody's breaking into your house and you're 6 years old and you have a gun and you keep them from, like, killing your family, okay, sure, but, like, not in this case.
That he is completely innocent in the killings and the self-defense shooting of that Grosskreutz. I wish the rest in peace to the attackers. I have no ill will towards them, but they really brought that on themselves. They were the vigilantes, not Kyle. And it is a concern.
I do agree with that. I think that I don't know if I'd say they were vigilantes, but like, yeah, they kind of were, right? They're taking justice into their own hands. They've got to apprehend Kyle Rittenhouse. They're going to do that's vigilantism. It really is.
That we have politicians, local politicians, who are unwilling to protect.
I'm not logged into Twitch on this. People are saying that both sides were vigilantes. Rittenhouse did not shoot or kill anybody in defense of property. If he would have, I would consider him a vigilante, sure. Could you argue that him showing up and playing medic or whatever is vigilantism? Maybe. But I mean, like, yeah, I don't think killing somebody in self-defense makes you a vigilante, which is the subject matter here, right? You could argue that Rosenbaum maybe was the aggressor and the other two were vigilantes, sure, but I need to log into Twitch on my. Dylan better be getting fucking ad revenue for this shit. Technically, he could legally carry the gun. The law has a weird flaw. So there's, fuck, there are names for this legally. Pisco might know this. Some laws figured out because of what's on the books, and other laws are figured out because of like I don't know if you say case law or like precedents or whatever. There are a lot of laws in the United States. My understanding is that right now there are a lot of laws in the United States that exist that are total bullshit. So they're either completely not enforced, or if they were to come up, they would be challenged and overturned. I think that's just like part of the U.S. process. That like that's just there just are. There are tons of laws that exist that are total bullshit. Either nobody enforces them, or if they were ever to try to enforce them, they would be overturned almost immediately. Yeah.
This is the innocent people from the terrorists, the insurrectionists. And there was no reason to have a protest over there. That was a completely justified shooting of Jacob Blake. He was out of control. Non-lethal measures did not work. So they had no reason to be out there rioting and looting and terrorizing the city. So
wait, holy shit. Was the Kenosha stuff over Jacob Blake? Was this the guy in the car with the knife? Oh my god. This is like mountains of bullshit. Wait, do we all know what the Jacob Blake shit was? So the original facts of the Jacob Blake case were like a black man had the cops called on him for no reason, and he was trying to get in his car and drive away, and the cops fucking shot and I don't think they killed him actually. I think they shot and seriously injured him for no reason in the seat of the car because they couldn't pull him out of the car. I think this was the reporting on this. He's paralyzed. But what actually happened was Jacob Blake was trying to kidnap, I think, his fucking kid from his ex or his kid's mama. She called the cops. The cops showed up. He got tased, continued to run from the cops, got in the car. They tried to pull him out. He pulled out a fucking knife while he was in his car trying to drive away with the kid that he was trying to kidnap, and then the cops shot him. This is like one of the reporting on this case was wild. When I actually read thank God. I think this is one where I read the facts of the case. I was like, holy shit, I'm so glad I didn't say anything. The cops were absolutely in the right on that. It like wasn't even remotely close. But yeah, holy shit. I didn't even, it's been so long. I didn't remember. This is what the Kenosha riots were over. I think he might have had an active warrant as well. Yeah, I mean, we can look into the Wikipedia real quick to make sure that I've got the facts of the case correct. Okay. Let me just read this because I want to make sure that when I'm saying anything like here, we're actually reciting this correctly. It's really important to me now. On August 23rd, 2020, Jacob S. Blake, a 29-year-old black man, was shot and seriously injured by police officer Rustin Sheshki in Kenosha, Wisconsin. Sheshki, Jesus, shot Blake in the back, firing 7 times, inflicting multiple wounds. When Blake opened the driver's door to his girlfriend's rented SUV and leaned into it, Shesky said he believed that he was about to be stabbed. Earlier during the encounter, Blake had been tasered and had scuffed with officers. Blake had a warrant for his arrest in July based on charges of third-degree sexual assault, trespassing, and disorderly conduct in connection with domestic abuse. Both Kenosha Police Chief Daniel Miskins and the Kenosha Professional Police Association stated that the officers dispatched on August 23rd were aware of the pending warrant for Blake before they arrived on the scene. The police shooting was followed by unrest, which included rallies, blah, 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 blah. Okay, hold on. Let me look at the actual facts of the shooting thing, okay? On August 23rd, Kenosha police responded to a 911 call about a domestic incident at approximately 5:11 p.m. According to multiple official sources, the female caller referred to Blake as her boyfriend, said he was not permitted to be on the premises, and that he'd taken her car keys and was refusing to give them back. Officers were also informed by the dispatcher that there was a wanted alert for someone at the address indicated by Police Code 1099. Blake had a warrant for his arrest from July based on charges of third-degree sexual assault, trespassing, and disorderly conduct in connection with domestic abuse. The woman who called 911 on August 23rd to report that Blake had stolen her keys was the same woman who had previously filed the criminal complaint alleging that Blake had sexually assaulted her. The previous May, the woman alleged that Blake entered a room where she was sleeping near one of her children, thrust his finger into her vagina, pulled it out, smelled it, and said, "Smells like you've been with other men." The alleged victim also said that Blake had sexually assaulted her approximately twice per year. Both Kenosha Police Chief Daniel Miskins and the Miskinis and the Kenosha Professional Police Association stated the officers dispatched on August 23rd were aware of the pending warrant for Blake before they arrived on scene. One witness stated that Blake pulled his car up near 6 or 7 women shouting at each other on the sidewalk and that Blake did not say anything to the women. According to other witnesses, Blake was trying to intervene between 2 women who were arguing when police arrived. Officers attempted to subdue Blake, and 2 officers used tasers on him. A bystander who recorded a video of the incident told reporters that he heard police yelling, "Drop the knife." The bystanders also stated, "I didn't see any weapon in his hands. He wasn't being violent." The police union says that Blake was armed with a knife in his left hand, but officers did not initially see it, and he forcefully fought with the officers, including putting one of them in a headlock while ignoring orders to drop the knife. Based on the inability to gain compliance and control after using verbal, physical, and less lethal means, the officers drew their firearms, the police union added. One of Blake's attorneys disputed this version of events, calling it overblown and saying that the police officers were the aggressors and immediately became physical with Blake upon arriving at the scene. After the initial scuffle, Blake walked to the driver's side of his girlfriend's rented vehicle, followed by Officer Rustin Shesky and another officer with handguns drawn. Shesky attempted to grab Blake, and when Blake opened the driver's side door and leaned in, Shesky grabbed him and fired 7 shots towards Blake's back. According to Blake's attorney, 4 of the shots hit Blake. According to Shesky's attorney, Shesky saw Blake put a child in the vehicle as he arrived and heard a woman say, "He's got my kid, he's got my keys." Shesky shot Blake, believing he was attempting to kidnap the child in the back seat of the vehicle he was entering, and because Blake had a knife in his hand and twisted his body towards Shesky. In a press conference on August 26, 2020, Wisconsin Attorney General Josh Kaul said the knife was recovered from the driver's side front floorboard of the car Blake was leaning into when he was shot in the back. Kaul also said that Blake told investigators that he had a knife, though Kaul declined to describe the knife or say whether it was related to the shooting. Blake's lawyer disputed that the knife was in his possession. The prosecutor who oversaw the investigation said that Blake admitted to holding a knife and that officers and witnesses stated that Blake turned towards Officer Shesky with the knife immediately before the shooting. Blake later admitted that he wasn't thinking clearly and picked up a knife during the altercation, although he denied having the intent to use it. So this was the case that I don't know how many of you guys remember hearing about this, but this was the case where people said, because there was some video footage released of this, where people were saying like, "Oh my God, this poor black guy was trying to get in a car and just drive away and cops shot him in the back like 7 times. This is that case that people were reporting it that way. This is, okay. When I say that people are being irresponsible, when I say like Hassan is a stochastic terrorist, this is what I'm talking about. The media coverage and the way that people responded to this, I believe that you can draw a direct line from the speculation on this case to the Kenosha riots. So like I would say that the deaths of the 2 people during those Kenosha riots are probably more the fault of the media and the alternative media than they are of Kyle Rittenhouse. I would absolutely make that statement. I would absolutely defend that statement with my life. Fuck everybody involved with this bullshit. Okay.
So it's a shame that it took a young man to handle business there, but I'm glad that thank God he was armed, and thank God that he didn't hurt anybody else, but angels were guiding his aim, and
Wait, oh no. Vosh video on Jacob Blake. Am I gonna lose it here? Is there any violence in this video? The title of this video is, "They Can't Justify This One, but They'll Try to Anyway."
Oh, wow. Hello. Another video being recorded not at stream time. I wonder why. Look, no chat. Sorry, just me this time. What could compel me to be recording a video at 11:02 p.m.? Well,
complimentary Vosh tweet. Conservatives, I'm undecided on Jacob Blake being shot in the back 7 times for literally no reason. Has he ever smoked marijuana? Like, this is stochastic terrorism, okay? When you are causing a scenario where the only reasonable response is for somebody to act in a violent manner to address it, this is what stochastic terrorism is, okay? All the same accusations people made about conservatives playing these games, this is what you are doing, okay? Okay, I don't know if he shows the shooting in the video, so hold on.
Unfortunately,
stop. I would permaban you. To be fair, this was before all the details were revealed. Then don't fucking say anything.
Unfortunately, there has been another police shooting, of course, of a black guy. And the reason this is noteworthy to me is because I thought it would be nice to just immediately take account of the conservative reaction to this sort of behavior. Now, normally I don't show these videos, I just describe them. This time I'm going to show it to you. So, if you don't want to see a black guy get shot, or listen to it, I guess, respectively turn away from the screen and close your eyes for about 20 seconds. But I think you should see this. Here we go.
The audio might be not safe for life, so I'm going to mute this for 20 seconds. Hold on. So he says, 3 cops, 1 guy, and there you have it.
Now, the play-by-play for you there, that car had his kids in it. I think 3 kids. 3 kids in that car. Anyway, the fella walked around the car while the 3 officers pointed guns at him and shouted. He got in
just walking around the car.
In the car, and one of them, who had a hand on his shirt, shot him in the back 7, 8 times, thereabouts. Now...
Oh, holy shit. Oh my god, I feel like I'm in the Marvel universe. And it's all coming together. Post. Vosh is morally responsible for the Rittenhouse killings. Extreme effort post. Posted by Doomer Politics. Holy shit, 5 months ago. Jesus Christ. If you guys are unaware, this is the guy that made the Vosh is morally evil video. Jesus. First of all, Jacob Blake, if you reflexively defend everyone who is a victim of a police shooting, this is a good opportunity for you to improve your media literacy. The police were dispatched to the scene because the mother of Blake's children called them in response to domestic disturbance. When police were called to the scene. Blake had a warrant out for his arrest for domestic violence and sexual assault. Blake was in the process of kidnapping the children. That's why they were in the car. I don't know if this is 100% confirmed or not. I know in the Wikipedia article it said somebody said kids were in the car. I don't know if they were in the car. Does anybody know 100%? But Blake took her keys and would not return them. She was afraid Blake would steal her vehicle and crash it, something he had done before. When police arrived, she flagged them down and told them that Blake was in the process of stealing her car and kidnapping her children. Police saw this. Blake resisted arrest and refused to comply. But yeah, but okay, let's back to this. Hold on.
I am not a police officer, or in fact, much of anything besides a YouTuber, and just a devastatingly charismatic person. But I want you to, and please follow through with me here. I want you to look at this, and I want you to think, if you were these cops, okay? see these police officers right here, and you really don't want this guy to enter his car. Really don't want him to go in there. Who knows what could be in there? A nuke, maybe. Do you think there's maybe anything you could do? Anything whatsoever?
Like maybe having tased him twice?
Oh, we got the guy coming in. He's got a grab on the shirt. Years of police training come into action. What is he going to do? What will he do to disable the man entering the car? Will he...
I don't know how... Dude, have I ever given a take that's been... Besides food, have I ever given a take that's been this... just fucking... so fucking bad? Like, oh my god. And movies. Jesus fuck. Like, holy shit. Like, oh my god. Just... like, to be so wrong. To be so wrong.
Pin him against the rear door? Will he throw him to the ground in some sort of jujitsu move? Or will he just let him go in? Just sort of go in there. Are we gonna grab the arm rather than the tank top? Gonna grab the arm? Nope. Nope. We're gonna hold on to the shirt while we just fire into him. Right there. Just like that. Now, I'm going to give you a factual accounting of what has taken place since this point in time, and then I'm going to talk about that.
Okay,
so,
let's hear it, Vosh.
Since we have clear footage of what is editorialized a little bit here, and obviously unjustified, not at this point in time murder, by the way. I believe that guy's in emergent or critical condition, but he is currently alive at the time of this recording. That might not be the case when this video is uploaded. There have been immediate protests which sparked outside of the police station in that town, and they have subsequently declared a curfew. So that's what's happened on the ground. Here's what's happened online. The conservatives are justifying it. I know, big shock. I'm not going to dignify the conservative channels that are doing this because I know they get off on the attention and they jerk themselves raw, imagining all of the people who are concerned with stuff like human rights and due process, getting mad at them. But there are a lot of conservatives, not just little nobody accounts, but big accounts that are saying, "Oh, if only he didn't. If only he had followed orders. That cop just had no choice but to unload into him from behind. If only he had followed orders. If only he hadn't gone to the car."
Imagine being... Could you be more wrong about a particular case? There's like 10 more minutes of this. I don't need to watch this. Just holy damn. Holy shit. So Vosh was like... Not only was Vosh wrong on the Jacob Blake shit that led to the Rittenhouse stuff, but then he's part of the machine that drives people out to protest. And then when somebody gets killed protesting by somebody else that he encouraged people to go protest for, then he takes the wrong side of that shit as well. Holy shit. How can you be so fucking wrong on so many fucking things like altogether? Like, holy shit. Sorry. Jesus.
I appreciate him.
Next is going to be counterpoints.
Okay.
This is fucking amazing. All right. I think you guys are going to see why I'm a fucking centrist. Holy shit. So, the way the prosecution has conducted themselves has been pretty fucking bad. I wouldn't mind getting into that with RGR because I literally just had a debate last night with, our good friend Destiny. Basically about like procedural rules and whether or not you can introduce information that you kind of know to be bullshit. I think that
dude, Connor actually he triggers the fuck out of me so much with his takes on this. Oh my god.
Something that we can talk about. A question that was asked by a few of the leftist panelists was, what is prompting people to form militias and these civil defense organizations? Well, I would say it would be the public narrative that we've all been dealing with for the past 2 to 3 years, and hopefully we can unpack that. But one of the things that I've been fighting for the past 2 years is let's just defund the police and figure it the fuck out. Well, no. If you slash a police department budget by 10%, or if you encourage them not to enact on behalf of the community, there's going to be a power vacuum. This is how power works. And as a result, you're going to have militias that take to the streets, and you're going to have basically vigilante justice the way that, not even vigilante justice, vigilante violence, the way that we've seen in this particular incident. Excusing rioting or the conflation between rioting and protest, I think, is part of the problem that let a 17-year-old walk around with a rifle. And then it's weird to me that, like, maybe we can parse this out. I don't have high hopes, but maybe we could parse out, like, why is it that a 17-year-old with a rifle going into a community in order to defend property is morally like reprehensible, disgusting even. But, you know, the day he turns 18, we can give him a rifle and he can go to Iraq. And the day he turns 21, we can give him a pistol and he can become a cop. Like, that very clearly the moral impetus that Kyle Rittenhouse had can be used for positive means. It just wasn't used for positive means. Finally, getting to the conservative things, handled himself perfectly. No, absolutely fucking not. Part of the reason why there's 2 dead people and part of the reason why there's a grossly injured person is because he got separated from his group. So he left himself, like, open to be attacked. This would be something that a law enforcement officer or a military member would have known not to do. And as a result of his negligence, he got 2 people killed and 1 person greatly maimed. So no, he didn't handle himself perfectly. I'm happy he got to do the John Wick voodoo after he fucked up by getting separated from his group, but god damn it. And then on top of that, this is my last point, and then I'll yield the floor, is like, this is an opportunity for de-escalation. After these intros, I don't exactly have high hopes for that, because it seems like everybody just wants to repeat the same fucking narratives that got us here in the first place. But I'll leave it for the open, and maybe we can pack some of this shit apart. We'll fucking see.
Okay, so we have one more intro. It's going to be Brent's. But I want to say that what we're going to do, instead of going straight into it, due to, like, how different people look at this situation, we're gonna have people raise their hand, and I'm just gonna choose who starts this off so we can get the ball rolling. So we're gonna have Brant next.
All right, so I guess it's time to piss everybody off, because I'm gonna say some stuff that pisses everyone off here.
Nothing US.
But yeah, this is in the art of compromise, right? This is in the idea of keeping things in the realm of logic. Okay, so we have 17-year-old gentleman who is dropped off knowingly by his mother to defend businesses. Is he legally within his right to carry the rifle? Yes. Does he lawfully possess the rifle? No, it's someone else's. He is lawfully having the gun on his persons, which creates a loophole there. Now, we can argue, should he have ever been there? Would I have called him and who I call the patriot private citizen feeling the need to do what the police want to do, they don't want to do? Should we stigmatize them? Not necessarily, but you should judge people that do take the law in their own hands and decide to do things like that. That being said, that does not give the right for an 11 times convicted, we'll just say offender. I don't want to get the show in any trouble here. But an 11 times convicted offender, another person who then not witnessing, but rather adhering to a call for vigilante justice to cranium Kyle, making the same fatal mistake that Rosenbaum did by grabbing at the gun. Does that give them the right to attack the kid? No. Do I believe that self-defense is what we've seen? I think all 3 times were clear, cut and clear moments of self-defense. Where do I think that we should be looking at to fix this from a point of reconciliation? Well, I think we really should look at how the FBI and how all state and local authorities handled the riots. Also, we need to look at the fact that Rosenbaum, a person who was released from a mental ward and then immediately went to go riot, we have to ask the same way we would ask Wendy Rittenhouse, what the hell are you doing dropping your son off at something that is very dangerous, known to be dangerous. And then we have to also ask, who is allowing Rosenbaum to keep doing what he's doing? That is what starts the first domino. That's what kicks all of this off. That's what starts the chase. That's making multiple threats to not just Rittenhouse, but other people in the crowd as well. And so what I'm saying is, in the art of compromise, I think if we were going to go after anyone, it would be a point of reconciliation with law enforcement, and then it would be possibly finding a window of pursuing the fact that Wendy Rittenhouse knowingly leaves her son somewhere he's a minor, and that to me is where the avenue of jurisdiction is. Other than that, nobody has the right to attack a minor who is lawfully carrying a gun, and that's what I will end on there.
Okay, so those were the intros. Now we're going to go into an open period again. Please consider how difficult my job is going to be today when you talk to people. Now, if you want to be the first person to talk, raise your hand and I'll just call on somebody. Okay, Riley was the first, so I'll throw it to Riley.
I want to ask to get this out of the way. Does anyone actually have any issues with the legal matters in this case, or are we all just talking about the moral issues or the other circumstantial issues? I just kind of want to.
Point.
Sorry. What?
I said that's a great point.
Okay, so I'd probably just distract. We could do it one-on-one, but my problem is there's just some information that the prosecution is using in order to try to make their case that I feel goes contradictory to the evidence. And basically the crux of the debate is whether or not defense attorneys or whether or not prosecutors should have the right to basically ignore exculpatory evidence that should be able to basically exonerate somebody or basically exonerate somebody. Do they have the right to basically just throw shit at the wall and see what sticks? And I think that's one of the main things that libertarians or conservatives have been frustrated about with this case. Is,
God damn it!
Basically, seeing the prosecution just kind of throw shit at the wall.
Yeah, I agree.
Okay,
I agree.
Does anyone? All right, hold on. So, does anyone else actually have any knowledge about that? I'd be fine to talk about that, but if everyone, I heard everyone talk on this, and it sounds like everyone is talking about more about the ethics of what Kyle did.
Well, I would go into an anecdote specifically within the case where there is a moment where the judge and the prosecution are having a back and forth in which the prosecution has mentioned things that multiple times have been cut and clear. Do not bring this up. You will plant a bad seed. It could corrupt the jurors' decision making. And it was about his silence. There were other moments as well where there were basically arguing what color the sky is, pixelation, and trying to explain interpolation to a judge who just knows pinch and zoom, doesn't understand the fact that whenever you have a canvas that is 1920 by 1080 pixels, whenever you are pinching and zooming, you're essentially cutting away pixels to add in pixels in hopes of clarifying an image. Now, whenever the judge asked the prosecution that the burden of proof was on them to prove that there had to be a precise, rebuttal from their, I believe it was an FBI person who had clarified the image, he could not give that clarity. They knowingly put him up there just so that they could keep talking about the subject. These are episodes of what I consider state malfeasance, and the fact that they'd much rather drum up a bad feeling or a theory for which will get thrown out anyway, but once it's in their brain, it's in their brain. These are all episodes of what I consider a state.
Oh, let's take a break, guys. Okay, when does this get juicy? I don't know if I can listen to these guys just talk about this for fucking 12 hours. Is that Vosh picture about me advertising on his video? Is that real? That's actually funny as fuck. Can you just sub? Well, it's not a sub. If I just log in, I have Twitch Turbo, but I'm just not logged in on whatever, Edge or whatever. Destiny, did you see this clip? Wait, this is coming up later. Why would I watch a clip?
Basically sees bad shit going on in his community and feels like he needs to do something in order to step up and stop it. Lumi, you seem fucking animated. I would love to hear your opinion on this.
It's not his community. You keep saying this is his community.
Dylan, you've been waiting for this.
What? Why would you? Oh, God. I don't understand how Lumi still thinks that they can have these conversations. I don't know why you would try.
Shit all
Can I
fucking
speak
night.
on that,
Lumi,
actually?
can you please expand on why it's not his community?
My
I would love
understanding
to.
is he came in from an entirely different place, which is something that Antifa gets
Okay,
targeted
do you
for
know
all
where?
the
Okay,
time.
hold on, no, fuck this. We've been waiting for this all night. Do you know where Antioch, Illinois is?
Oh, no.
1 hour from the border of
No, it's 15 minutes. Do you know where Kenosha is? 15 minutes away. Do you know where Kyle Rittenhouse worked?
Did he work there?
He worked in Kenosha, Wisconsin.
His
He
dad
drove there
lived-
every fucking day.
Okay, okay,
Can I
that's
add
fair. I'll
some family
concede that.
Okay.
They want a result. They don't want the correct result, and
All right.
that's basically my,
So I have a lot to say on that. Wait, hold on. I have a lot to say on that because, I mean, so I'm going to begin by saying I don't like the way that the prosecution has been conducting a lot of their case, but also I don't think that the way that they're acting is atypical for how a lot of other prosecutors would act in similar circumstances. This is a situation where the prosecution has bad facts and bad case law. Now, I think that there's a really good criticism of the prosecutor with the Fifth Amendment issue when he commented on his silence. That is inexcusable. The other issue when they were talking about propensity evidence, right? So the comment that Rittenhouse made about like, oh yeah, I wish I would have my rifle so I could be able to shoot at other people. The circumstances where where the prosecutor tried to reintroduce that comment makes it seem like he actually tried to do what the judge wanted them to do, which is usually in those circumstances, or if it's more prejudicial and probative, you have to be able to establish more evidence to be able to demonstrate that it is in fact relevant or more probative than it is prejudicial, or substantially more probative than it's prejudicial, because all relevant evidence is going to be prejudicial in some effect. But in that case, it seems like the prosecutor probably tried to do the best that they could, but they just are dealt bad facts. I wouldn't say that this is an example of prosecutors trying to like act maliciously or whatever. It's just that they're doing the best that they can with bad evidence. You can say that they're not doing a good job, but to make them out to be evil, I think is misleading.
Why doesn't Riley try to do more on Twitch with like politics? I don't understand why this person was allowed to just play fucking EverQuest or whatever the fuck she plays. I feel like she should have a louder voice to her or whatever, because she seems like a pretty reasonable I think we've disagreed in the past, but she seems like a really reasonable person. I wish that she would have like a ESO, whatever the fuck. I wish it, because of all the demon mama shit and everything, fucked her so hard. I wish she would be, I really like the way that she structures and forms arguments. It just is refreshing to hear. But
can I respond to that? Because I think this is kind of my frustration with it. So, like, should prosecutors be able to throw shit at the wall even if they kind of know it's bad? Should they be able to prejudice a jury as long as...
Okay, I need to know how long this argument goes, because I can't listen to this get hashed out again. I can't do this. I can't listen to this again.
Because they think that they can get away with it without getting slammed too hard. And on top of that, this is kind of my question. I didn't get a direct answer yesterday. You were saying that it's like, oh, it's inexcusable for him to do that. Is this something that, like, I don't know, like fucking first-year law students fucking know? Like, do you think that it was intentional, or was it just a mistake by somebody who has a shitty job? Like, that was kind of my frustration with it.
The Fifth Amendment issue is definitely, so that's something that you're normally going to be taught in like evidence. It's not going to be first year, but it's going to be like second or third year. Usually, so like that is a pretty egregious issue, and I think that is warranted of criticism. But with the other issue, with like the propensity, like the comment about the rifle, right? That seems like an example more where it's like they tried to make it relevant. They tried to do what the judge asked, and the judge didn't buy what they said. I don't hold that as much against the prosecutor, because they essentially were trying. You can make an argument that they were trying to give the judge what they wanted. They just didn't do a good enough job. But I wouldn't fault the attorney for trying to do that if that's arguably going to be one of the best pieces of evidence they could get into the case, to be able to prove their kind of theory that Kyle is like this. They're trying to like make it into like, oh, Kyle was this evil, scheming person beforehand. That would be a really good comment to be able to get in to support their theory.
I have a question really quickly for the eggheads on this panel, the legal nerds. What do we say about the claims that the judge has been a little bit sussy? How do you feel about those claims?
I feel like the judge so like I said it
I like that Bosch realizes he's on a panel where people know their shit a little bit more, so he has to be like very careful. He has to couch all of his language incredibly carefully. And rather than frame it as he would on a stream, now it's like, well, how do you feel about this thing that I've said is an absolute fact prior to this? Yeah.
Earlier, I feel like the judge has been a little bit sussy. Usually, whenever you ask for things like a mistrial, or you have issues where you think that the judge is being impartial, usually the question is like, because every judge is probably going to be biased, at least to some degree, right? Like, this is just kind of like a matter of the fact for dealing with the legal system. We're all humans. we try to make the system to account for human error. So what probably will happen is that there will be like appeals after the case is decided, and there's going to be like some arguments that based on some things like the judge having everyone clap for the expert, for example. Like it's a little sussy. But I don't think it rises to the level of being able to throw out like all of his rulings, because a lot of them have seemed at least reasonable.
Do you think that, because I did see that whole, like, do we have any veterans in the room? Oh, hey, it's the defense's next witness. Can we all give her a... I did see that. That did seem really weird. I don't know if that would be enough to declare a mistrial, but do you think the...
What? So why would you think
that any...
Why? No, I don't think that would have been enough to throw out the entire fucking... Like, wow, thanks for the expert analysis, Chief.
Things rigged.
You called for a clap of a veteran on Veterans Day now. I don't think this quite rises to the level of mistrial yet, you know? I don't think he should be executed. Like, okay, thanks, Captain. The longest fucking presiding judge in all of fucking Kenosha. In all of Wisconsin, maybe? Like, Jesus, but okay.
I don't either. But do you think that there's a good pretense, a good excuse to, at the very least, say that behavior ought to be changed? Is there... What can we do about this alleged sussiness?
I don't know. It's hard because like usually in a lot of cases where if you have judges who are like this, as an attorney, it's probably in your best interest to just try and like go with what the judge wants to the best of your ability, because ultimately like the judge has a lot of power in these kind of circumstances, right? And it's not like you can make the judge like change their mind, and you can't really like give a judge an order to not be as biased, because like if you try, I don't even know what you would try to do that. But
no, you could try. I don't know if it'd work, but you know, you could try.
But it would make the judge probably like royally pissed off at you, and you never want to piss off the judge. So you can fault like the prosecution for royally pissing off the judge, because that's the last thing that you want to do.
One second, Connor. One second. I want to throw it over to Hake. You tried to speak earlier, and I saw it was stopped. I want to make sure he gets a chance to speak. Hake?
Thank you. What can we do about the fact that, I think Lecture Fan said it first, these people, Kyle should never have even been charged with at least most of this stuff, especially the most serious of the crimes, in the first place. But the only reason he was charged, seemingly,
don't say politics. Don't say politics.
Was because of the lynch mob in the media and on Twitter and elsewhere, and the.
I mean, like, what does Pisco think of this? I feel like it's impossible to truly say that the entirety of our judicial system is going to exist completely and totally independent of public pressure. Like, if there is public outcry over a certain thing, it wouldn't surprise me if there was some influence on the prosecution or the DA to bring charges to or against a certain thing. It wouldn't surprise me if that was the case, you know? And I don't even know if that should necessarily be wrong, right? Like, because ultimately you have your judges are elected, your your DAs, all these people can come from elections or from the mayor. These systems are ideally supposed to be enacting the will of the people. Now, does this mean that the DA should go around charging parents fighting against CRT or blah, blah, blah? Obviously not. Of course not. But if you have a case that maybe could go one way or another, and the Rittenhouse case certainly could, I don't think it's horrible to say, like, there was public outcry, so they decided to bring charges. I mean, like, the judicial system is a function of, public application of our moral code, of our law. I mean, like, I don't think that's the worst thing. I don't know if that should necessarily change, or if it has to change, or if it even should change,
The local government that failed to protect their city. It seems like it reminds me of George Zimmerman. Aren't you supposed to only make a charge against a person if you think that you can win without a reasonable doubt?
Sure, but that doesn't mean you know you can win, right? Charges are not rubber stamps, okay? Just because you charge somebody with something doesn't mean that you're always going to get a guilty verdict or whatever verdict you're seeking, right? Like, shit happens, right? Sometimes, and maybe people do fuck up sometimes as well, sure.
But they're, like, ridiculously overcharging these people when the facts are quite clear.
No, I think
No, you can charge... It's not when beyond a reasonable doubt. That's the standard for the ruling.
No, it's purely up to the DA.
I don't know how it works, and I don't know how,
it's up to the DA.
I mean, I don't know, like, I don't know how you guys do it over there.
You
but,
go to
like,
500 different counties. It's going to give you 500 different results on how they would pursue these charges.
I don't think it's at all atypical for for Rittenhouse to receive the charges that he has, you know? Like, part of the legal process is determining innocence as well. If anything, we would be happy that Rittenhouse, even people on the left, the right, everyone, we should be happy that Rittenhouse is getting these charges and a trial following, because the alternative would be essentially lawlessness. You can't claim to be law and order while also throwing out the mechanism by which we determine whether or not a person has actually violated the law, right? If he ends up getting exonerated of these charges, then that's something you should be celebrating. You shouldn't be angry that he was tested to begin with.
Wait, one second. Riley wanted to say something. I'm gonna write lecture fan down. Riley Loner, and I'll write lecture fan down.
Yeah, I just want to say that, like, very quickly. All right, so I'm going to make some background appeal because I used to work in the Attorney General Office of Maryland for their organized crime division, so I have experience with like some degree of like charging. In this kind of case, what we're dealing with, so like it's important to recognize that self-defense is a justification defense. Usually when it's brought up by defense attorneys, it's brought up when you already acknowledge or where you're already basically agreeing
You've done
that
something
a lot
kind
of
of
the
wrong.
material elements of the charges that are being made are already basically met, right?
Yeah.
It would be really, really weird to not at least bring the charges against Rittenhouse when it's very clear that, like, I don't know, so like if there's like manslaughter, right? So common law manslaughter is like unlawful killing of another, and then mens rea is going to vary, right? We already basically know that those elements are absolutely met, right? So it would be really weird to not put that in front of a trial when we already know that there is a dead body. Isn't that multiple? There's a dead body. Kyle did it, and now the matter is just like, did he do it with the requisite mens rea? And also, did he?
To be ultra clear in this though, there absolutely are cases, depending on the circumstances, where you can kill somebody. It can be self-defense, and it can be so obvious that you're never even actually charged. Like, this does happen, for instance, depending on the number. Like, it's going to depend, obviously, on a lot of things. But self-defense, just because you're saying it's self-defense and just because someone's killed doesn't mean you're always going to be going to trial for it. But you should always be prepared to, right? It's something like, if you kill somebody, that's a big deal.
Do you have a justification for doing it? So it would be really, really weird to not at least bring this to trial.
Even though no sane person would convict him.
Then you should be fine. Then you shouldn't get convicted.
You guys do it over there, right? But like over here, if there's a self-defense case, even if it's like fairly clear cut, like if someone dies, it should probably go to trial, like just to, you know, like so the criminal justice system can like confirm that on paper, especially since you're going off camera footage. Like I think it's fairly normal.
There was a question. If a person's going to be convicted?
Wait, there was a question to Riley. I just want to make sure she can respond to that.
Yeah, what was the question?
Oh, I said even though no sane person would convict this young man.
I wouldn't say that. I think that a reasonable person could come to the conclusion that he. So one of the elements of self-defense, we didn't go over all of them. We can go over all of them if you want to. But one of the elements in common law self-defense is that you. It's also required that you did not create the circumstances where you needed to use deadly force in order to be able to defend yourself. So there's a reasonable argument that could be made that he ended up contributing to creating the circumstances that led to him having to use the deadly force. Now, I'm not saying that like any reasonable person is going to come to that conclusion, but I think that a reasonable jury could.
Also, the point of a trial is to find out the evidence of the case, right? You can't really say whether a person would be convicted before the trial has happened, because that's when the arguments are made for whether or not they should be convicted.
Good job, watching those Destiny streams.
We have grand juries and shit to figure out whether or not stuff is like worthy enough of going to trial. And then on top of that, yeah, like with this situation in particular, like there is.
Wait, hold on, Pisco. He keeps mentioning grand jury. Is a grand jury convened every single time you're deciding whether or not to bring charges to somebody? Because he's brought up grand juries a ton. Is that always the case? I don't know why because I know that sometimes you'll assemble a grand jury to see if you want to bring charges, but that isn't always the case, right? No for federal or yes for felonies. Usually felonies go to grand jury, not misdemeanors. It's entirely dependent on the jurisdiction. Some states have. Was there a grand jury involved in the Rittenhouse case? Let's see.
You're a fucking statistician.
Rittenhouse grand jury. Does anybody know? I don't see anything saying this, so it seems like that's not the case. But okay, sorry.
evidence that like Kyle might have had a different mindset. I think we've all seen the CVS footage where he was talking about like, oh, I wish I had.
This is actually unreal. I'm sorry. Hold on one second. This is what watching D&D is like? Well, then fucking sub, you fucking loser. Okay.
Do not like quiet down when I start talking, or
I lost my spot.
Liberally.
Where was I? Does anybody remember?
Times were clear, cut and clear.
Second, Riley.
I just wanted to correct the record on Proud Boys. They're generally honorable. In fact, by and large, honorable men.
Oh God.
I had my gun because it looks like there's a guy that's armed right there while they're riding.
Okay.
Should be convicted.
That's
No,
not
hold
totally
on.
True though, because we have grand juries and shit to figure out whether or not stuff is like worthy enough of going to trial. And then on top of that, yeah, like with this situation in particular, like there is evidence that like Kyle might have had a different mindset. I think we've all seen the CVS footage where he was talking about like, oh, I wish I had my gun because it looks like there's a guy that's armed right there while they're looting the store. While I think that's excusable, a bunch of leftists don't think that it's excusable. They think that that's like, you know, nefarious moral behavior to see people like robbing a store with guns and be like, oh, I wish I could do something about that. But, you know, that could go to the mindset of whether or not he wanted to cause the situation that resulted in other people's deaths. There's
Right,
still
but we
room to be argued.
We can all
After
agree
Vosh,
that,
you're going to lecture fan, by the way.
that court proceedings are a necessary component in finding out whether or not it would be worth it to convict somebody, right? I mean, we don't have all the info. We didn't have all the info.
That's not always the case. The DA can make that decision beforehand based on the available evidence or other things. Right?
After Rittenhouse actually went ahead and killed those folk. We have more info now. That's the point of these trials. It contextualizes things. It adds information. If we don't have these trials, what do we defer entirely to the court of public opinion, where whichever Twitter video goes most viral is the one that'll determine the rest of Rittenhouse's life, you know?
Ironic for Vosh to say this.
We need to be able to defer to some kind of systematized process. The courts are not perfect, but they're sure as hell better than going like, I don't think I'd convict Rittenhouse, so no charges. Like, you know?
Yeah. I mean, that is exactly kind of what that's what the district attorney decides, right? Is like, you look at the available evidence and you have to make that judgment call. Do we think we have enough to build a case? Is this something to go to trial? Do we even have to go for a plea? Right? Like this is a totally a judgment call. It is almost exactly that, right? Like, you know, do we have enough? It doesn't look like it. Yeah, you know, fuck it. We're not going to trial with this one, right? Like that's exactly, like DAs have to make these calls all the time. Or I mean, it's part of what they do. Yeah.
No, okay, no, Vosh and Lonerbox are wrong. Brandt is correct. When Brandt said you could get 500 different counties and 500 different decisions, that's absolutely correct. It's called prosecutorial discretion. It's a very, very important thing in criminal prosecutions. Is the prosecutor's discretion. That's why prosecutors are elected. In Montana and a lot of other states, county attorneys, they're elected officials. The attorney general is elected. At the federal level, the United States attorneys are appointed by the president. These are political positions because they have a ton of discretion, and so it's called prosecutorial discretion for an absolute reason. And I find it very rich to hear leftists. I find it very rich to hear leftists who are the first to always criticize our criminal justice system as being sort of rigged against the criminal defendant. And you always hear leftists talking about how, oh, the prosecutors and the judge, they're always going to lunch together, they work together all the time, and the whole system is rigged against the criminal defendant, and they're forced into plea deals all the time because it's so expensive and so risky to go to trial, and blah, 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 blah. But when it fits our political narrative, now we're going to say, oh, a criminal trial is to find out if they should even be prosecuted. No, it's not. You shouldn't be charging people. That a prosecutor shouldn't be exercising his his prosecutorial discretion to pursuing charges like this and literally potentially ruining somebody's life just by going through the trial, when that discretion clearly should have been exercised to not charge him at all.
Wait, well, I'm pretty sure. Hold on, wait. A protest where a person open carrying ends up killing 2 people. This is a circumstance where you would see charges brought in almost any circumstance. I have never heard of any case that was that lethal.
God damn it. Vosh is choosing good debate upon. Vosh is going to end up sounding completely reasonable here because of how fucking unhinged lecture fan is.
That was that ambiguous, not be given some
It happens all the time. It happens all the time. It's just not put out as a national story because the Democrats don't want to use it to push their narrative.
Do you have evidence that there's some kind of bias with regards to Rittenhouse, and the only reason charges were brought was because of some kind of lefty?
Yeah, look at how the prosecution's been acting. And you see, I mean,
Wait, I'm sorry. Wait, hold on.
This is happening up and down the justice system. You see this happening all across the justice system. It's not just this one incident.
That didn't answer my question. You can't just say, well, look at how they're acting. Like, I'm pretty sure that with what happened with Rittenhouse, charges were pretty reasonable, you know? If he gets exonerated of some of them, that's good. But it seems like there are some he isn't even going to be, right? Aren't there some things he did, like the crossing the borders, the illegal possession, or possibly reckless endangerment, that there's a decent shot at them getting convicted for? Maybe some more than others? If that's the case, not only were charges warranted, they might end up even being found guilty. How can you say that he shouldn't have gotten any charges at all? Also, you realize that if he'd never gotten any charges, lefties would have thrown a fit, right? If you think BLM burned down cities, oh my God! After Rittenhouse, if he hadn't even gotten charges,
that's exactly. Yeah. So now you're trying to use like this threat of burning down cities to try to get the prosecutor to charge, and then you're saying, oh no, there's no evidence.
Wait.
I'm saying that there was a legal reason too.
Okay. We're going to have Vosh respond, but I'm going to throw it to Lumi because Lumi hasn't been able to talk really since the opening. So we're going to have Vosh then Lumi.
Yeah, so there's there's a legal reason too, as I explained, because it seems like some of the charges might be even found guilty. And even then, I think that the charges for which he is exonerated are socially valuable. For 2, it's valuable because exoneration from charges is a important social process, you know? People can't magically decide whether or not charges are going to be exonerated or found guilty on beforehand. You need a process.
Socially, it won't matter. If Rittenhouse gets off, all the lefties are still going to say he's a white nationalist murderer that showed up and killed 2 brave BLM super soldiers or whatever. That's the narrative. Lefties are never going to change that, even if he is exonerated completely.
Civically, yeah. I do think that high publicity cases should go to trial. Like, all the time. How else are we as a society supposed to arrive at any opinions on the matter outside of the court of public opinion? It's socially valuable. In fact, I'm pretty sure one of the biggest benefits of the right to trial by jury, the system we have of due process, is that it gives everyone a sense of fairness, at least more so than the alternative, when big events like this take place. I mean, this is like a slam dunk. The trial should have happened. And
okay, so everything the left has been saying about the criminal justice system and the problems with our criminal justice system, that's all wrong. Okay.
Do you think you can maybe just address us instead of like the imaginary leftists? I mean, like, you can make like a conservative civic case about this. Like, you want to go with responsible gun ownership. Well, if you're a gun carrier, maybe it's good to know that if you kill another citizen, then you should probably have to make your case to the state. I think that's a good precedent to set because it encourages responsible gun ownership. So, but as far as I know, like I looked at this a little bit, but as far as I know, it's fairly normal for this to happen.
Lumi?
I just got frustrated because it sounds like Lecture Fan is so determined to make generalizations of the left and not hear what Bosch was saying. So it's popping in to say, no, you're completely misinterpreting what he's saying, but I should have just let Bosch do it. He had it.
Okay.
Oh, thank you. I appreciate that, Lumi.
We're all friends.
To interject on their conversation.
1 second.
That was fine.
1 second, Brant. Connor wanted to go earlier, and I stopped him, so I'll go Connor, then you, if that's okay. Cool. Connor?
Yeah, so, no, it's... I get it. We're all being sober adults. I super appreciate it, actually. I was expecting this to be a fucking shit-fligging fest. We can probably get into that pretty soon.
Law and order.
But
wait until we get into
yeah, so the court, the actual court and a public trial is to give us an alternative to the court of public opinion. All right, I think this is completely accurate, but I'm gonna pull a fucking Lecture Fan and I'm gonna go, the left has been, tried in the court of public opinion for a fucking year with evidence that has been publicly available for the better part of a year. And even in this panel, we're still using terms like fucking white supremacist fucking militia in order to describe the incidents that fucking unfolded. So that this is where the left is, you know, capitalizing on a narrative that isn't substantiated by evidence that we've had for like a super long time, and then using it as fucking jet fuel to continue with like fucking protests and riots. And like that.
Who said white supremacist militia? Here.
Lumi during
Okay, I did, and the reason is so my point.
Uh-oh.
Am I
Also,
echoing?
I'm on
someone?
Twitter. I'm on Twitter too.
Yeah, you're
so
echoing a tiny bit. Yeah.
Don't say these people don't exist. We all know they exist.
Okay, but I do think it's good to address people on the panel, of course. But I did say this, and what I should have probably said is I do think that he is influenced by a lot of the narratives in what we have seen regarding white supremacy. So that's frustrating. I can't say that for sure, but I do think that the case of him being with the white supremacists in the bar, drinking, is something to be mindful of. When you have a 17-year-old around someone who is
After the incident?
Proud Boys, white supremacists, I think it's dangerous to ignore that reality and try to shut down that conversation, especially when that's right after. Wasn't that right after he got out on bail?
Yeah. So
is that not a concern?
No,
Why
no,
do we have to shut down that conversation?
Yeah. Can I address this directly? Because we're jumping between like multiple definitions of white supremacy. If you want to talk about like a highfalutin academic, like you know, white people have set systems up and systemic racism and capitalism and all that kind of shit, you could say that about the fucking Proud Boys. But if you're talking about like ethnonat, Richard Spencer, Roman saluting fucking people, then the fuck yeah, or even Fuentes. I don't even think the Proud Boys are Christian nationalists. Then they're like, you know, we're talking about different categories of right wing, different categories of what some people define as white supremacy. And when you say white supremacist, like nobody in the conservative or libertarian movement is thinking like, oh, in an academic sense, they contribute to systemic racism. They're thinking fucking Klan hoods. That's what they're thinking. And then on top of that, normies are thinking that shit too. And that's part of the reason why discourse is so fucking poisoned around these conversations, is because we can't be nuanced. I literally just got called a fascist today. And it's like you don't know what the fuck the word means. Like, all right, anyways, not you, the ambivalent you.
And I think the left has a similar frustration that we all just get grouped. But I would say, you know, that's why I have my streams where I do break it down in academic terms and say, this is why, this is what we're talking about, and this is the specifics of it. But I understand not everyone does that.
Next is going to be Brant. Brant wanted to talk earlier.
Yeah, I have 2 points to make here. We kind of sped past it. Lecture Fan was talking about, I'd brought up 500 different DAs with 500 different elected judges. Gives you 500 different scenarios of how this ends, right? Then you mix in the whole fact that...
All right.
If you're...
Listen, guys. This is a heated panel, all right? And I'm sure that tomorrow we're going to have so much fun going over it, okay? But holy fuck. This is boring and I'm fucking tired, okay? Blame all the social workers that came on earlier, okay? Fuck them. You can't stop August said so. Look, I'll leave this up right at this time, okay? Are you doing the shit with Cubot tomorrow? Oh, Melina's doing that. Oh, fuck. I probably won't. I still have so much stuff I need to catch up on, and we're going out of town again in like 8 days. So, and I got a gym. So I'm probably not. I'm going to be here with you guys. Okay. Fuck women. Okay. I'm going to stay here and we're going to do politics. It's going to be awesome. Okay. Okay. We'll finish going over tomorrow, okay? I love you guys. It's been fun. Let's see. Cubot's streaming. Yeah, fuck it, I'll host her. Alright, good luck, guys. Have fun. Rip one.
I don't remember you doing
yeah.
confetti.
Confetti. Yeah, we did get confetti. I just forgot. Oops.
These outfits, dude.
Okay.
Jesus.
Thank you.
Ribberino, cappuccino, 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 my Doritos. I will catch you guys
Hey, thank you, Pull Out King.
whenever I wake up
For 6 subs.
tomorrow and get home from the gym. Rip on, dude.
Thank you. 6 subs. 6-9.